Supervisor Elliott, I just want to confirm that you can hear us in board chambers.
Can hear.
Supervisor Elliott, I just want to confirm that you can hear us in board chambers.
Yes, I can hear you. Can hear.
Thank you, Supervisor.
Supervisor Elliott, I just want to confirm that you can hear us in board chambers.
I'll feel this. Testing 1, 2, 3.
Good morning, everybody. I think we have our technology issues sorted through. I'm now calling the meeting to order at 9:05. We will now have a moment of silence, silent reflection, or silent prayer. Thank you. Supervisor Villapudua, would you lead us in the pledge this morning? Thank you. For the record, this is the regular meeting of the San Joaquin County Board of Supervisors. I have to look up the date of Tuesday, December 8th, 2020. Would the clerk please take the roll?
Supervisor Villapudua.
Present.
Supervisor Patty. Supervisor Patty. Supervisor Wynn.
Here.
Supervisor Elliott.
Here on the phone.
Thank you. Supervisor Patty, are you able to hear me? Supervisor Patty? I'm sorry, Madam Chair. I know that he is connected, so we'll just wait a moment. Make sure that he can hear us in board chambers before we continue.
Okay, great. Do we have the capacity to communicate with him via text or email?
Yes, I can to troubleshoot with him, but we would not be able to participate in the meeting.
Okay. Okay, then while we sort things out with Supervisor Patty, we will announce later when he is able to communicate with us. He is on the phone. We're going to move to public comments. Now is the time for public comments on matters within the jurisdiction of the Board of Supervisors that are not listed on the agenda and any matters listed on the consent agenda. We are having public comments submitted via email. We request that they be limited to 250 words or less and may be sent to SJC Public Comments, all strung together, at sjgov.gov.org. So I would now ask the clerk if we've received any public comment, and if so, to please read them.
Good morning, Madam Chair. We do have about half a dozen public comments this morning that I'll read. The first is from Alexis Jones, who writes, "Good morning. I currently work from home 20 hours a week If I lose the ability to work from home, it would negatively affect my family. My children's school is not opening until at least April. I cannot afford daycare for all 6 of my children on my salary. I am also concerned about contracting COVID. If everyone returns to work, there's a greater chance of contracting and spreading COVID. I am in the high-risk category and I have an infant child. I need to be able to keep myself and my family safe. Please allow us to continue to work from home. Thank you for your time and consideration. The next comment is anonymous and writes, why is San Joaquin County, as an employer, not adhering to the recommendations that all office jobs, whenever possible, should be able to telecommute 100% per the governor? In the beginning of my department, worked 1 day in office to check in, submit work, and obtain resources. Why would that stop? Our COVID numbers have not decreased. Also, we at least need our current partial telecommuting schedule extended. Sitting in limbo, not knowing how long our schedules will last, is unacceptable for working parents. Take some stress off of your employees and let us set an example that we can proudly serve our community from the comfort of our home. In order to stop the spread and be home to protect our children while they do their distance learning. San Joaquin County should be as flexible as an employer as your employees always have to be. If employees get sick or have to take a leave of absence due to their children not being in school, we are hurting our community. Employees are willing to work. We just need the BOS to work with us. The next comment is from Debbie Alter, who writes, please act immediately to implement a temporary full work from home policy where available. Monica Nino back in March stated to department heads that, quote, working from home should be an option when available, end quote. At the department where I work, Children and Youth Services at BHS, we are currently on a 2-day work at home for 1 week and 3-day work at home the next. This is not sufficient now that we are seeing a great spike in COVID cases. As my one-room cubicle-only office, there are numerous staff out due to exposure, one severely ill in the hospital and others who are ill awaiting test results. The county has spent a lot of money to create the infrastructure and policy for work at home, yet some departments are not fully utilizing it. Why? Yes, it is not fair to all staff as some cannot work from home. However, those who can should to help decrease the spread for all. Less staff in the office equals less exposure. Thank you. The next comment is anonymous and writes, I would like to know if teleworking for county employees will be extended past 12/31. With the surge in cases, it is very scary to even come into the office at all. The department I work in has had 7 new cases in the past week alone. The next comment is from a concerned employee who writes, I urge you to please not only encourage but demand that all county departments with the capability to telecommute 100% of the time while in the county is forced into the stay-at-home order. Employers across the state that have office positions capable to telecommuting full-time have already taken steps to ensure that employees and their families can safely work from home full-time during this pandemic. But San Joaquin County has seriously dropped the ball in this area. Limiting telecommuting days to 2 days a week still exposes employees, their families, and not to mention clients, which is definitely a contributing factor as to why SJC has moved back in the purple tier. San Joaquin County has taken steps to attempt to make offices secure. However, staff still continue to get sick, and medical experts would confirm that the virus can be shed in public restrooms, which are only cleaned once a day in most offices like HSA. Staff have to take leave for testing every time they are exposed, and that interferes with workloads. Schools are also still not open, and many daycares have been closed either due to the new order or due to recent outbreaks of COVID. Your county is failing with the pandemic, and perhaps you should make some serious changes and take note of what other large counties with significantly smaller rates of infection are doing differently than us. Please enforce full-time telecommuting, at least for the duration of the stay-at-home order. The next comment is submitted by Sean Hayes, who writes, Dear Honorable County Supervisors, I have watched our local merchant business owners, landowners, suffer under this California draconian martial law that is trying to be imposed upon us. It comes to the great San Joaquin County Supervisors residents to rise up and use sound medical research to reopen up our great country for commerce normalcy. Please review the attachment set separately that a county district have used. And that document will be submitted with the board documents for this meeting. The next comment is from Chris Toll, who writes, "My name is Chris Toll, and my father and I own Down Under Sun and Spa, as well as a couple of other businesses in Tracy for the last 21 years. Down Under Sun and Spa is a 2,500 square foot, 20-room facility featuring several UV tanning levels, sunless airbrush tans, and spa wellness services such as red light therapy, infrared slimming pod, and automated zero-gravity massage. I have two concerns that need to be addressed. Due to the recent shutdown, what category do I fall in, and is our business supposed to be closed for the next 3 weeks? I just want to make sure we comply to close, or if we are allowed to remain open. I have called the county and city yesterday but could not receive an answer due to the unclarity of what category we are placed. My next concern is one that does not receive any attention to my knowledge. Businesses that were forced to close late March through June are being forced, harassed, and threatened with eviction to pay the rent when no money was generated to pay for this business cost during this time period, and now businesses face another round of this issue. There needs to be a mandate, law, county addendum, or something for businesses to not have to pay rents when forced to close, but the landlord corporations are demanding rents to be paid by instructing us to get a loan. My rent is $8,500 per month, multiplied by 3 months is $25,500 is what they are demanding. And those 3 months is what we call peak season in our industry, where all profits are generated. We were unprofitable all year. Thank you for your time consideration. I look forward to a positive solution. Chris Toll." The next comment is by Megan Escudero, a welfare fraud specialist, who writes, "I would like to ask that the following items be considered for discussion and answers given. Mask with valves. Some are wearing these, but the valve can release the virus rather than protect others from it. Require the wearing of masks all the time. This could help businesses to be able to stay open if everyone would just comply. It's about keeping the economy going as much as possible. Shut the Human Services Agency to the public. This is really no good reason for clients to be coming into the building. It puts our highly dedicated reception application unit staff at great risk of contracting the virus. Other counties shut their doors to the public. There's no reason why we shouldn't do that as well. Social Security and EDD shut their doors to the public in our first lockdown. If absolutely necessary, an appointment can be made to be seen. All county offices that have the ability to telecommute should be allowed to do so for more than 2 days per week. If telecommuting is working, it should be used as much as possible as long as the work is getting done. Thank you for your consideration." The next comment is also anonymous and writes, "Why is San Joaquin County as an employer not adhering to the recommendations that all office jobs wherever possible should be able to telecommute 100% per the governor?" I apologize. I believe this may be a duplicate. It does appear to be a duplicate, so Madam Chair, I'm going to skip that comment. The next comment is also anonymous and writes, "If Tom Petty is free to spread his virus around the county he is responsible for, I should be free to stay home and avoid him. This is why the county that this BOS manages is one of the worst in the world, because golfing is more important than human lives. We should never have been sent back to the office when teleworking is so readily available. Please do the responsible thing and make teleworking 100% mandated until we have access to a vaccine. Thank you." And Madam Chair, the next comments that I have are for the public hearing and discussion items later on the agenda.
Okay, thank you. Next up, we have minutes. And we have 2 regular meetings to approve, November 3rd and November 17th. If there are no changes or additions proposed by the board, then I would entertain a motion to approve.
So moved.
I make a motion to approve.
Supervisor Patty, you're there. Awesome. Welcome. That motion is made by Supervisor Patty and seconded by Supervisor Wynn. Have a motion and a second. Please cast your votes. We're going to have to do roll call today for all of our votes because we have 2 supervisors participating.
Supervisor Villapudua?
Yes.
Supervisor Patty? Supervisor Patty?
Yes.
Supervisor Nguyen?
Yes.
Supervisor Elliott?
I will abstain from the number 2 minutes since I wasn't there for that meeting, but yes on number 1.
And Chair Miller?
Yes. Okay, so the first set of minutes was approved 5-0. The second 4-0 with Supervisor Elliott abstaining. Next up, we have appointments to boards and commissions. We're going to see if Supervisor Patty has that information, and if he does, if he would make his recommendations in the form of a motion.
Yes, Madam Chair, and hopefully you're able to hear me without any interruption. Kind of a test so far. Are you able to hear me?
Yes, we can hear you just fine. Thank you.
Excellent. Thank you. So, Madam Chair, I do have the following 7 recommendations. Appointment of 3 positions to the Advisory Water Commission. 1 South Delta Water Agency alternate, position number 1015A, that's Dean Ruiz. 1 South San Joaquin Irrigation District alternate, position number 1016A, that's Mike Weston. 1 Urban Flood Control Reclamation District representative, position number 1018.1. I'm going to ask that clerk of the board re-advertise. I have an appointment of a position to the Community Action Board, 1 3rd District representative, position number 2403, Paul Singh, incumbent. Appointment of 1 position to the Council for Quality Education and Care of Children, 1 Child Care Provider Representative, position number 2501.2, Gloria Barbero. I have an appointment of a position to the Equal Employment Opportunity Advisory Committee, 1 at-large representative, position number 2701.1. I will ask that the clerk re-advertise. And lastly, I have an appointment to 1 position at the Lodi Community Center Advisory Board, 1 at-large representative, position number 4501.1, Kathy Piazza. Madam Chair, that is all, and I make it in a motion to approve these recommendations.
Thank you. Supervisor Nguyen will second that. Could we have a roll call vote, please?
Supervisor Villapudua?
Yes.
Supervisor Patty?
Yes.
Supervisor Nguyen?
Yes.
Supervisor Elliott?
Yes.
And Supervisor Miller?
Yes. So that is approved 5-0, those appointments, and we will re-advertise as recommended. Next up is our COVID briefing, regular update from our staff. I believe we are going to have Dr. Park via telephone this morning, and so we're going to ask her to kick it off, please.
Thank you, Chair Miller. Hope you can hear me.
Yes, we can. Thank you.
Great. Thank you. So I see that my slides are up. Next slide, please. So this is the EPI curve that is available on our website, which shows the total number of confirmed COVID cases to date. We're sitting at about 28,000 confirmed COVID cases to date and 530 deaths. That number, 28,000, is an undercount at this point in time, as we know that statewide numbers are surging and many confirmed cases are still sitting in what is called the DISA, or the Disease Incident Staging Area. And because of this, the state is considering today moving to an auto-processing format where all of the confirmed positives will be uploaded automatically instead of requiring county staff to be processing these. As you can see, our surge back in the summertime went as high as having sometimes over 500 cases on the highest day in one day. And if you look now to the right of the curve where we are now in December, we are again experiencing some days where we're almost at 500 cases confirmed on one day. You will see that there's two particular spikes that almost reached 500. That first spike a little over a week ago was really the Monday before Thanksgiving, and we looked at it and confirmed that it really was that high. And we believe that people were getting tested at very high amounts in order to prepare for traveling for Thanksgiving or in expectation of seeing family and friends for Thanksgiving. You'll see the dip right around Thanksgiving time where there weren't many tests done because testing stations were closed, and I believe people were mostly staying, at home or going to gatherings and not getting tested. And then you'll see again that second spike, which starts to show what was expected is that we would have some increased cases after the holiday, after Thanksgiving. And I believe that some Thanksgiving numbers are still going to be coming in. And to the very right, the bar looks low, but as usual, as I always say, it's an undercount at this point as we backfill. So looking at the very latest bar is not going to be very accurate because we know that that bar will increase. So next slide, please. So this is really our number of cases that are, as our EPIs put out on a weekly basis. And let me see if I can bring it up on my own computer because I can hardly see it looking at your board chambers. And so this is the weekly cases by age group. And again, you'll see that much like the rest of the state, when you see that the state says that the age group 18 to 49 is the highest contributor, we kind of break it down 18 to 24, 25 to 34, 35 to 44. But those three age groups have the highest case rates right now for the past week. And next slide. This is our weekly rate by city. So again, this is not how many cases in each city, but how many cases per 100,000 population for that city. And interesting that blue line is Escalon. So the other cities seem to be quite neck and neck with their rates, but this past week we seem to be having a surge in Escalon more so than the other cities. Next slide. So I'll move right into this new regional stay-at-home order. Which I'm sure people are aware has been imposed on us as a region. And the state has explained that this is due to an alarming surge in rates across the county and across the state, of COVID-19. This regional stay-home order was announced on December 3rd, and it adds restrictions in regions that have less than 15% ICU bed capacity. It prohibits gatherings of any size, so we are now at 0 gatherings again. We are no longer allowed to have gatherings of 3 households. It closes operations except for critical infrastructure and retail, and it requires 100% masking and physical distancing. So when this stay-home order was announced on December 3rd, this is what the website looked like, and it showed that as a region, we are in the San Joaquin Valley region, we had an ICU capacity of 19.7. That means we had 19.7% of our ICU beds remaining and available out of all ICU beds in the region. And you'll see that our region is defined as these counties here: Calaveras, Fresno, Kern, Kings, Madera, Mariposa, Merced, San Benito, San Joaquin, Stanislaus, Tulare, and Tuolumne. So the reason why we go by regions is because as our hospitals fill up, we rely on our neighboring counties to offset some of our surge. We transfer patients to some of our neighboring hospitals. And so if the region as a whole is at less than 15% remaining ICU bed capacity, we're in trouble because we can no longer share the load because we're all burdened. Interestingly, these 9 counties make up the San Joaquin Valley Public Health Consortium, a group of health officers and health directors who meet regularly. And throughout the pandemic, this group has met twice a week. And so I'm very familiar with my partners and colleagues in those counties. And what we've done as a region is we've gotten our PIOs together, and they're working on messaging for the entire region. So they did come out with that initial press release, and they're working on more messaging together as a group. Next slide, please. So how do they calculate whether we've hit this 15% ICU capacity? There's really 2 components involved. Number one is, what is the baseline ICU capacity across the region? So let's say you have 100 ICU beds, staffable. These are staffed ICU beds, and you have 100 of them, and 80 of them are being utilized. That means you have a 20% ICU capacity. So they have used the staffed ICU bed numbers, meaning we know that maybe we could create more ICU beds and maybe we have more ICU beds, but the hospitals are required to submit numbers to the state that tell them how many are actually staffable with doctors and nurses and hospital crews. So that's the number they use. For this component, it is our non-surge ICU beds, and they've taken out any neonatal ICUs and pediatric ICU beds. The second component is the percent of adult ICU beds that are positive for COVID. So how many people in those ICU beds that are being utilized are there for COVID? Remembering that we need to save space for people who, for emergent needs and who cannot be foretold to have heart attacks and strokes, other needs, we need room for them. Perhaps we need room for people who are having major surgeries that can't be put on hold any longer, such as heart valve replacements. We need room for them in our ICUs, so therefore they have put this in as a component, and the state has said that if more than 30% of the adult patients in the ICU are there for COVID, then your baseline ICU number is reduced by 0.5% for every 1% over the 30% threshold. And they've shown us the math, and there's some calculations, and I won't go through the math with you here, but just to let you know that in this component, sorry, this should have been labeled component number 2. In this component number 2, the surge ICU beds are taken into consideration in the math here, meaning you are now overflow and you're using your surge, and the math includes those staffed surge beds. So next slide, please. So if you look at the bottom of this is all the fine language as to how this is explained by the state. But what I did was I went on to our snapshot tool, and you can find our region, San Joaquin Valley, because I was curious to know if we had indeed surpassed that 30% threshold. I know that we have here in our county, but I wasn't sure about the region. If you look at our region, it does say that we currently have 1,289 hospitalized patients with COVID across the region, and about 42% of those adult ICU patients are in the ICU for COVID. Largely mirrors our percentage. So with 42% across the region in hospital ICUs for COVID, my assumption is we passed the 30% threshold, and we did have that downgrade of 0.5% for every 1% over 30%. Okay, so hopefully this is making sense. Next slide, please. So this is what the COVID-19 website looks like now. If you look at the regional stay-at-home order, you will see our region. You'll see that the statewide metrics show that there is a statewide rate of 30.2 new COVID cases per day per 100,000. Statewide, there's a positivity rate of 6.4. And statewide, there's 14.2% ICU availability. So far, this regional stay-at-home order has affected 2 regions, San Joaquin Valley and Southern California. And our 2 regions make up about 70% of California's population. And as many of you know, the Bay Area imposed on themselves their own stay-home order, even though they didn't meet this 15% metric yet. So in reality, it's above 70% of our population. Really, the majority of the state of California is now to stay-home order. I have put together the numbers as they came out since the order was created on December 3rd, and you'll see that in the bar graph at the bottom. So when this was first announced on Thursday, December 3rd, as I said, our region had 19.7% ICU availability. We waited to see what that number would look like on Friday, and it was posted very late in the evening, and it seemed to precipitously fall. And this was explained to us that the 19.7, they had not excluded the pediatric ICUs, and we do have some in our region. They had already taken out the neonatal ICUs, but not the pediatric ICUs. So it took them some time to clean up the data and post Friday night, but by Friday, what posted showed that we had already met the trigger. I will explain to you that although we had met the trigger, if you look at the state health officer's order, her order, though it was written on the 3rd, said that it would take effect on the 5th. So on the 5th, we were below that trigger by even more at 8.6, and that is when we had to enter the order. When you are entering the order, which we did on the 5th, you have a day to enact, which is why with this data coming out in the middle of the day on Saturday, we were given until 11:59 p.m. Sunday to enact the order. Essentially, businesses were affected starting Monday morning. And you can see now that as of yesterday, our percent ICU capacity across the region is now dangerously low at 6.3%. And today at noon, this number will be adjusted, and I'll tell you that I'm hearing that it's going to be even lower than 6.3. It's going to be in the 5s. So we need to look out for that today, but it's not looking good for the region right now as we see it. Okay, next slide, please. Oh, I'm sorry. Can you go back to the previous slide if possible? I wanted to just point out the fact that there is if you go to the website and you see that little purple picture of the state and you click on See Counties, you will be able to see where each county is at, not just for our tier metrics, but our ICU capacity. And I'll show you ours just in a couple of slides. But for anyone who likes to look at the website, the covid19.ca.gov website, when you go to the regional stay-home order, you find this picture. If you click on that little purple picture, you will see each county. So now, next slide, please. Again, this is the data we receive from our EMS agency. They diligently get this data and collect it from our hospitals every day. And you can see to the right how I had said at our last meeting, I was hoping that this blue line would not keep going upwards towards the peak that we peaked at in summer, but it is. Unfortunately, that blue line now represents a total of 213 people in our hospitals for COVID as of yesterday, 51 of them who are in our ICUs. That's the red line. So our ICU bed capacity in our county is 116%. So in other words, we are past 100%. When I gave the example of 80 beds being used out of 100, and that would lead you to have 20% bed capacity, we are using more than 100, so we have 0 bed capacity. So when you compare us to the rest of the region, we are one of the counties that is actually contributing to the effect of our county. We're actually bringing to the region, we're bringing the rest of the region down, unfortunately. There are some counties in our San Joaquin Valley region that have more ICU bed capacity than us. And when you average it out, we're at that 6%, 5 percentile range here in our county. We're really at 0. And the percentage of ICU beds occupied by COVID patients in our county is 44%. I will let you know that our EMS agency is also tracking hospitalizations related to influenza, the flu, and so far there have been none. If you look at the peak back in the summertime, back on July 27th, that blue line, the highest we ever got was 262 people in the hospital, and that represented 127% of our ICU capacity being utilized. The real peak in ICU utilization was actually on July 31. We didn't have as many in the hospital. We had 225 in the hospital, but the ICU was being utilized at 149%. So our peak ICU use was 149% back on July 31. Next slide. So this is what you get when you click on that little purple map and you click on our county. You will see last week's data because this was coming out every Tuesday, and they were doing it more often than every Tuesday, but they haven't done it since last Tuesday. Today, this light blue box will be updated, and you will see the new numbers coming out. But as I said, if you click on that, you will see that even as of last week, our ICU availability was already 0%. We had about 109% ICU capacity at the time. As I said, today we're at 116. So if you click on the other counties in our region, you will see that a couple of other counties like Fresno and Madera are also at 0%, but our neighboring counties are not all at 0%, which is why as a region we're at that 6%. But we are contributing in a negative way to the region. These case rates that came out last week of 13.2 adjusted to 13.5 really were not in line with what we were seeing here on the ground. We knew that this was probably not correct. The week before, the case rates were in the 20s, and we knew we were really still in the 20s, but that there was so much catching up to do after the Thanksgiving holiday that our case rates were not being accurately reflected. And I'll show you what they really are now. So that is how we got into this stay-home order, this regional stay-at-home order. So hopefully that makes sense to all. And next slide, I will explain to you how we get out of this order. So the order remains in effect for a minimum of 3 weeks. So for the San Joaquin Valley region, as well as for Southern California, we were told that we are in it through December 28th, with the earliest possible release being the 28th. The order will end if the region's ICU capacity projected out 4 weeks later is equal to or above 15%. In other words, on December 28th, after we've been in this order for 3 weeks, the state will calculate what they project our ICU capacity will be 4 weeks from then. And if they show that we can be stable the month after and be at an ICU capacity above 15%, the order is lifted. This is a region, so we get out of the stay-at-home order as a region. San Joaquin Valley as a region entered the stay-home order, and we will exit the stay-home order together. However, where each county lands when we exit the stay-at-home order is based on your own county's metric. So if you are in purple metrics, and when we get out of the stay-at-home order, you will be in purple. If you're like Mariposa, that had been red but was lumped in with us, if we get out of the stay-at-home order December 28th and they still have red metrics, they go back to red. So each county gets assigned to the tier in the blueprint system that matches their metrics when you exit, but we exit together as a region. Okay, so next slide. And I'm sorry, but as I keep adding numbers to this slide gets busier and busier, but if you just look at December 1, as I said, the case rate of 13, we did not think was really accurate, and what is going to be reflected today is that our case rate is 27. This will be showing up today on the website, the governor's website. So we are now at a testing positivity of 10.8%. They have gone back to doing these calculations on Tuesdays with a 7-day lag. And with the 7-day lag, their system's able again to calculate what your testing positivity is in your health equity quartile, and that's at 11.9%. So as you can see, the state testing median has also been adjusted. It went to 272 on the 10th. Between the 10th and this week, There have been more than weekly updates, as they've done sometimes twice a week updates to these numbers with a 4-day lag. But it has been 4 weeks now total, and so as promised at the 4-week mark, they adjust this median, and it's now 363. And again, we tested beneath that, unfortunately, this past week. Next slide. So this is the actual regional stay-home order as written by our acting state health officer, and just put this up here for people to see the order at a glance. But if you see, the first page is all an explanation as to why this is being done and how the state is experiencing this surge. The second page really goes through the pieces of the order. And next slide, please. And you'll see here that on the third page, item number 4 is where it says that it would take effect December 5, which explains why we then had a day to enact. And so next slide. So this is what comes with the order. The things that are open, really largely open with the usual precautions that have been given previously, really no change, is critical infrastructure remains open. Schools that are open, either whether they opened with a waiver or they opened when we were in the red tier, they remain open. Non-urgent medical and dental care can remain open. So this is a little bit different than in March when a lot of dentists closed. So this order is a little bit different than the March stay-at-home order. Child care and pre-K remain open. And next slide. And still open, but with modifications, are these things: outdoor recreational facilities. And so this includes outdoor fitness activities, and this does include operations at gyms outdoors being allowed. Retail allows indoor operations at 20% capacity. This originally was written to be all retail, but if you look at my asterisk at the bottom, grocery stores on the 6th, there was a supplemental order that said they could be open at 35% capacity. So grocery stores had originally been lumped in with retail and could be open at 20%, but now grocery stores are at 35%, all other retail at 20%. That pertains to shopping centers as well, 20%. Hotels and lodging are only supposed to be taking reservations for people who are traveling for essential critical infrastructure work. The other reasons why you might allow someone to stay in a hotel would be if they are on quarantine and fulfilling a quarantine requirement. And the state has also said military reserve can have hotel lodging. Restaurants are now, again, unfortunately closed indoors and outdoors. As you recall, just recently when we went to Purple Tier, they were allowed to remain open outdoors, but now it's just takeout or delivery. Offices for remote critical infrastructure, places of worship, no change from when we were in Purple. When we went to Purple, places of worship were allowed outdoors, and that remains the same. And then some things in the entertainment production industry. And next slide. These things are now closed. Playgrounds, indoor recreation, hair salons, nail salons, museums, movie theaters, wineries, bars, breweries, and distilleries are closed, except for the purposes of production and manufacturing. Family entertainment centers, card rooms, limited services, live audience sports, and amusement parks. And we do await more clarification on some of these things. I did hear the public comment read about someone who wants to know if they are essential or not and can be open or not. Limited services include such things as laundromats, car washes, but it also says plumbers, electricians, and the state is going to come out, I think, with language that says certain things such as plumbers and electricians can stay in business as critical infrastructure. So there's some cleaning up that needs to be done with the language around limited services. And so that is the stay-home order. I have some more slides, but I'm going to switch topics now. Next slide. You might have heard that the CDC put out some new quarantine recommendations. This is in an effort to try to increase compliance. The CDC said that quarantines no longer had to be 14 days long. If you're exposed, if you're a contact to someone who's positive, you might be released from quarantine at day 10 and possibly even at day 7 if you can test out, if you have a negative test. So the state took a look at this and they really examined it and came up with CDPH's own quarantine guidance. This was with much input from health officers across the state. We know that a 14-day quarantine is difficult, and sometimes people just kind of throw their hands up in the air and don't do it at all because it's so long. So there are some advantages to shortening the quarantine. However, it's ideal, if you can, to be quarantined for 14 days still, because we know that incubation can still occur out to day 14. Most likely, people who have been exposed to COVID incubate and develop COVID by day 5 to 7, but they can continue to incubate to day 14. However, there is now this clause that CDPH is saying that you can discontinue quarantine after day 10. Now, as far as being able to test out of quarantine at day 7, the state's saying this is a possibility, but only for certain circumstances. Healthcare, emergency responders, social service workers can take a test after day 5 and be released from quarantine, having to still mask the entire time till you hit day 14. So this is new language, just came out yesterday, and so we at Public Health need to update all of our documents to reflect this now. And I just have, next slide, a very quick one on the antigen tests that are currently being used in our county. These are the rapid point-of-care tests that we've discussed in previous meetings, and I wanted to show you that about 15,000 of these have been dispensed to our skilled nursing facilities, 3 different brands, and they are in use at our skilled nursing facilities to screen for symptomatic people, residents and employees alike, to make sure we cohort them away if they're positive. Our medical health operational area coordinator, who is Mr. Dan Birch of EMS, is in charge of distributing Binax Now, which is one of the antigen tests, and he has been actively distributing to hospitals, correctional health, ambulance, surgical centers, and rehab facilities. Hospitals are possibly going to be utilizing this to screen their own employees to try to prevent any outbreaks amongst employees as we try to keep them healthy and make sure that they are not coming to work sick, and that we are really keeping our health care force as usable and as available as possible. So this is something that that they're looking at, that the state is looking at, using it for surveillance and those purposes. Again, as I've said before, any facility that has these tests have to be affiliated with CalReady so that they can upload results to the CalReady system. And next slide, I'm going to switch to the COVID-19 vaccine and then wrap it up. And I apologize for the length of this presentation, but there were people who wanted to hear about the vaccine. Back a couple of months ago, a lot of fervent discussion at the federal level with the National Academy of Medicine and the National Academies of Sciences, Engineering, and Medicine. And if you're looking for frameworks as to how this vaccine will be allocated, this is where it started. Next slide. And this, the studies and the discussions they were having were sponsored by the CDC and the NIH, which were very much involved in these discussions. Next slide. And you'll see here that really what they were trying to look at was how do we allocate this with ethical principles in mind. So the goal was to reduce morbidity and mortality in the most severe cases while, trying to decrease the negative societal impact of transmission. So we're trying to find who is most at risk of acquiring it and having severe morbidity and mortality, who would be most at risk of affecting the rest of society and transmitting the infection to others. And so they're trying to be transparent, they're trying to be ethical, and what they came up with was 4 phases. Next slide. So these are divided into phase 1, 2, 3, and 4. So, I'm sure people will look at this and try to find themselves somewhere in this, but this is already being modified. I'll let you know that some of this might be changed over time. This is a general, layout of how it's going to happen. So phase 1 is divided into 1A and 1B. And in 1A, you have your healthcare workers. These are our priority group and the people who will be receiving the COVID-19 vaccine first. And includes our first responders, but by first responders, we mean medical first responders, not the non-medical. If you look at phase 2, that's where you might see teachers. You might see some people who are critical infrastructure, people with significant risk. We're in phase 1B, but moderate risk are now in phase 2. This includes the homeless shelters and our jail settings as well, and older adults who are not in phase 1. Phase 3 now comes to our younger adults and children, and the rest of everyone else, really. And then 4 is anybody who wasn't captured in 1, 2, 3. Really, the focus right now is to get through phase 1. Of course, we have to continue planning for 2 and 3, but as we are looking to receive shipments soon, the state is very much focused on this 1A. And there's not enough vaccine to go around, even for 1A. There will be. But in this very initial shipment, there isn't. So even within 1A, I will tell you that 1A has now been broken up into tiers, tier 1, 2, 3. And I will tell you that when I say that this framework is already being amended, I will say what I'm trying to explain is that there is already a switch and a change to phase 1A. Skilled nursing facility residents have been added to 1A. So when you say healthcare workers and hospitals, we're really talking about the employees, but added to this are the people who live in long-term care facilities. They've been moved into 1A. And so next slide. On December 1, there was a meeting with the CDC and the ACIP, the Advisory Council on Immunization Practices, and they did vote to incorporate residents of long-term care facilities. So that now phase 1A includes healthcare and our long-term care facility residents. And so next slide. As I said, even phase 1A has to be divided into tiers. And so the very first doses of COVID-19 vaccine are supposed to be targeted towards people who work in tier 1. Again, as I said, our acute care hospitals, and we do have a psychiatric hospital, and correctional hospitals are included. Our skilled nursing facilities, paramedics, EMTs, and then dialysis centers, as the state has put that into tier 1. Next slide. Tier 2, we're still talking healthcare workers, but now we're talking about home health, in-home support, federally qualified healthcare centers, community workers. And then phase 3, tier 3, next slide. Specialty clinics, lab workers, our dentists, and our pharmacists. So, next slide. Currently, there are 2 COVID vaccines that are almost to market. The Pfizer vaccine submitted for FDA approval on November 20th, and Moderna announced that they were submitting on November 30th. This is moving quite quickly, Moderna being just about a week or 2 behind Pfizer. And these are both mRNA vaccines that are looking very promising with the 95% efficacy rates. So logistically, this is quite complex as we look at all the numbers and we look at all the tiers. And I will end with this last slide. Next slide. Just to show you how the Pfizer vaccine looks. The Pfizer vaccine comes in these vials that then, when you dilute them with diluent, become 5 doses. So the vials are then packaged into these pizza boxes, which each box holding 195 vials. And then those 5 of those trays are then put into this carton with dry ice, so that each of these cartons in the end holds 975 doses. These are the ultra cold vaccines that need to be at very cold temperatures and storage. And once they become refrigerator temperature, they're good for 5 months. So you might have seen in the news this morning that there's very good news looking as the FDA looks at this Pfizer vaccine. We are really expecting them to approve it on time, which would be the 10th. And as soon as it's approved by the FDA, we are expecting that shipments of those that are already available will immediately be dispensed. So the state of California is looking to receive an initial 327,000 doses of the Pfizer vaccine. Note that in the state of California alone, we have 2.4 million healthcare workers. So as I said, not enough for the first initial shipment, but there will be more shipments week over week is our understanding. Maybe not every week, but it will be perpetual. And so once we start receiving it, it will be slow, but we will continue to receive. So the state will receive about 250,000 doses. And then San Joaquin County Public Health, we have pre-positioned ourselves to be some of the first recipients because we have an ultra-cold freezer. And so we did notify the state that we could be pre-positioned, and we were one of 32 entities that was awarded this pre-positioning status. So we are expecting to receive our first initial delivery on the 15th, so coming very soon. And what we were told is that we can expect to receive 5 of these cartons. So 5 times 975, we are expecting to receive 4,875 initial doses. And we are in heavy talks right now with our hospital systems. We did have a webinar with them yesterday, and we've been meeting with them. And each of our 7 hospitals has named who their liaisons are for this process. And they have interviewed their hospital care workers and asked who is going to be some of the first recipients who wants to receive this. That our 4,875 initial doses will be spread out amongst them, and that the number's quite on target and right about what we need for this very first phase. The FDA is going to be discussing the Moderna vaccine on the 17th, and it's very similar to Pfizer in the way it was created, and so we expect that their efficacy data is right on target, and we would expect that they would be right behind Pfizer in receiving their approval. So that in the end, California does expect that by the end of December, combined between Pfizer and Moderna, we will have about 2.16 million doses. So initial maybe a third of a million, but we're expecting maybe 1 million more of Pfizer and about 1 million of Moderna by the end of December. So this is going to be ramping up here by the end of December, and we will get through Tier 1, and then I'll have more to bring to you next week on that process. So thank you very much, and I'll stay on the line for questions. And I know that we have Mr. Davis as well to give us a presentation, but I'll stay on the line.
Thank you, Dr. Park. Does the board have any questions for Dr. Park? Supervisor Villapudua?
Dr. Park, I'm just wondering about the turnaround time as far as testing. Are people getting tested? Is it getting better? I think I got tested before Thanksgiving, and it took 2 weeks. And we're just wondering if the turnaround time is getting better. Is it improving?
Yes, statewide, the turnaround time did improve before this surge. And now there are certain regions that are struggling with turnaround time again because there's so much demand and our labs are getting full again. But as a state, turnaround time is mostly still within 3 days and with the majority within 48 hours. Locally, we did have one of our vendors switch to a new lab, and so their turnaround time is expected to be shorter. So we're really hoping that anyone who gets tested now in the month of December will have their specimen sent to that lab, and turnaround time will be better. At our own lab at Public Health, our turnaround times remain good, and at many other labs, they still are very good. So I think that you're going to see improvements. We're deep into this surge, and the demand is high, but our labs across the state have learned to be faster, more efficient, and we do have more capacity in many of them.
Great. Thank you very much.
Thank you. Supervisor Elliott, you have some questions?
Yes, a question on the the percentages of ICU availability. You had mentioned that there was 6.3% ICU availability right now, which is throughout the region. But then you went into an explanation of how if your percentage of COVID positive patients in ICU was greater than 30, then that caused you to be deducted, I guess. So if we have 40% COVID positive in ICU, that would mean we would be facing a negative adjustment of about 7%. So my question is the 6.3% real, or is that just some adjustment that has been made?
Right. So we have asked the state to show us what our regional numbers are, and they direct us to that snapshot, which were the orange bars I showed you. And so looking at that, it says that we are at about, as I said, 42%. I'm assuming that the 6.3 is an adjustment. So for every point above the 30, we were probably adjusted down 0.5%.
Okay. Well, I guess it is what it is, but it just seems that people who are making these decisions on these metrics are making it unnecessarily convoluted in terms of coming up with numbers, and then the rationality for these things isn't, in my opinion, isn't great enough to justify adjusting our numbers down. And so we end up being penalized on these things just because of certain ratios that occur, which doesn't affect the number of ICU beds that are available at all. So, that's just my comment. I'm really frustrated with this whole metric system here. It just seems that there are those who are trying to make it as difficult as possible to get ourselves out of these restrictions that have been imposed.
Yes, Supervisor Elliott, I hear you, and it's harder and harder for me to even explain the math as they come up with these. They consult with some of the greatest, Harvard and Stanford, and then they explain it to us, and it is hard it does feel like a penalty if that's not your real ICU capacity, but they explained to us that this penalty for going over 30 is to really preserve the space needed for people having strokes and heart attacks. And so it's a protective factor. It is a difficult one to explain, but that's the math they're using.
Any other questions for Dr. Park? Supervisor Wynn?
Thank you, Madam Chair. Thank you, Dr. Park. Is always very illustrative in regards to the numbers. Unfortunately, as we've talked about before, it's not just only complicated, it changes. We talk about, and I use the term, moving the goalposts, and we just constantly move things around and for things that we really have not a lot of control over in regards to cases and testing and positivity and those types of things, somehow we're punished as if we have control of this virus, which obviously we don't. So just a couple of questions. First of all, you talked about in meeting with the hospitals or healthcare workers, has there been a determination as to specifically who the individuals would be receiving this vaccine so that when it does arrive, we can immediately contact those individuals and provide that? Or are we in kind of in the general discussion stage where we're just talking about numbers and how we're going to administer it, et cetera? So do you have that information?
Yeah. Oh, yes. We are gathering very specific numbers from each hospital. So, for example, let's say we talk to San Joaquin General Hospital. We ask them to poll their employees, and it is to conclude basically all healthcare workers who either touch patients or are within reasonable, risk of being working there. So basically, it's really anybody. and so then we will ask them how many want the vaccine now. And we're really hoping that a lot of people do want this, but for the initial stage, let's say they say 250, and then Dameron says 300, and Dignity says 400. We are collecting those numbers from them, and then when we receive this shipment on the 15th, it's going to go very specifically to them at the numbers that they say they're going to use, because there can't be any waste. And as I said, it has to be used within 5 days after we dispense it because of this whole complexity with the fact that it's frozen. So they're aware of that. They're aware that they have to use it without waste, and they have to ask for the exact amount that they're going to be able to vaccinate within that time period. And it's looking like it's going to be about that number 4,000 that we're going to be receiving. And if we don't cover them all, we'll be getting more. And as you know, they all need second doses, and so we will have to monitor that very closely to make sure that 21 days from now we're re-injecting them.
That goes to my next question. Was this 4875, is that 2 doses or is that just a single dose? Because there has to be a follow-up within 28 days.
It's single dose, as I said. Each of those little vials has to have diluent put into it, and then it's drawn up, and it's 5 doses, and then you can't save it, so it's single doses. You can't save half of that to re-inject the same people 3 weeks later. We are being reassured by the state that they will give us that same amount plus more, so that the people who get their first dose will certainly get the second dose of the same brand. So we are being asked to inject it into 4,875 separate individuals, not cutting that, not half of that. So we don't save the initial. We use them all.
Okay, so essentially what you're saying is that everything's in place with the hospitals in regards to numbers, and we're just transmitting the vials or the doses to those individual hospitals, and then they will distribute amongst their staff. The question, what I've heard, and I don't know if it's changed, but I'd heard that maybe less than 50%, maybe as low as 40% of healthcare workers actually intended to receive the vaccine. Is that number changed?
Right now, we're sitting at about 41% of our healthcare workers who have stepped up and are counted in those numbers. So, no, you're correct. We have confidence, though, that as others watch their colleagues, coworkers get the vaccine, that they will be stepping up and getting them. And we do have to make it a very successful Tier 1, Phase 1A. So there will be messaging even out to healthcare workers, encouraging them to get this vaccine. But yes, we are, and our EMS agency is polling our first responders, and it's similar with them too. We're about 41, 45% of uptake right now.
Well, another statistic that I've heard, and obviously, you know, it's kind of hard to get this specifically to California, but, you know, during, I guess, the past 60 days, maybe longer in regards to discussions of whether or not we would have a vaccine by the end of this year, or it would take, you know, 2 years to come up with a vaccine. There was a lot of discussion and a lot of concern expressed by some governors, especially about, you know, rushing this through and trying to get this out before the end of the year, and establishing these committees or commissions to, once they receive them, to do additional testing to make sure that they were safe to use, et cetera. And I've seen some statistics, especially in some of our disadvantaged communities, minority communities, in regards to, you know, maybe as low as less than 20% in certain classes who are intending to take it. Have we looked at the possibility of correcting what I think was initially maybe some misinformation as far as the safety aspect of the vaccine, so that these individuals will be willing to at least consider taking the vaccine when it arrives?
Yes, thank you so much for that question, because this is a big issue. As we get more vaccines, we're expecting in the spring to be able to start in on the general public, and we really do want the public to have confidence in these vaccines. And we know that historically, some of our African American and Hispanic communities have, for various reasons, you know, coming down through history, been distrustful of medicine and of science. And this is fair, obviously, because of some of the, and I don't want to go into the history, but some of the experiments and some of the things that this country has done. And we really need to turn that language around. And we need to point out that some of these same people are at the highest risk for having severe outcomes. And to really explain to them that this has been completely vetted by the FDA and the CDC. So we're working on that, not just at the local level, but the state level as well. Lots of messaging being created and lots of partnerships going on with community-based organizations to try to get the community vaccinated.
Okay, I appreciate that. I have a question in regards to masks, which is almost a daily discussion, in addition to the lockdown. But I guess my question is, as I've seen in some of the recent court decisions by judges on the question of, show me the science in regards to some of these decisions. Do you have anything specifically that maybe you're aware of or the states provide in regards to the effectiveness of mask wearing amongst our population?
There's a lot, and I could probably send that to you via email, Supervisor Wynn. There are many studies now on the effectiveness of masks, and cloth masks versus surgical masks versus gaiters. There's been many different studies, but I could definitely try to forward to you some of the major studies that have been used by the state to make its determinations.
I appreciate that, because I've done some researching myself, and I found several different studies in regards to masks, and maybe unfortunately I just hit upon the studies that provided a recommendation or an outcome that questions the protection provided by masks. For example, Dr. Fauci back in March 8th of this year talked about there's no reason to be walking around with a mask when you're in the middle of the outbreak. Wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think it is. And then the World Health Organization stands by a recommendation to not wear masks if you are not sick or not caring for someone who is sick, and that was March 30th. In April 1st, New England Journal of Medicine, which is a leading American health journal, wrote, "We know that wearing a mask outside healthcare facilities offer little, if any, protection from infection. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over pandemic." And then moving, and I won't go through all of these that I found, but I did find a research study that was done in February, obviously before the pandemic, but it was at least being discussed, where 7 researchers in Hong Kong reviewed all the trials they could find that tested whether masks outside hospital settings protected their wearers against the flu, which obviously that was a main concern. They found 10 studies going back to 1946, and they combined these, and in a conclusion published in Emerging Infectious Diseases, they did not find evidence that surgical type masks, and you're right, they're surgical, and there's also the cloth, are effective in reducing laboratory confirmed influenza transmission, either when worn by infected persons or by persons in the general community. So, and it goes on in regards to, and I won't go through all of them. September of 2020, in Lancet Respiratory Medicine, Dr. Fennelly talked about, it doesn't provide, because there's a discussion about large droplets and aerosol and all those things, and the conclusion is that oftentimes these transmissions are so small that neither the surgical masks or the cloth mask can protect, and the amount of protection is minimal. And then probably the most recent that I could find was the Denmark study, which was published in November 18th of this year, where they had 5,000 people in the spring, and half of them were given high-quality surgical masks. They were given 50 of those, and the other half were not asked to wear a mask. And within a month, 53 people in the maskless group had been infected, compared to 42 who wore masks. And obviously, and their conclusion was based upon the time frames, et cetera, that maybe that was almost indistinguishable. My point is that when we talk about the increase of wearing of masks over the past few months, certainly with the spread of the virus back in the spring and certainly during the summer, as you showed in your chart, it seems like, you know, most people are being compliant in regards to wearing masks. And so the question arises is that why, if everybody is being so careful, and you can rarely find anybody without a mask, especially if you go, you know, to any of the stores that are allowed to be open, then why, if they're so effective, why are we seeing such a dramatic increase in the cases? Because obviously, if they work, we shouldn't be experiencing this type of spike. And so those are my concern, is that, and that's why I would appreciate you sending me those studies in regards to the science, because frankly, I don't get it. You know, for me, science is something you observe and you analyze, and it would seem to me that what we see as far as the activity in this county and throughout the country and actually the world doesn't show a pattern of effectiveness. And then I'll finish with this, and this is just a couple of comments in regards to that I've read from individuals who are much more learned than I am, and their observations. These are from epidemiologists and medical experts, and they're collectively, and I'll try to summarize this, is that they feared that, for example, politicians they would be blamed for the deaths and the negative health consequences, and as a result, they did a lot of things to minimize what they perceived would be the increase, certainly in cases, which again, cases, from my vantage point, I know people, and I know we all know people who've contracted the disease, and it's almost been nothing. I mean, you may loss of taste and smell and maybe a headache or whatever. But aside from that, I also had a good friend who died from it. So I mean, I've seen both sides. So my point is that by virtue of those decisions, we have dramatically damaged our country, and I'm not just talking about economically. I'm talking about any number of things. And I know you're aware. Unfortunately, we had an 11-year-old last Wednesday who committed suicide during distance learning, which is a tragedy. Just a tragedy. And my point is that, you know, when we as elected officials make decisions, we have to consider all the consequences. And I'm just saying that unfortunately sometimes, you know, things happen that we don't expect, and that's a concern. I'll finish with two quotes, and this is from a journalist from the early 1900s who was quite a critic, I guess, of government and a bunch of other things. And what he said, two different quotes, he said, "The whole aim of practical politics is to keep the populace alarmed and hence clamorous to be led to safety by menacing it with an endless series of hobgoblins, all of them imaginary." And his last comment was, "The urge to save humanity is almost always a false front for the urge to rule," and that's H.L. Mencken. So my point is that I am very concerned about the decisions we've made. I understand the need in the beginning because we didn't know what we were dealing with, but I think we know a lot more now today than we did back in March or April. And I think that, unfortunately, what I've heard and read is that our flattening the curve and taking these measures have in many cases, if you look at other countries that haven't taken these measures, that are now reopened. And just a good example, because on your list of amusement parks, Disney World in Florida has been open for months. Disneyland is closed. I don't see the difference between the two. I don't think Californians and those who visit Disneyland are any different than those who visit Disney World. So again, I'm not being critical of you, but I am being critical of the way we're handling it in this state, because I think, unfortunately, we have overreacted, and I'm not suggesting we don't wear masks. I think that's an individual choice or decision. And I know as you've said, we have had no flu, and so maybe that's a good thing. Well, it is a good thing. So again, I would appreciate that information, but I can't, and I guess I'll have to talk to County Council, because I'm sure he is familiar with some of these court decisions that have been happening in regards to being challenged, like the Restaurant Association and others, where the County of Los Angeles says there is no scientific evidence for their decision to close 31,000 restaurants in the county. So again, thank you very much, and I look forward to seeing that information.
Thank you, Supervisor Wynn. I appreciate your comments.
Thank you. Supervisor Patty, do you have any questions for Dr. Park?
Yes, Madam Chair. If you're able to hear me, then my connection is still good.
Yes, we can.
So, yeah, I want to take a deep dive. Supervisor Wynn kind of exasperates the point that we seem to talk and talk, but not much action is taken. And here's the frustration. We have a fantastic report, and Dr. Park, I might suggest that there's not 3 people in all of San Joaquin County that care about the ice packaging that's going to be coming from Pfizer and the layers of the ice and the layers of the vials and everything else. That's all blah, 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 useless information. And this may be outside of your realm, but the question is, what are we doing to save lives and save jobs? And I'm not talking about in health care, but as Supervisor Wynn points out, we have a child that took his own life on a Zoom classroom setting. We have restaurants that are suffering as we speak. We have small businesses. We have jobs. It can go on and on and on. What measurable action, and again, Dr. Park, this may be outside of your realm, but what can we be doing? Now, for instance, it's been suggested that having more of the antigen rapid testing might inform people, instead of waiting, as Supervisor Villa-Prudhomme pointed out, 2 weeks for his results, and if he were positive, then more people would have been spread. Instead, we should have a lot more rapid information. To give you another example, last Friday, I was feeling a little bit under the weather. I went and got tested. Within a couple of hours, I was informed I was COVID positive, and I immediately self-isolated, unlike what somebody in public comment, some idiot, wrongfully accused me of going out in public and spreading my COVID infection, which is blatantly false and misleading. I actually have self-isolated, and I remain so. I'm following all the protocol. But the real question is, what can we do? And I'm gonna throw this to the board, to Dr. Park, to Mr. Dietrich. But let's say, for instance, our capacity for ICU is not met the standard of measure, and therefore we're penalizing, and all these businesses must be closed down. Well, are we buying a portable tent structure, much like they've constructed in other locations, and let's say we're putting in 50, 80, 100, 200 ICU capacity beds that allow us to increase our numbers and reduce the percentages or improve the percentages so that we can keep businesses open. And that's a question I'm throwing out there. Who has some solutions? Instead of us complaining about it and watching businesses suffer and the damages to our youth and to the jobs and to our economy, who has solutions to come forward with more than just information on graphs and information about packaging?
Supervisor Patty, we are going to hear from Dan Birch from EMS on a hospital report, and specifically on our ICU capacity. So it's my understanding from the regular briefings that the main issue is not the number of ICU beds, but it's staffing for the beds. and that because the surge is being experienced statewide and nationwide, we don't have the opportunity to bring in staff from other areas. So we were going to wait for Mr. Birch, but I'm going to have him just real quickly and perhaps answer your question, because I think his information goes to the question that you're asking. Mr. Birch, welcome. Thanks for being here today.
Thank you, Madam Chair, members of the board. So to answer Supervisor Patty's question, I honestly do not support the state's linking of ICU capacity to the metrics to shutdown, because I don't, as we got into a little bit of the last board meeting, I really don't think the shutdown is really appropriate measure. I think there's other engineering measures that we should actually be using instead. But the way the hospitals are currently working right now is we have been operating above our licensed hospital bed capacity for the county since the middle of March, and pretty much since summer we've been operating above our licensed bed capacity. We only dropped below 85%, which would be our own 15% metric in the middle of October, and then we immediately exceeded that again. So the metric right now is we have 99 licensed adult hospital beds in the county. My understanding is the state is using those 99 licensed hospital beds as our baseline metric for whether or not we have 15% capacity. The hospitals themselves, each of the hospitals have plans and processes in place to increase their ICU capacity, and I have some slides later that I can show you that'll show how each hospital has increased on that. Those extra surge beds, is my understanding, do not count towards the metric on whether or not our region can be open or closed based on ICU capacity. So we would have to have essentially 80 patients in ICU today in order to meet our own county metric of being under 15% as it would apply to the region, wide. I don't see that we're ever going to get there, and the reason not is because our seasonal ICU capacity is always near 100% or over every winter in our county. That's why it's a false metric. We'll never be able to get to 85%, and neither will our other member counties throughout our region, because normally during this time of the year we're always operating at 100% or higher in ICU capacity. So without doing real drastic austere care measures, which I'll talk about later in my slide presentation, we'll never be able to drop below that number.
Okay, thank you. Supervisor Patty, do you have any other questions for Mr. Birch? If not, I'm going to let him sit down until it's time for his slide presentation.
Well, yes, if he's going to do a slide presentation, then we can sit tight, but that's very concerning. And as Supervisor Wynn points out, the hardships that are coming on in our community and in our small businesses and to the children, we need to start talking to county council here and as a board decide what we are or aren't going to allow in our county, because this is not something we can shut our economy down until spring, and perhaps we're waiting indefinitely for the numbers of vaccines to appear. This comes to a point where it's rather hopeless in too many people's capacities, so it's very concerning to say the least. So, Madam Chair, I think that's all I have until we hear more from Dan Birch.
Okay, great. Thank you. Then I'm going to ask Chuck Davis to come up. Mr. Davis is with Bayesian, and I believe Dr. Park has requested for him to be here today to give us an update on some of the San Joaquin County specific data.
Good to be with you again today, and I'll go through this presentation. One of the, oh, great, thank you. So as of today, and the numbers will be updated, we're currently at 530 deaths within the county, COVID-19. One of the things that we wanted to do was to examine the mortality within the county to actually understand more about what's actually driving death from COVID-19. And so we've prepared this presentation. I'll go through it, but before I do, I definitely want to thank a couple of people, specifically Mr. Diedrich, also Blackwell Rodriguez, also Mr. Burchin, of course, Dr. Park, but more importantly, all the epidemiologists. I work with them on a pretty close basis, and the county is extraordinarily lucky to have such great professional staff, and more importantly, the work that they do. It's extremely challenging within this pandemic. They're talking to people that are ill, they're talking to people that have loved ones, and not very gratifying work nowadays. And they do it. They're working very long hours. I just wanted to single them out and recognize them for all that they're doing. It's allowed me to be here and pretty adamant about being extremely transparent with the data, and so I think it's great that we're able to present the county and for people to understand what's happened, the finality, hopefully give this body and also the public context for this pandemic. So we had a few objectives. One were, how are COVID deaths being classified? There's been a lot of talk about if someone is truly dying from COVID or are they dying from something else, and how the numbers are being counted. Are COVID deaths over or underreported within the county? What are the demographics? Who are the people that are dying from COVID? And where does COVID rank as a cause of death within the county? I think that some of the information that you're going to find in this presentation is actually quite surprising. Have COVID-19 mitigation efforts affected other mortality? Are we seeing a rise in suicide, for instance? That was just mentioned. In order to do that, we not only have to look at COVID-19, which is a new phenomena for 2020, but we actually had to go back and we had to take a retrospective look at all deaths throughout the county. And we looked for 7 years, 50,000 cases to evaluate. We had then isolated where the deceased lived in the county of San Joaquin. We have people that are deceased in the county, but they're not county residents. Once we made that adjustment, it comes out to about 46,338 cases. And then those cases were then cross-referenced with those death records were then cross-referenced with the epidemiological records. And for the cause of death, they use a code called an ICD-10 code. And those codes are over 1,400 across that entire span. And so those were comparatively analyzed for all of the cases. So probably a little difficult to hopefully the public is able to screens, but cumulative deaths by year. So on the left side, you see 2020, and this data only goes up to November 18th, I believe. And so there's a gap because there's a reporting gap. So it's important to note that in 2020 for the numbers, we're not out of 2020 yet. But we're sitting at 5,119 deaths that are currently being tracked within the system, and the average age of a decedent is 72.2. You can see as we go all the way back to 2012 that around 2017, well 2015, 16, and 17, we actually had a slight increase in the number of deaths. But the death rate through the county has been pretty consistent, about 5,000 or so per year throughout the entire. Numbers have remained fairly consistent. If we break that down by gender, we can see that the blue represent men and the pink represent women, and my color choice. But what we could see is that women tend to outlive men anywhere from 5-7 years on average, and that's remained fairly consistent. So, again, as we look at the data year by year, the numbers are fairly consistent. So now what I'm doing is I'm zooming in on 2020, and we're looking at deaths within the year on a weekly basis. So this is the running total of weeks. And as you can see, in that July, August timeframe, we see that there's that spike. Now that's consistent with COVID-19. So we can see that there's that increase outside of that normal pattern that we would expect to see. So what we have found in the data is that in 2020, COVID-19 has become the leading single cause of death within the county. Now, this is a busy slide, and it's not intended for everybody to try to go through and read every single thing. I'm just going to point out a couple of items here. What we're looking at is on the far left side, that's 2020, and the bar at the very, very top is COVID-19. If you look to the right of that for the rest of the years, you don't see a COVID-19 bar because COVID-19 wasn't around. But you could see that COVID-19 is at 8%. So COVID-19 right now as a singular cause of death represents about 8% of all deaths within the county. And then from there, you have a whole, it would actually go beyond what I'm showing and go further down. There are a whole list of ways that people, pass away within the county. We're going to go into a little bit more detail here and focus on 2020 in just a second, but it gives you an idea of the impact that COVID has had. So again, now looking at 2020, we can get a better view of COVID, and again, we have a whole series of different ailments. So for instance, COVID-19 for any singular form of cancer, like breast cancer, prostate cancer, COVID-19 has exceeded all of those individual cancers. Now, if we lump cancer together, all cancers together, then it more closely approximates or comes pretty even to COVID-19. But for any singular cause of death, COVID-19 far and away is the largest single cause of death. So I wanted to isolate a couple of items here. So if we look at a cause of death, it's COVID-19. Its overall rank currently in 2020 is 1. And so if we look at something like heart failure is the 9th leading cause of death within the county, but COVID-19 still outpaces heart failure 3.6 times. So it's 3.6 times greater, the amounts of death from COVID-19 than we've had from heart failure so far in 2020. Accidental overdose, drug overdoses, ranks number 10 overall, but with COVID-19 is 4.6 times more deaths than accidental overdoses or exposure. A car accident. I've heard people talk about, I stand a greater chance of getting in a car accident and dying than I do COVID. Not in San Joaquin County or probably anywhere else for that matter. COVID is proven so far to be 5 times more deadly than car accidents in the county. Suicide, 6.5 times more. Homicides rank as number 30 collectively within the county in terms of death. COVID is outpacing homicide by a factor of 8.5. And influenza, and I've heard people say, COVID is no worse than the flu. It's 58.3 times worse than San Joaquin County. So we could be pretty conclusive about how bad COVID is compared to the flu. I would definitely like to disabuse people of that notion that it's not as serious as the flu, or just as serious as the flu. And this is important, I think, because I understand that there's a lot of fatigue around COVID. I get it. All of us are suffering. My family is. Publics are. Certain all of you here. The real issue is that initially I think that people took certain precautions because they were afraid, and now they're tired. And my concern is that with the surge that we have from Thanksgiving, that we'll build upon that for Christmas, and we'll build upon that for New Year. I'm pretty sure that all of us have heard it. I appreciate what Supervisor Wynn was saying. There probably has to be some medial bridge because not everyone's going to listen to the warnings. Hopefully this provides some type of context because unfortunately the people that have passed away from COVID, that's a quantifiable number. I mean, this is not something that's made up or subject to interpretation. They're just hard facts. So how do we classify these deaths? And that was another issue, the potential for misclassification. So death classification is multi-factor. Typically, it's literally listed as A is due to a consequence of B, and then there's an interval between the onset or death. And that can go on several times. So you will see that A is a consequence of B, and B is a consequence of C, and C is a consequence of D. What that means is that someone can have cancer and contract COVID. And some would argue, well, you know, if they had cancer, that's an underlying condition or a comorbidity, and lots of people that die of COVID have comorbidities. But if you look, and this is an actual example, the person dies or the immediate cause of death, the cause of death is cardiopulmonary arrest. That's the immediate cause. But the final cause of death is COVID-19. They had COVID, and as you can see, they had COVID for 8 days, developed a pneumonia from the COVID. Then 4 days after that, they went into respiratory failure. Within a half hour, they went into cardiopulmonary arrest. So that's the progression of what's happened. Someone can have cancer, they can have diabetes, they can have any number of things. But when I look at the data for COVID, what I find is that typically with these chronic illnesses, people live for an amount of time, several months, and then they expire. With COVID, it tends to be fairly quick, and it's fairly consistent. So the mortality density map, if we were to map deaths from COVID, it looks a little bit different than what we see for reported cases of COVID in terms of the density. A large part of that, I believe, is due to the age of the population. Even though we're starting to see that shift a little younger in terms of mortality. At least initially, we had mostly people that were 65 and older that were succumbing to COVID, and also in managed or in care facilities as well. I'll go back to this. I guess I can't go back. Oh yeah, I can. One thing that I did notice is that in the areas that are the hottest, and something that I actually want to go back and take a look at closest in terms of the greatest density, I'm not quite sure why, but I've noticed that the areas with the highest density are also the areas that are closest to the major thoroughfares. So in terms of demographics, the Hispanic community, which is the green part of the pie chart there, represents 40% of the deaths. And men are succumbing to COVID more so than females. And then on the far left-hand side, you can see by race the ratio of male to female. This is the age cohort in years, and so about the middle of that chart should be around 65 or so. But so on the far left-hand, I'll move to the left, people are younger. I believe that the youngest death on that chart is, I think, 22 years of age. And then at the far right, 100. Interestingly, both are women. The pink represents women, and the represent men. What's interesting is if you look in this at this particular cohort from the age of around 40 to around 50, we're seeing a distribution of fair distribution of women that are dying from COVID, and then also it's not surprising at the tail end of the graph that there are more women because women tend to live longer than men. And then finally, in terms of the additional demographics here, this would be, this is occupation, and these are just some of the occupations. I believe these are the top 25 or so, or top 20 occupations listed. So one of the things that we're seeing is that of the people that are expiring from COVID or succumbing to COVID, they tend to be essential workers, working class people, and we generally, truck drivers and repairmen and laborers, but there are also teachers and secretaries. I mean, the list goes on beyond this group. But it's very clear that the more interaction that people have to have, the more that they're required to work. If they generally are at a lower income strata, that they are more than likely they're at a higher risk of actually succumbing to COVID. And that concludes the presentation. I'll take any questions.
I have a quick question on your last slide on occupations.
Sure. Go back to it. Oh, can't. Okay. Yes.
Homemaker is listed twice. The second bar, and then if you drop further down, it's the fourth line. So it's the second and the fourth line. And you also have unknown, 2 bars with unknown. I'm just wondering, is there something specific about that homemaker category that why they've been split out into 2?
Yeah, so that's a coding issue because we're looking at the actual death records. We're not going in and changing or modifying anything. So it's possible that you might see an artifact. I'm pretty sure that there's probably a slight difference between the 2. So they're showing up. They're showing
a little
up
bit
double.
different.
Yeah.
Okay. Thank you. Any other questions for Mr. Davis? Chuck? Supervisor Wynn?
Sure. Thank you. Obviously, this is important information in regards to the lethality of the COVID virus. But I guess from a vantage point, because we talk a lot and focus on the death aspect, but if you look at the ages, for example, when you get up to probably 60, 65, obviously there's more deaths, getting up to 100. And I guess, from a general global perspective, it would seem that one of the things we need to talk about, which is important, because most of the population, 782,000 residents here, are probably not going to die from COVID-19. Now, there is a possibility that they may contract it, but in many cases, it's almost asymptomatic, which means I don't want to say it's nothing, but it's certainly minimal. So it would seem, since you can do all this, statistical analysis, I guess my question would be, could we do the same thing just for the virus itself for those who don't die? And see, what the demographics would be in regards to our general population, because one of the things that I've been curious about, because we're doing contact tracing, those types of things, is with the statistics that you have available to you, and supposedly what we're doing with public health and all these other things, it would seem that we would be better acquainted with the specifics as to what's actually happening in what demographic, in what occupation, in what region, whatever it happens to be, so we would have a better idea of educating our population that these are the areas that have a tendency to have a higher rate of contraction of the disease. because when we continue to talk about the death aspect, it's just a very small percentage of the overall picture that we're dealing with. And again, when we talk about businesses, for example, it's important that, and I was going to hold my question till Mr. Birch got up here, but I guess for your benefit, it would seem to me that we ought to be able to better quantify some of the specific aspects of this disease. One of the questions that keeps coming up in regards to the documentation of the cause of death is supposedly that a hospital or a medical facility somehow gets some higher reimbursement for a COVID-19 death as opposed to a cancer death, et cetera. I don't know if that's true or not. Maybe Mr. Culberson or Mr. Dieter can answer that. But so the question is, if for example, the cancer patient that you showed had the type of cancer that was inevitably a mortal death, yes, they may have contracted COVID-19. Maybe it would have accelerated their death as opposed to eventually they would have died from the disease itself, which happens with cancer. So again, I guess I just need a little more information to really assess the balance between what's happening in our communities, which our residents are just demanding to know, as opposed to just focusing on the lethality of the virus itself. So I don't know if that makes sense to you, but I would like to see the death is a very small percentage. Everything else certainly should have a lot more information that we could digest and then maybe give some recommendations to our public health officer, certainly to our department heads, et cetera. So anyway, that's just my question is can we do a broader take on this since you have that information available?
Yeah, thank you, Supervisor Wynn. Actually, that's precisely what we've done. By looking at deaths, and we've had 530, by looking at them very carefully, one of the things that we do is a form of regression analysis, looking at all of the factors that played a role outside of COVID. What are the correlations that exist between these individuals? Then we can apply that to the 780,000 people that make up that comprise the constituency within the county. So we've actually done that, and in addition to that, we've actually looked at those people that have tested positive, and those people that were hospitalized, and those people that recovered. And from that, we've actually generated something called a COVID Objective Risk Assessment Score, or CORE score, and we've applied that score about 90% of the individuals within the county. So we already know, or at least probabilistically, for instance, if you were to contract COVID, we have a score that we could apply against your profile to actually make a determination as the likelihood that you would require hospitalization or worse. That will hopefully play a role in terms of prioritization later on down the road. We're still trying to figure out exactly how the most effective way of being able to apply that. But to your point earlier, when people talk about the goalposts moving, and we've seen that happen so many times in terms of the metrics, whether it's equity metrics or whether it's metrics around ICU capacity, they seem to be constantly changing. The one thing that we could possibly do to impact that is to try to make sure that the people that are going to contract COVID and have a high probability of recovery, that the priority is those people that are going to contract COVID and wind up in the hospital, and that's probably where the effort for education and outreach should be. Who are the people that are going to get the most sick? Who are the people that are at the highest risk of dying? And it's not just people that are Hispanic. There are a lot of issues in terms of that correlation. So we've been able to do that. We're aggressively figuring out how we can apply that so that we have a way of being able to mathematically keep our numbers down by some type of intervention. It also addresses the point that Supervisor Patty made earlier. But we're aggressively trying to figure out exactly how to use these.
I appreciate that. I guess I'll give you a quick example, and I don't have the numbers exact, but for example, in retail in LA County, on the cases in the retail sector, there was like 3,420 number-wise. Of that, I think it was like 131 were restaurant workers, employees, I shouldn't say that, out of restaurants. And out of those 131, as I think was the number, only one was an employee, one was a customer. Now, that's important information if you're talking about closing up restaurants, because obviously from a statistical standpoint, they're just a blip, on the radar in regard to the total retail market, and especially when you're talking 31,000 restaurants in that county alone. So my point is, if we can identify, as you listed in the occupations and the numbers, et cetera, it would be nice to know in those different sectors, for example, retail or truck driving or plumbers or whatever it happens to be, what are the numbers? And if they are, obviously, if I were a plumber, I'd want to know if I was high on the scale, and what could I do as a plumber to better protect myself or my customers or certainly my family. So that's all I'm asking is for a bigger picture to get a better visible presentation of what's actually happening within our county.
Understood.
Thank you. Any other questions for Mr. Davis? Okay, thank you so much. This was really interesting information. Thank you. I'm now going to ask Mr. Birch to come back up and do his presentation.
Hello, Chair Miller. I had one question. I was trying to get unmuted here.
I'm sorry, Supervisor Elliott, go ahead.
Okay. And this is a follow-on here to the discussion here about trying to home in somehow on the most effective areas that could be that we could focus on in terms of trying to prevent people getting it or dying from COVID-19, and that was some of these closures that have been talked about, and so just with this recent additional restriction here, the recent additional stay-at-home order, now restaurants no longer can offer outside dining services, but yet just I think it was just yesterday. It's been in the last few days, if not yesterday. The Assistant Secretary for Health in our National Health and Human Services Agency, Admiral Gerwar, went on the record as saying that there is no scientific evidence to support shutting down outdoor dining. So can we use your statistical analysis capability here to home in on things like that? For some of these policies, not only do they not make sense, but they may not be effective either. So is there any way we can focus in on that kind of thing to determine, okay, just what types of activities actually are resulting in people getting sick?
It's interesting because statistics can be used to make a point. They can be used to disprove a point. I want to be cautious about politicization of statistical methods, but with that in mind, I think it's really important to note that it's not so much about businesses. The issues that are driving COVID are behavioral. So they're individual behaviors. Does a truck driver or does a person that work in a restaurant, they have to have more public contact, but if they are able to follow certain guidelines and use certain protections, and they're disciplined and vigilant about it, they have a lower risk of contracting COVID. So there are certain things that we conceivably could do. Without question, I believe that, for instance, if we look at the number of cases, we can see that there are individuals that have certain types of locations where the likelihood of them contracting COVID is higher. So yes, I do think that from a public health standpoint, there are certain things that could be done, more education, more outreach, making sure that those individuals have the proper protections and the proper PPE or whatever is required, or even more vigilant. But it's largely individual behavior that drives the virus. People getting together, and letting their guard down, taking off their mask when they're amongst relatives, when they go and visit their grandma or whatever the case might be. It doesn't take much for the virus to spread, and it's extremely difficult. I mean, I understand it from my own perspective, my own family. It's very, very difficult. I totally get it. But to answer the question, yeah, I think that there are some things that we could do. Statistically, we do have good modeling, and we do have additional data that we didn't have before. When we talk about the goalpost moving, I think it's important that not worry about the goalpost and start to maybe create our own scoreboard. And I think that the data that we have within the county that we should be able to do.
All right, thank you.
Yep.
Thank you. Mr. Birch?
Thank you, Madam Chair, members of the board. I just got a few slides I want to run through to give you everybody an update on where the hospital statuses are, and then I got a few other comments to make to share with everybody. As I said earlier, I really don't believe that we should link the hospital ICU metrics to opening. I think that's a bad measure. I don't have a better measure for you, but I think that my comments that I made earlier, the fact that we typically this time of the year, the hospitals run at that capacity just makes it an unfair metric in which to hold any county accountable for opening or closing that metric. So you've already seen this graph. This is our daily tracking graph. You can see where we did have 262 as our height July surge. And since essentially October 31st, we've been going up steadily as a county. I believe last week's or yesterday's 7-day rate, we increased by 37% in the last 7 days for COVID positive admissions to the hospital. So here's I want to spend just a little bit of time on this particular slide. This is just the last 14 days. But what you'll notice, when we were at our peak in July, the highest overall hospital census during that time was 780 patients. We have been operating above 800 now, essentially for the past week. And we're currently, these are all yesterday's numbers, today's numbers. Today's numbers were at 806 total patients in the hospital. Not COVID, just total patients overall for the 7 hospitals in our county. And what you can see is, and then the blue line just represents the number of the 213 patients that are COVID positive that make up that number. And so as we're going into the winter season, as we would expect, we're starting to get a lot closer to full capacity with the licensed beds. And I'm going to go into a little bit more detail next couple of slides. So this is our current hospital licensed bed capacity for each hospital. I'll run through it real quick. We can see right now is operating well beyond their current licensed capacity. So their licensed capacity is 156. Yesterday they were at 125% of that. I think they were at 190. They've dropped a little bit today in the early numbers that I saw. But they've had to surge to meet their demand. I think there's something like, there's 40 plus major trauma patients currently in the hospital. Trauma is up for the hospital overall, and that doesn't help account for some of their numbers, but not all of their numbers. when we asked the hospitals about where the patients are coming from, there was no one clear example. Flu hasn't come yet. We were asking them to report flu every week so far, or every day. So far, flu isn't testing. The patients aren't having flu, but it's when you talk to the hospital administrators and the hospital CMOs, we speak with them at least once a week. Their answer is it's just a little bit of everything right now, kind of the normal winter season. People are needing hospitalization and the needs of the hospital. You can see St. Joseph's Medical Center, which is our Lazarus hospital with over 350 licensed beds, is operating 90% range. Dameron, special note about Dameron, we're measuring Dameron at 70 beds based on their limited staffing capability. And so we've been tracking that as our baseline. They're actually licensed for 202 beds. We talked to the state early on in this process about being able to augment that to utilize that space. None of those talks came to fruition other than last summer when we were able to bring in the Air Force team to help staff up their intensive care unit. I have earlier this week had discussions with Dr. Song, who's with the headquarters of CDCR, and she's interested in approaching Dameron and has already talked to Adventist Health, which manages Dameron, about bringing in additional resources to utilize that space for their patient population. So I have a follow-up phone call with her and Adventist Health at 1:30 today to talk about that as a potential option to better utilize the space that's available. And then our smaller hospitals are all operating at or near about 50% of their capacity. Adventist Health Lodi, I think, is also worth noting. They have about 196, I think, or 190 licensed bed capacity. They have not been able to really operate more than about 120 beds based on their current availability for staff. So that does limit us, even though we have the licensed bed capacity. Staffing is an issue, and I'm going to go through some of that solutions for that here in a minute. So this is just our last 14 days looking at ICU. As you can see, the blue line represents our licensed ICU capacity for the county, which is at 99 beds. And for the last 14 days, clearly we've been operating above that 100% capacity. We had 115 patients in the ICU yesterday. What does it mean to be operating above ICU capacity? What the hospitals have to do is they all have overflow processes in place where they usually have medical surgical tele beds that are just outside of their ICU that they typically use for overflow. That's what most of the hospitals have done. San Joaquin General's had to get a little creative in creating additional ICU space, and so has St. Joseph's Medical Center. So it's gone beyond their normal, what we call overflow, daily overflow for ICU. They've had to get creative. I know Dave Culberson, earlier this week, they had ordered that their post-anesthesia recovery unit be converted into ICU space to accommodate the number of patients that they had to do as well. So those are some of the tools that the hospitals have to find additional intensive care unit space, and then you have to get creative with the staff because it doesn't always come with staffing to just beds. But just, I can go back. There you go. And then this is another reason why I don't believe it's fair to the counties in our region to use ICU as a metric for opening and closing, because we're not going to operate below 99 licensed beds probably between now and February, in my opinion, based on historical experience. So this shows the ICU capacity at each of the hospitals versus their licensed bed capacity. You can see for licensed beds, everybody is pretty, it's pretty small, and that's probably an error on our part because well, maybe not. I look at it, I think Adventist Health only does have 10 licensed beds, but they've been routinely operating about 16. So everybody's pretty much full in operating above their ICU space. We've never ran completely out of ICU beds in the county because the way the hospitals manage their ICU is if I have a 10-bed ICU unit and I have an additional 5 beds that I've created, if a bed frees up in the ICU unit, it just becomes available. They don't move a patient back over and fill that bed. So If they're already surging to an additional 5 or 10 beds to expand their ICU capacity, when a bed opens, they just count that as an available bed if they have staffing for it. And so far, the county, although some hospitals have run out of ICU beds, the county itself has maintained at least 1 or 2 available every day on our morning report, the hospitals. And you can see San Joaquin General has been hit extremely hard, operating at 150% of their ICU capacity. Danvers is over at 125, and then St. Joe's, which has the largest capacity, is operating above 100%. And this slide here is a little different graph. It just shows you the percentage of COVID hospitalized patients in each hospital. They're typically sitting, low 20 or high 20s to mid 30s or to high 30s. With San Joaquin General, because of their trauma and others that come into their facility, their COVID hit yesterday was only 14%. So they actually have a lower overall COVID burden of the percentage of patients that are in the hospital than everybody else. But they're pushing their general census well beyond their current license capacity. I got some notes I want to talk about, but I have one more slide that I want to run through as well. So we're talking about action steps that we can take. Each of the hospitals has initiated their hospital incident command system, and those essentially have been operating since early spring. The attention to detail that they bring to that obviously has comes and goes as need comes and goes, but I think as we're reading right now, talking to the hospitals, they're all very focused on bringing as much efficiency into the system. And they all have activated their hospital command posts. That's just from a management perspective. On a daily perspective, what are we looking for the hospitals to do? One is to actively manage their bed utilization, turnover, and the cohorting of COVID-positive patients. So one of the things that we want to expedite with all the hospitals is the ability to turn over a bed. So we don't want discharges, and we've all, I'm going to speak out of turn here, but I think we've probably all been a patient in a hospital at some point in time in our lives, or we know people who have. There's nothing worse than waiting to be discharged, right? It takes forever and to get out. That's one of those processes that the hospitals can speed up, that frees up beds. And that's just an efficiency issue. And so all the hospitals have been asked to basically work on that utilization, turning beds over. The other management technique that the hospitals have been using throughout this pandemic is to cohort, to create wings that specifically treat COVID patients to make it easier to manage the patients and the overall burden on the hospital and their staff. We've asked each of the hospitals to expedite the discharge process. Essentially, we're asking each of the hospitals to do continuous rounding and discharge 24 hours a day, 7 days a week, not to wait for mornings or evenings, not to do it at the convenience of their physicians, but to force their physicians to make rounds and write the discharge orders and get the patients to home where the patients want to be. We're working with them, we've asked them, and we're working with them to enhance the emergency department workflow and expedite patient movement throughout the hospital. St. Joseph's Hospital reached out to us late last night. They were holding, I believe, 110 patients in their emergency department. And they were at max capacity last night. They reached out to us to see what we could do. Wasn't a lot that we could do to help them, but understand their needs, and we're trying to work on that process. The other thing the hospitals have been reluctant to do, but I think as we're heading into this season, they're going to have to spend a little bit more time on it, is rescheduling their surgical procedures that require admission. So anybody who can put off their hip surgery until January or February, the hospitals need to be asking their surgeons and those patients if they can reschedule those. As our numbers go up, that won't become an option anymore. They're going to have to do that. We'll have to look at the hospitals to eliminate all non-emergent clinical services, reallocate resources to inpatient care into the emergency department, and ultimately, if the numbers continue to increase and put pressure on the hospitals, they'll have to be asked to reallocate all of their workforce that are administrative or outpatient services into the environment. And that essentially leads us into a crisis care management process where people will have to decide, the ethics committees at the hospitals will have to decide who gets traditional beds, who gets surge beds, which patients get ventilators, which patients don't that sort of approach to crisis care. Right now, we have plenty of ventilators in the hospitals. Several of our hospitals have asked for additional, but small cash available that we can deliver just in time. We're working with the state to bring in more that are on a permanent basis. So that's the end of my slide presentation. Just a couple of more notes I'd like to go over. We talked about the census being part of our current seasonal pressures, and I think that's only going to continue as we go through. We're seeing the surge now. We have the rest of the winter holidays coming. We have the first of the year coming. I don't see the graph coming, just based on my own experience and looking at the numbers. I don't see that I don't see the hospitalization rates are going to go down for COVID anytime soon. So what we can affect is the hospitalization rates of other types of patients. That's what we're going to have to help with the hospitals to focus on. Some good news is the state announced that they're going to open the Sleep Train alternate care site this week. We expect it to be open tomorrow. If not, but at the latest, it should be open by Friday. That should help the hospitals discharge patients that require skilled nursing level care. And if any of our skilled nursing facilities become impacted, that would also give them an opportunity to discharge a certain class of patient to that facility. The state has acknowledged that they've learned some lessons from when they tried to open that over the summer. They're bringing in more experienced staff to help manage that with physicians on site. They bring in what we would consider traditional skilled nursing facility type services like physical therapy and some other services to make that site actually a lot more functional for the hospitals to actually have an option to. I did mention CDCR. CDCR statewide is an area of concern for myself and most of my colleagues. Right now, the Department of Corrections reports 5,543 active positive COVID inmates statewide. Locally, CHCF in our own county has 22 positive patients. On their website, I spoke to them this morning, they upped that number to 24. Dole is reporting 12, and in Ione, just across our border with Amador County, Mill Creek State Prison reports 477 positive inmates, which could negatively impact our area for hospital and healthcare resources as a potential. That's why I bring that to your attention, why we're so engaged with CDC.
And what's the total population in Ione of Mule Creek?
I don't have that off the top of my head, Madam Chair.
I'm just wondering what the percentage is of their population that's now positive.
I don't.
Because it starts to go exponentially the more the percentage goes up.
Which is why that we've been actively engaged since last Friday with CDCR on trying to mitigate impact that their patient population may have on our community. There's a lot of moving parts that go with that. The other thing that we're working on right now is we've granted authorization for Lodi Memorial Hospital and Dameron Hospital to utilize paramedics as part of their inpatient staffing. We're working to direct resources to the facilities, paramedics and others. They can utilize paramedics normally paramedics are barred from working within a hospital utilizing their scope of practice. The state has given us permission to utilize paramedics within the hospitals during the pandemic, and both of those hospitals have requested those resources along with nurses and respiratory therapists. We're working to obtain those resources from the state. We also are working we have a small list of disaster healthcare volunteers that we've reached out to see if they would be interested in paid assignments with those hospitals, and we're referring the people that responded to that request directly to those hospitals for. San Joaquin General also reached out to us. We expect them to be putting a staffing request in today that we'll process with the state, and also begin working with them on the types of staffing that we may or may not be able to utilize within that facility to assist them as well. I think in speaking with the staff at SJGH, it looks like they need more LVN and medical techs than anything else, just to help with just the pure number of patients that they. But we'll be working on that. And then we touched on this just a little bit. I think one of the things that we should emphasize more than anything else is engineering in our workspaces. As you can see, what you've done with your board, where you have screens to separate. We typically, I know there's efficacy on masks, not wear masks, but if we stay 6 feet apart, we have engineering controls in place, we're properly washing our hands. Those are the best items that we can do to keep everybody safe, and we need to keep that. I think a blanket picking winners and losers in the economy is the wrong approach. It's the approach that the governor has taken. I don't know what we can do about that, but I think that there are action items we can take. That's my report. I'm available for questions.
Thank you. Any questions for Mr. Birch? Supervisor Patty, do you have any questions for Mr. Birch?
Thank you, Madam Chair. A real quick follow-up, Mr. Birch. You just said you think there are actionable items. Is there anything additional to what you've already shared that you feel would be actionable on behalf of the county?
I think we should look at doing better partnerships with our faith-based organizations, and I can't think of a more interested group in being able to want to meet and congregate with each other, and I think there's ways that we can work to help them. I think one of the things that we didn't do with them right off the beginning is we didn't offer them testing every Saturday and Sunday and Wednesday night that they wanted to meet. I can't think of a more reliable partner within our community that could have helped us do testing. And we could have brought testing resources directly to them as a way of helping to keep those organizations open. But I think there's strategies like that we just haven't brought the full measure of the county to bear on that we could start looking at. That's just one example.
Would you, by all means, if you've got several of them, you can either share now or detail them and present to the board. What about the idea, I had brought up expanding our emergency, our ICU capacity, and then Chair Miller had pointed out that it's more of a staffing shortfall than anything else. Is there a possibility that we could construct a 60, 80, 100 person ICU unit with an external sprung structure, something that with staffing would change our numbers so we could start to alleviate some of these restrictions?
Supervisor Petty, I think that's an excellent question, but we have the space within the hospitals, and our surge plan has always been to expand the space within the hospital itself. It really is a question of working with the hospitals to obtain the necessary staffing or to change their engineering processes to create the staffing environment in which we can do that safely within the facility. I don't think any of the hospitals need additional stand-up facilities to create bed staffing. I know some of the experience in Fresno County where they had a federal medical supply site that they stood up. Essentially, the hospitals in Fresno County ended up basically cannibalizing the resources and equipment from that federal site because it didn't make sense to stand it up even adjacent to a hospital when there was space within the hospital itself. It's really a matter of do we have the staffing to take care of the patients?
Understood. So then, on that note, just several weeks ago, we had a strike out of the general hospital, the county hospital, and we hired staff to come in for a period of time. Is any such service available that if we were to bring in 200 additional staff on a weekly basis, would that help alleviate the lockdown that we have? Like what measurable action could we take that we could utilize some sort of resource that might be at our disposal?
Each of the hospitals have been reaching out to their staffing registries to attempt to find nursing personnel. I have to commend our county hospital and their administration for actually getting in the front of the line and obtaining registry personnel to keep the hospital up and moving and to be able to meet the demand that they have. Really, I don't think there's a lot that we can do directly to bring additional personnel into the registries that the hospitals themselves aren't already doing. It's really about how can we work with the state to obtain the waivers and to make the engineering changes and process controls within the hospitals to use what we have to accommodate the patients that are going to come. Unfortunately, I don't think there's anything we can do to lower our ICU metric to be able to reopen the economy. I just think it's a bad metric.
Yeah, I appreciate that that honest assessment. That's very daunting for us throughout the county, business owners, and of course for parents and people that are looking to keep a job and pay their rent and so forth. I honestly, I'm turning to this board, but we need to have a discussion on what actions we can take to alleviate this inevitable crisis that's just exasperating and expounding and compounding on a daily basis, to say the least. I do have a question through the chair. I'd like to ask County Council. A couple of people have contacted me about enforcement warnings and penalties coming from the county. I'd like to ask County Council, what measures are we taking? There are some places that are saying I'm staying open. What measures are we taking, not taking? What authority has been exerted to try to get people to comply?
That's an excellent question, Supervisor Patty, and one that I had queued up to ask, given the current situation where we see that a number of businesses are saying that they are going to stay open, is to seek direction from the board on how you wish us to respond. And it's not that respond in the vein that we're going out looking for businesses that are staying open, but we receive a number of complaints from the public who are seeking, who are reporting that these businesses are open and saying, what is the county doing about this? What I can report that we are currently doing is that I'm aware that the sheriff is responding selectively, and that their goal is to go out and provide education. The sheriff is here in the House and can respond to that himself, but they're going out to provide education where there is a violation. Some of the reports come through my office. We are also, making calls to businesses. Sometimes it's more than just a COVID violation. There are some other business licensure issues or permit issues that are addressed through community development. And then we've been asked by both OSHA, the Occupational Safety and Health, as well as ABC, to provide information when we're aware of licensed businesses that are in violation and where the report should fall under their purview. And my understanding is that both from ABC and from OSHA, I believe, they are just doing the education as well.
Understood. And just for clarity, are we at this time in the county, do we have any type of financial penalty mechanism? And it's just for clarity, because I know several weeks ago, if not 2-3 months, this had come up as a discussion point with the board, and we as a board had said no, we did not believe that we would need to or should enforce any type of fiscal impact against somebody that was not complying at the time. Has that changed in any capacity?
It has not changed. Some of the cities have adopted a tiered response where they go either 2 or 3 levels of response, with initially an education outreach. If there's a repeat violation, then there is a warning, and then ultimately there is, in some instances, a citation is issued by the cities, but the county has not taken that action.
Understood. Well, and just to close the loop on what you had brought up is, if we were to bring this up and have a discussion, right now is the appropriate time. I will reaffirm that I do not believe we should be engaging in any type of penalty, nor should we even report them to any other state agency. If a person is operating and trying to pay their bills and their rent and child care and take care of their job, and they are doing so with all safety measures and precautions put into place. A person that finds that offensive, stay home. A person that wants to report that, mind your own business, in my opinion. If a establishment is willing to serve the public and a member of the public is willing to take the assumed risk and enter into that place of business, I support it. Just like I support Gavin Newsom just a few weeks ago using his own freedom of choice to gather with associates and friends and family and whoever he wanted at a public restaurant to support that restaurant, participate in an evening of dining at that restaurant. That's a great American opportunity and freedom of choice, and I support that. And I believe here in San Joaquin County, we need to support people's freedom and individual rights and their willingness to support a business and also provide services to the community, because I do believe all jobs are essential. Every single job is essential, otherwise it wouldn't exist. We should not be dropping the hammer on anyone. And that's my take on it, and if that needs to be an actionable discussion item through the board, but I want to be very clear on that I believe we need to be supporting, not penalizing local businesses.
I appreciate that, Supervisor Patty, and I appreciate, I'm looking for direction from the board generally on this matter. I think that a point of distinction should be made that in many instances, you're right, the businesses are following all of the other protocols, but they are saying, we're going to operate. We have bills to pay just like everybody else does, and we need to be open. However, we do receive a number of businesses or a number of complaints of violations where it's not simply that the business is staying open, but it's a conglomeration of the business is open, people are not wearing masks, whether you agree with that or not. There's the absence of hand sanitizer. Oftentimes there are reports of employees who are COVID positive who are still remaining at work, and the employer's not taking any action to stop that activity. And so I think there are some nuances that's the type of, or we're looking for guidance on those nuances. Is there a level of risk or a level activity where the board thinks that it's appropriate for us to, whether it's should we continue the phone calls and the letters, or is there a level of risk and activity where the board says that kind of crosses the line and something more should be done at that point?
Thank you, County Council. And my closing thought on that is I will appreciate and support all levels of safety and protocol that would be from hand sanitizer to masks and face shields, and you name it. Let's run the full gamut that we have seen our private businesses and people at work are willing to do just so they can go to work and serve the public. So I think those are great guidelines that have been identified through the efforts of Dr. Park and through CDC and through a multitude of best practices that I believe we should wholeheartedly embrace, support, and endorse the utilization and warn that these are the bare minimum requirements in every and any capacity, whether you are essential or non-essential as a business. These are proper protocol guidelines that should be adhered to.
Thank you, Supervisor.
Thank you.
Anyone else? Supervisor Wynn?
I understand where Supervisor Patty's coming from, and I probably maybe have the sheriff come up and after Mr. Birch is finished and talk about it. But we have had this discussion, and as County Council has commented, the Sheriff's Department, Code Enforcement are different departments that enforce a variety of ordinances, regulations, and statutes. I think are extremely well qualified and competent to deal with this particular issue. I think from a law enforcement standpoint, what I've found is that officers and deputies have a range of options available to them to deal with these situations. And as in any other law enforcement activity, it starts with a verbal warning or an education. It escalates up depending upon the severity. And I would ask the sheriff when Dan is finished to talk about his deputies in regards to it, because it's very easy for us to sit here, or the governor to sit in the Capitol and talk about enforcement. I don't think he's ever written a citation. I don't think he's ever arrested somebody and taken them to jail. And deputies do that on a daily basis. And I think that they're well equipped to use their discretion and judgment on how best to deal with these particular incidents. And the reason I say that is because unless you're there viewing it firsthand, I mean, you can speculate and you can surmise and theorize until the cows come home about what a deputy or an officer should do out in public. But I would say, and I had a discussion with the city manager just last week about this issue, and they are taking action with their police department. And I guess my point is that I think it's important that we trust our various department heads, certainly our enforcement officers in all departments, to do what's best. And I think, along with what County Council is saying, I think it's pretty clear that they will do what's necessary to protect the public. But on the other side of it, I think they also understand the need to educate and to inform. And I would leave it in their hands to make those decisions on an individual basis, because as was mentioned, it can be a totally different incident that has a multitude of violations that need to be enforced, as opposed to just the fact that they're open. So I would leave that discretion to our enforcement employees and let them deal with that. So again, I think it's been discussed. I think, and I would again have the sheriff come up and talk about his experience, because he deals with his deputies on a daily basis. But I think we're in compliance. And one thing to keep in mind is that law enforcement, or any type of enforcement, is not designed to punish. It's to encourage compliance with the laws, however that comes about. And if it works at the lowest level in regards to educating or informing or providing literature or whatever it happens to be, and it accomplishes that goal, that's fine. If it requires more stringent measures, maybe to the point of, as in other states you've seen, maybe people being cited or whatever, that's up to the individual deputy or officer on the scene. So again, I would defer to our departments to act appropriately, because I think department heads, the sheriff, for example, I think are perfectly capable of giving instruction to their staff in regard to how to handle these situations. I know, Dan, I know you come. I do have a couple of quick questions, though, in regards to what's been brought up in regards to staffing. When this all started, we shut down hospitals, basically, and a lot of those hospitals dismissed their staff. I mean, they laid off, a number of workers. And I guess my question, have those workers been rehired? Because I know some of them move on to other jobs, maybe to other counties. Have we recovered from that loss of medical staff to date?
Supervisor Wynn, I think that's a good question. I think most of the staff that were furloughed or laid off from their hospitals have come back to work. But has occurred, though, throughout this process is a lot of people have left the healthcare industry overall. And so there has been a mass, I wouldn't say a mass exodus, there has been a net loss of healthcare workers throughout this process through just what's been asked of them at this point in time, COVID fatigue, getting sick themselves, caring for their own relatives and loved ones. The process has had a toll on the healthcare. I think there's just fewer people available. And so now it's really working with our healthcare partners to do the best we can with the resources that we currently have available. And so I wanted to speak to, really I have probably two comments I'd like to make about priorities right now. Given the current state metrics, I think it's a fool's errand to try to create artificial process to reopen. I don't think we can. The governor's just going to make another move and change the goalposts, as we've all talked about. So there's no point trying to create additional fake ICU beds or capacity just to meet that arbitrary metric. I don't think it's right. I think what's going to get us out of this pandemic is a vaccine. It's almost here. We need to put the entire focus of the county's resources into making sure that we manage that vaccine program efficiently and effectively, and not one dose goes to waste and not one day goes to waste. That would be my priority for the county.
I don't disagree with that. However, one of my concerns is that we've all gone to businesses. For example, barbershops, and I'm sure hair salons and nail salons and those types of personal service operations, they are probably some of the most sanitary businesses you could go into, and they still are. And my point is that as with restaurants and a whole bunch of other businesses, my question, and I don't know, and maybe Dr. Park would know or Mr. Diedrich would know, but the question is, did the governor, has any politician, for example, had an opportunity to really sit down with businesses? Because I see the protocols when gyms were allowed to be open, the extreme measures they went through to make sure that people didn't contract this disease. And I guess my question is, it seems to me that businesses have bent over backwards and expended thousands and sometimes hundreds of thousands of dollars to allow to continue their operation. And it seems just a wave of the hand to be dismissed as to the simplification of the solution to the problem, which we have no control over. I mean, I understand hand washing, and I understand social distancing and all. That's an oxymoron, by the way. But the question is why haven't we invested more time and effort in dealing with our businesses? Because they want to comply, and I haven't found, and I have to admit I don't travel everywhere, but I haven't found one business that I found any violation. In fact, what I find is businesses going overboard with hand sanitizers, with sanitizing their tables, equipment, et cetera. And I guess my question is, why are we doing all this when, in fact, it's going to happen no matter what we do? We just delay the inevitable. And that's my concern, is we're spending a lot of time and money and effort and anguish in regards to something that changes all the time. And you're right, I understand that. However, I do think when we had this in the past, we had military assistance. They had hospital ships in LA. They had these things. I do think there's an opportunity to work with the medical establishment to provide for that potential spike that goes beyond even our expanded capacity. I think that's where we need to focus. And I was reading one thing. It talks about disinfection of ultraviolet germicidal irradiation equipment. And especially in nursing homes or places that have a susceptibility to higher contacting of the virus. These are things that I think we ought to be investing our time and money in, this type of equipment, to really focus on the protection of those who are most at risk, as opposed to doing all these things on all 40 million residents of California. We need to target our emphasis and certainly our resources on those. So again, I appreciate, Dan, I appreciate your comments. Thank you.
Thank you. Go ahead.
I agree with a lot of what you had to say about we can stay open. I haven't seen any statistics from the governor or any other peer-reviewed journals where it says that people are at higher risk of getting COVID while they're getting spa services at a pedicure or a manicure or getting their hair cut versus going in and buying groceries. So it's a false metric. It's a false equivalency, and I think the state has made a mistake from the very beginning on asking us to treat people differently. Because I think we can safely do disinfection, put engineering controls, and if we ask people and give them the tools, we ask people to do the right thing, and we give them the tools to do the right thing, I think they're more than happy to do the right thing. And we haven't been able to focus our energies on that. The one other thing I'd like to point out about the ICU metric is the ICU metric, in comparing and adding that to the economy, is going to hurt patients. because there's now a disincentive for a hospital to accept a patient from another county or another region or an open hospital bed because they don't want it to count against their metric. We saw this early on in the process when we were doing test positivity rates for patients out of county, and there were a lot of counties, ours wasn't one of them, I'm proud to say, that didn't do that. Because I thought every positive patient's a patient, meaning we're going to treat them. But they actively worked not to accept transfers from other counties because it would hurt their opening metrics. This is the danger of tying healthcare metrics and healthcare resources to open the economy. It disincentivizes helping people in need, and I'm absolutely against that.
Thank you. Supervisor Elliott?
Yes, am I unmuted?
Yes, you are.
All right, thank you. I think there have been several good points made. I agree with what Mr. Birch said, that we should focus our efforts and resources on making sure we get this vaccine distributed and administered as efficiently as we can. And then there are other comments that were also made that the Supervisor Wynn had a good suggestion there that we could focus our efforts on some of the measures that can be taken in those facilities that take care of our most vulnerable people as well. At this point, with there've been several comments made about the moving goalposts and all that. They're going to just keep moving, I'm sure. So the things that we can most do, the greatest actions that we can take to do the most good, are what we should try to do. And then, just as a matter of principle, we should push back on the governor every chance we get, so that we don't get these silly policies that are contradicted by others in the healthcare profession, as saying that there's no reason to support doing such things, such as restricting outdoor dining. I mean, we should push back every chance we get and then focus our efforts on those things that we think will do the most good, such as administering the vaccines and taking care of our most vulnerable people. Thank you.
Thank you, Supervisor Elliott. Supervisor Villapudua?
Thank you, Chair Miller. My question is for County Council. What are the ramifications if we were to let the restaurants and businesses open as far as in county and cities? Do we have control of the cities, and can we tell them they can open?
I don't know that there's clear direction on what will happen. I know that what the state has said and what we have seen in other instances where the municipality, usually cities, have taken a position where they declared themselves, quote unquote, a COVID sanctuary, if you will, allowing businesses to operate in violation of the order without taking any action. And in those instances, they've promptly received a letter from, I believe it's state OES, notifying them that a portion of their funding is at risk. We've looked at those dollars, what would be at risk in this county in a similar situation, and it's funding that the county uses to pay for general service, general fund type departments, specifically law enforcement.
Okay.
So, and I don't remember the numbers, but Ms. Nino probably does.
I believe it's close to almost $30 million. A portion of it relates to $17 million we received in state CARES Act dollars. And then I believe there's another 13, Supervisor Villapudua, that related to additional realignment dollars. And those additional realignment dollars, and Mr. Miles is very accurate, those CARES Act dollars do assist with law enforcement, but they've assisted us in utilizing those funds for room key. Some of the various things, Mr. Birch mentioned about testing with our nonprofits and our religious sanctuaries. Well, we already started doing that back in August with Housing for the Harvest. We contracted this board, allocated $750,000 towards Catholic Charities and the Community Foundation. There was pop-up clinics Saturdays and Sundays at various Catholic religious facilities. And so those dollars would be at risk. And I believe it's every month I sign an attestation that goes to the state of California, essentially saying that our county is in compliance with the state imposed health orders.
Okay. So it just concerns me that other counties, other restaurants, and other businesses are staying open. I'm wondering how they're doing it. And there's a lot of businesses here that are suffering, and their employees are going home for the holidays, and they need to make income, and they have bills to pay, and most restaurants are hurting. And I feel like we have to do everything we can to support them. They're the lifeline of our cities and counties. So it doesn't make sense that they're not even allowed to serve outdoor. I mean, they're doing everything they can. I've been to several restaurants, and they're practicing safe measures. They have, from what I've seen, they've had they're doing everything they can to support public health. And for them to close down, it's tragic. So that's all I'm saying.
Thank you.
Thank you.
From my standpoint, in terms of the enforcement, I agree with Supervisor Wynn that our law enforcement officers, if the goal is compliance, is for people to follow the public health orders, to keep their employees and their customers safe, then our officers are both our code enforcement officers, our sheriffs, deputies. They're in the field. They're in the best position to decide what's the best way to get compliance. And if that's the goal, I think our most sensible approach is to empower them to do that. It's my understanding from the sheriff that in almost 100% instances, taking that attitude of education with the various businesses has resulted in compliance. And if that's our goal, then our deputies are doing a good job of meeting our goal right now. I do think there's a difference when we are receiving complaints from employees who are in a position to see far more and experience far more than the general public is, certainly more than somebody just driving by a business and seeing that there's folks eating on an outdoor patio. And there's laws in place. I mean, County Council mentioned OSHA. There's laws in place to protect workers from being put at risk and being harmed on the job. I think that if we receive those kind of complaints from the public about actual safety violations, then I believe we have an obligation to handle those as we would, whether it's COVID or it's any other health and safety violation. I think those employees have a right to that. And I think they are protected by law, and I believe County Council has a legal obligation, if I'm not mistaken, to report that to the various oversight agencies, whether it's state licensing or it's ABC or whoever it is. It's my understanding that we have a legal obligation to do that to protect people. So I support following those protocols and the law and making sure that we are protecting workers. I think Supervisor Patty basically said the same thing. The vast majority of these businesses want to comply, are complying. But for those that aren't, I think they do need to be first educated and then warned. And I do think it needs to be reported if that's the legal process.
As to the legal requirement, the state has asked, they have made somewhat of an enforcement team available consisting of OSHA personnel as well as ABC there. And they have asked for us to provide them with that information. There may be a legal requirement under the health and safety code, under the state's health orders. I'll have to look at that.
Okay. I just think that, you know, if health and safety and compliance are our goals, then that's the direction we should be coming from. And if education is the most successful way to secure that, then that's certainly, I think, where we should start. But I don't think it should be, hey, you're not requiring your wait staff to keep their masks on when they go to the back of the house, which I have personally been told by a couple of employees is happening where they work. I think if that's the case, I think we also have an obligation to those individuals who have to work to support their families and be there, and they should have an expectation that their employer and their workplace is going to be safe for them to do that. And so I think, I mean, I'm not advocating we send in undercover people. I'm talking about when we hear from employees and members of the public that feel that their health is being placed at risk. I think we need to also represent those folks. So that would be my input on enforcement. Okay, thank you, Mr. Birch. We appreciate it. Before we wrap up this COVID, I have just a couple of questions, and I think maybe this is probably for our CAO. First of all, in terms of working remotely, I believe that was part of the new order, correct? That employees should work from home if they can. Am I correct in that regard?
Mr. Miles, did you want to share that section?
Certainly. So the order does say that employees should work from home. They create as the baseline, right? Stay at home as the baseline, with the exception for critical infrastructure, to the extent that it's necessary to leave your home to provide that service. So I interpret that language to the extent that it's necessary to mean that if you can provide that service or if you can work remotely, that it's the expectation of the state that you do so.
Okay, and so my question is going to be, what are we doing? I mean, we're the single largest employer in the county, and so what policies are we implementing? I know we had a lot of talk in the beginning about how we were going to do this when we did send the bulk of our workforce home. I know each department made their own list of who actually has to be on site, how often, all of that kind of stuff. And we were also looking at how were we going to fund all of this. So I also know that we got huge allocation of CARES Act funding, and a very, very large portion of that went to, we were able to shift a lot of our law enforcement costs that had already been budgeted. They were now considered 100% COVID related and were 100% reimbursable, which in my mind means that all of the originally budgeted money is now free to be utilized as without those same restrictions, since it's now San Joaquin dollars.
You're correct.
We can reallocate those dollars in a way that that we feel is most appropriate. And so that's one of the things I want to ask about is how do we provide for a larger percentage of our workforce to work from home? How do we make sure that our budget is kept whole? And then going forward, there are an awful lot of other things that are expiring the end of the year in terms of, and I'm talking about both for individuals and also for our businesses, for rent relief. There were a lot of things that we have budgeted for that, and people were getting reimbursement from the federal government, the state government. That's going away. So I would like a little bit of input on that. First, on our own workforce, and then secondly, what are some really concrete things we could be doing for our businesses? if we can't move the state in terms of, I mean, we just heard from Mr. Birch, it's unlikely we're going to be able to move out of this metric that's based on ICU beds until probably February at least. So what are some concrete things we can do to help our businesses weather this next 90 plus days?
So you're going to hear today about our first quarter report, and you're going to hear that there's a much more significant year-end fund balance as a result of being able to reimburse not just public safety salaries, because the U.S. Treasury loosened the guidelines probably about that September timeframe, but also public health, which was where its initial intent was, but even gave us greater flexibility. So you are going to see the benefit as a result in the county general fund as a result of saving those dollars within our existing budget, and then some. But you're also going to see, not just today, but also next Tuesday on the 15th. So for instance, this board has received requests from Gospel Center Rescue Mission because that COVID particular protected area within that low barrier shelter, that funding was running out. So you're going to see the request from staff to utilize contingencies. Some of those items, both for extending our room key, because we've received some money on room key, not enough for the millions of dollars it has costed this county through the CARES Act dollars, but those dollars have come through the department reimbursement. So for instance, we put as part of first quarter today, the roughly over $19 million of the CARES Act dollars that went directly to the community, whether it was for reimbursement of business related expenses, PPE, what we're proposing to do on behalf of fire districts, what this board proposed to do on behalf of hospitals. So you will see that. So I'll go now to our current employees. So I spoke yesterday to our human services director. I spoke to our assessor. I spoke to our treasurer tax collector, because I was very worried. This Thursday is property tax day. And so what are we doing from a lobby perspective? Because a number of our departments are taking full advantage when they can from that 2-day telework. And if you have employees that are 75% out of the office, it's a 3-day telework situation. What we aren't receiving is that additional 2 weeks of HR 6201. That was money that we were reimbursed for those 2 weeks. That qualified, so people didn't have to use their sick leave. People didn't have to use, their accrual times. So that is not continuing after December. So to enhance more stay at home, right now, what we're trying to do is provide our departments with data. What has been the level of productivity of our folks that are teleworking? What has been the level of accrual use? Has it gone down as a result of this additional telework? Because people are scheduling their time. It's more convenient to deal with their child's doctor's appointments because they're, online learning. So, they're not having to have that commute time down to the office. So we are getting that data available for the departments, but there has been roughly, and I'm looking at HR, if Ms. Hopkins could come down here, I believe it's roughly a third of our employee population that has utilized that 2 weeks. And so if it's the pleasure and the direction of this board, you want us to implement a greater level of telework, as long as there's some level of accountability, I would encourage this board to consider from a productivity perspective, we can do that. But what has happened is the pleasure of this board wanting to close down our building to the public. There's been a lot of customer service that this county has been able to deliver as a result of us opening, which was very different than what our cities did. And I believe it has sustained us to do that, especially because we're ultimately here to deliver those services effectively. So when we did open up back that early May timeframe, a number of our departments, like our Human Services Agency, they reduced their lobby entrance to less than 20%. Our assessor did the same thing in the recorder's office. Our treasurer has maintained that in the treasurer tax collector's office. So some of our high traffic areas our departments continued to maintain, when we reopened in late April, early May, less than a 20% public traffic for the protection of the employees, but also the customers. So if I received direction today from the board that you want us to close down again, that was not what I was going to be recommending today. So does that help you as far as kind of some context of what we're trying to achieve?
Yes, yes. And so what you're saying is to increase remote working, that would entail closing down.
It may.
Okay.
So we could ask, because when we originally closed down, we didn't do any survey work to say, you know what is this going to do to your service delivery? Thank goodness, we not only just look at our service delivery, but internally. Thank goodness we were already really successful in rolling out online time cards. Mm-hmm. All of that technology enhancement that we've been doing for the last 12 to 24 months has brought major benefit to the telework community and our organization. But we just shut down because we were told to shut down.
Right.
A number of counties within the various regions are essentially not necessarily shutting down, but they are enhancing telework. Some of them are.
I guess from my standpoint, and I'll ask the rest of the board, I'd want to see some of that data.
Okay.
I wouldn't want to just make that decision today on the fly.
Okay.
I'd like to know exactly, I'd like to have a better idea of, as you increase telework, what's the level of decrease in access to the public, and what are the impacts in terms of service delivery?
Okay.
Maybe we're already at the sweet spot, maybe we're not. Maybe we can increase it somewhat. But from my standpoint, I want to balance that with the public's ability to receive the services that they need. Now, if they really don't need to access folks face-to-face, that's information we need to have so that we can make those decisions. And I think our department heads are in the position to help assess that. And hopefully they're going to incorporate input from their staff as well.
So the Ag Commissioner had a really good question relative to, because there's some permit issuance requirements that he has that are coming into play where they need some face-to-face. And so they were asking about changing their operating hours, which typically requires board approval. So maybe when we do bring it back, and I don't know if HR will be ready by next Tuesday to maybe bring something as part of COVID, to bring some of that data, and maybe at that time the board could consider delegating to the department head some of that authority to change operating hours so it's conducive to both employee safety along with customer safety, but still needing the needs of the community, especially when we start hitting some of these seasonal activities. Would that be something that the board would?
Yeah, I think so for sure. And I think perhaps we can also look at, some of the things Mr. Birch was talking about in terms of engineering. Are there additional things that in some of our departments we can do, install, put protocols in place that would enable some folks to still interact with the public but increase the safety level from where we're at? Maybe there isn't. Maybe we're already there. I don't know. But I think that's something that that the board would want to consider, because obviously we want to keep our employees safe. We also want to keep the public safe. But a lot of folks don't have the ability to access these services online. They either don't have Wi-Fi, they don't have computers, they simply cannot do it, or they don't have the technological information they need to be able to handle that on their own. And they need to be able to interface with the county in a more direct way. I want to make sure that we're not cutting people off from critical services. That makes sense to the board? We'd want a little more information before we decide.
Well, I don't know if the governor's saying, the numbers are so bad and our employees feel like they're at risk. I think maybe this telecommunicating thing is working. So if they feel like they're safer, then I think we should make them feel safe. They're our employees, and if they want to stay home and we need to close down for the next 3 weeks, like the state is, and I think it makes sense that they telecommute and try to stay home. And if we need to close down for 3 weeks, we close down. Maybe the month of December.
So just to share a little bit of data relative to transmission of the infection within our own organization, I've got to recognize the department heads and staff. They've done a phenomenal job. It's been extremely limited, primarily within the hospital, of course, within our healthcare workers, of course, that has happened, and then some of our criminal justice facilities. But otherwise, it has not, the infection that has happened, it's primarily that the employee has brought it to work, and it's come from outside the workplace. So early on, we have done some very good measures, activities to protect our employees. But it's whatever the pleasure of the board is. So we have not experienced transmission within the workplace very rampantly at all within our organization.
But you're saying transmission in the workplace that's caused by the public. What I don't know about everybody else, but what I keep hearing from our employees is exactly what you're saying. It's other employees who are bringing it in, but they're becoming infected at work. So that's why I'm asking, are there additional protocols that can be in place? Where's the right amount? And I don't know that we can get there exactly, but I do think that perhaps we can increase the amount of teleworking and still be able to provide services to the public in a way that will help keep our employees safer. I hate to hear that they're afraid of their coworkers, but the reality is most of them do know. They got it from somebody who came in and then they found out that they had it, and they were, and that's how it was transmitted. So I do want to find the balance, and if we need to apply some of these additional resources, I would just like to get that information. And from my standpoint, I think the safer we can make our employees while still delivering critical services that the public requires, that's, from my standpoint, that's where I would want to land. And if it takes some additional funding, then I think that's where we need to go. But Supervisor Elliott, did you have some input on this?
Thank you. Yes. No, I agree. I think we should take a relook at it here, increase the ability to work from home as much as possible, but then keeping in mind that we still do have the requirement to provide the services that we're here to provide for the public. So we just need to do the best we can to come up with that balance that will keep the essential services coming, but allow for the amount of working from home.
Okay.
Thank you, Chair. I was wondering why, I have a lot of faith in our department heads, why can't we give them more authority as far as letting them run their department, and if they need to send their employees home, if they feel safe, give them some power.
That was kind of where I assumed we were going to be getting the information to us. They'll route it through our HR department. But yes, I agree. I think our department heads have that ability to know. And I think if they understand that our priority is we want to increase it as much as possible while still delivering critical services, that's where we're starting from. I think if they understand that, I think they'll be able to put that information together for us.
Exactly.
Yeah. And so what I'm hearing, the direction is that we'll bring that back to the board. The direction isn't to go distribute it and give that authority now, but bring it back to the board on the 15th? Or do you want to go ahead and give that authority now and, like the example I used with the ag commissioner, give them the discretion to be able to, be open based upon their demand for service if it's face-to-face, and then do whatever telework they need to do?
I'm okay with.
I totally agree. I have a lot of faith in our department heads. They're all competent and they're looking out for their employee safety. So let's give them the authority to manage their employees.
I don't disagree with that. I think that the only thing, and I'm not suggesting we do it, but there has to be some consistency in regards to the guidelines on how we do this. I think first, obviously, is the protection of our employees. That's first and foremost. But there's departments that you can't telework, like our waste management, public works, departments like that. And then there's other departments. And I guess I would agree with Supervisor Villaputa that leave it to the department heads to make a determination. But if there is a particular service that the public absolutely needs, to survive, whether it be, human services or whatever, or our health department. But again, I think that we need to look at those because the governor does talk about essential services being available. So I would agree with those, Chair Miller and Supervisor Villaputa, give department heads the authority to make those decisions, but they need to be consistent in regards to I guess the importance or the necessity of working in the office, so to speak, or in the building. One thing to consider, though, when we talk about lack of online ability, I know that maybe we can provide some satellite offices where individuals can come in and have some coaching or assistance in regards to, because I know the library, I don't know if the libraries are going to be open, but I know libraries have computers and they provide that service. But certainly anything we can do to assist the general public to communicate online and receive whatever service that they require, well, at least we ought to look at that and see if there's any options out there. Because, for example, in my district, you can go all the way to Lodi, you can go to Thornton, you can go to a lot of places. And if they had the ability to go online and receive that document or fill it out or whatever, I think that would be important. And it would also protect our employees and again, not require them to drive it, because part of the problem that in my district is transportation. How do you get there, especially in these times? So again, I would leave it to the individual departments, but I would think collectively with ISD or whatever, that we come up with some creative ideas on how we can expand our reach to our public without having them come down to this building or go to one of our satellite offices.
And so I want to make sure, probably where the consistency would be extremely helpful to myself and the department heads, is what I'm hearing, you're hearing loud and clear. We don't want to shut down for these 3 weeks. We want to set up a situation where we're still delivering services, but yet if we can enhance the telework ability within our respective departments and continue to provide those essential services. Because we have received questions about shutting down, as we did back in March, and I would discourage this board from going there. So did I hear you correctly? Okay.
Right.
Okay.
Can I add something, Chair Miller? Can I add something?
Yes.
I just think that every department head should have their own policies. That way it increases accountability. That way there's no, inconsistencies. And let every department head make their rules as far as who gets to go home and not, and so forth.
So Supervisor Villaputa, I appreciate hearing that, but at the same time, I think it does create some level of inconsistencies. And so what I'm hearing, I'm trying to take in all of what everybody is saying. We may have to develop, and I'll work with Brandy, because we'll provide, what kind of leave times have already been taken from staff. Because what we end up also worrying about is when people start falling out, losing leave. You know what I mean? And so how can we help them to assist them in managing that also? So if we could find some kind of, I want to say, ground rules, and then the department heads could go from there. We'll see if we can, but if not, I appreciate hearing that the board is very supportive of having the departments come up with some, their operating rules.
Right.
Okay.
Supervisor Elliott or Patty, do either one of you have any comments before we wrap this up?
Yes, Bob Elliott. I tried to insert them just a moment ago. Apparently it didn't get through, but yes, I agree with that. The idea of giving more authority to our department heads to set up the policies that will work best for their departments. I think they're all capable of doing that. And I think Ms. Nino restated what we have said very well. I don't think we want to go ahead and just shut down, but we do want to explore ways to increase the level of telecommuting as much as we can. Thank you.
Thank you.
I concur. I'm good.
Okay, great.
Chair Miller, just real quick, if we could just cycle back briefly for the sheriff to close that loop on this enforcement discussion we've had.
Sure. Sheriff Withrow, could come down real briefly. Good morning. Go ahead,
Thank
Supervisor Wynn.
As we talked about, I just wanted to hear from you because I know you've been dealing with this with your staff and certainly deputies on patrol, et cetera. So if you can just, because we've talked about this before, I just want from you, because obviously your department is the largest enforcement agency within the county, to kind of give us your thoughts in regards to what you're doing, your deputies are doing, on enforcement, which obviously is a focus of the governor. But anyway, if you could share that.
Yeah, I really appreciate it. I agree completely with what you said. You've had a firsthand view of law enforcement through your life, and it's true. We've posted online, our stance on enforcement and educating. And as you can imagine, 25% of the people think we're not doing enough, and the other 25% think we're doing too much. Somewhere in the middle is most of our citizens here in San Joaquin County. So we're cognizant of that. And we try and be cognizant of that, not just with COVID issues, but all issues. It's a very difficult time for law enforcement all over the state to go through this because, they're, especially as sheriffs, we're constitutional officers, so there are constitutional issues being discussed here and that have not been settled yet. And so we're getting ordinances and direction from the governor's office and things like that are being brought into question as to legality. And yet they're enforced right now. And so we're trying to do that balancing act. And I think we're very fortunate here in San Joaquin County. And as you can see with our discussion today, we have a board that represents all these diverse opinions. And yet we're all kind of on the same page as far as, hey, we know everyone's suffering. We know this is a difficult time. We're trying to use the lowest level possible to gain compliance. We're fortunate. We have the county council who contacts me regularly and advises us of concerns that we get from our citizens or complaints. We go out and address each and every one of those. As you can imagine, when law enforcement shows up on scene, sometimes behavior changes as we're walking towards a door, and we're aware of that, but sometimes it raises red flags when we get the same concerns over and over again. The business owners have been fantastic. I personally try and contact a lot of our business owners when these orders start to change or we hear they're coming down the pike and they're going to change. I get on the phone and I start calling folks or some of the people who run like Lincoln Center or whatever like that so they can disperse information and get out ahead of this. And we are totally open to working as close as we can with our citizens. With the staffing shortages that we still have. We're still working through that 9 months, 12 months to try and get our staffing back up. We're very compassionate towards what our citizens are going through. Some of them are losing everything that their families have had for generations. So we are doing everything we can, and we are very fortunate. Every time we go and speak with folks, they understand. They understand our position. We understand the position they're in, and we try and find compliance through some middle ground there. When I have questions, I pick up the phone, and I'm on the phone regularly with Dr. Park, who clarifies stuff for us the best she can, because it's very difficult for her also in her position when these orders come down to try and decipher them herself. So, and right now, we're still looking for some clarity on this new order that just came out as far as our employees in our office. Ones that are in the cubicles now, do they have to wear masks constantly or not? And they're trying to decipher that. We're doing everything at our office, comply with these orders and figure out what they are, and work with the public to, in the softest way possible, gain compliance. But we will be very aggressive towards anyone who is intentionally out there trying to harm people, spread this virus. because of their own view on this or thing. We haven't seen it in our county. We've been very fortunate, but we've seen in other counties where somebody will go into a store and purposely start, coughing on food or that type of thing. We would be very aggressive towards anything like that. And I can only think of one instance where we got some pushback, and we compiled the facts that we had at the time and forward that to the district attorney for their review, and then they can disperse it out to the different offices that may be involved, maybe ABC when it comes to licensing and things like that, or other offices. So, but 99.9% when we arrive on scene and talk to somebody about a complaint we've received, they've worked with us great and tried to fix it and comply. And as with the employees, a lot of times, the business owners don't know about it. They've gone home or whatever. Manager's not on scene, and when we let them know about that, then they try and address those also. So it's just a difficult time, and we're doing the best we can to work with our community. You won't see me making some big speech on a video about what I am going to do or what I'm not going to do. My job, I've been hired by you guys and the citizens to go out and enforce what we've been given the best way we think possible. So that's what we're going to do.
Thank you. Appreciate that.
Thank you. Thanks for the update. We appreciate all the hard work of you and your entire team.
Thank you very much.
Chair Miller, I'd like to add something.
Sure. Supervisor Patty, go ahead.
Yeah, thank you, and I appreciate, I agree with Supervisor Wynn to kind of close the loop, and I appreciate the update from our sheriff. So for me, and as we've all expressed our opinions on this and where we should go through county council and such, but I believe that we should do the bare minimum as required, and as it relates to state agencies. For instance, there might be a business doing something, and I don't know that it's up for us to be the whistleblower. While we can inform, while we can meet with, while we can promote the health, safety, and in my opinion, and I'm uncertain how the rest of the board feels, but I do think we need to close the loop on this. I believe we need to follow the bare minimum requirements and not activate state agencies and drop the hammer and come down with heavy-handed threats when people are just trying to survive. It's winter. You're going to have hungry kids. You're going to have struggling families. You're going to have people losing their homes. I mean, the repercussions are going to be dramatic as we go further and further into levels of enforcement and hardship. So let's do our bare minimum, and let's not exasperate the protocol of enforcement, but let's go more with the health and safety promotion and protocols. Thank you.
Okay, thank you. We're going to move on to consent. If there are any items that any member of the board feels they need to pull, please let me know that now. Okay, then I am looking for a motion to approve consent items 1 through 32.
Motion to approve.
Second.
We have a motion and a second. Roll call vote, please.
Supervisor Villa-Pudua?
Yes.
Supervisor Patty?
Confirmed.
Supervisor Wynn?
Yes.
Supervisor Elliott?
Yes.
And Supervisor Miller?
Yes. So consent's approved 5-0. Okay, I think what we're going to do is we're going to go ahead and do our 2 scheduled public hearings because we have some folks here that have been waiting all morning on that. And then we will take about a 30-minute break and we'll come back for our discussion items. That's okay with everyone. All righty. So first up, we have a public hearing regarding the appeal by Kathleen Lippelt of the Planning Commission's approval of use permit number PA 1900036 of Enjoy the Journey LLC. And we're going to hear from Mr. Kwong, our Community Development Director, and John Funderburg. Oh, no, Jennifer Jolly.
Thank you, Chair and members of the board. I'm going to defer to Jennifer here for the presentation.
I'm just waiting for the PowerPoint to be loaded. Thank you. Okay. Thank you, Chair Miller, members of the board. This is an appeal of the Planning Commission's approval of a use permit to allow the change in use of a historical building previously used for assembly and military purposes to a current day community assembly building. The 2,900 square foot building is located on a parcel of land that has an existing bed and breakfast on it. And the bed and breakfast is referred to as Lock House, and the historical building that we're discussing today is referred to as the Lock Barn. This bed and breakfast is also a designated historical resource and has been in operation since 1997. On September 3rd, 2020, this project was approved by the Planning Commission on a 3-2 vote. The use permit was then appealed by the neighbor who lives directly north of the project site. The parcel is located on the east side of North Elliott Road, 140 feet north of East Laird Road, in the urban community of Lockford. Although it looks like it's two parcels, this is actually one legal parcel with a general plan designation of residential low density. The parcel actually has two different zonings on site, which are AG 40 general agriculture 40 acre minimum and residential low density, which is the yellow. So this slide shows the project site where you can see both the bed and breakfast. The bed and breakfast is on the southern portion of the property, and the arrow is pointing to the Lock Barn, which is where the historical building being proposed for community assembly. Just east of the property line, the property drops off. There's a bluff there. It's hard to show you that part, but basically just east, there's a bluff and then drops down to an area that's used for agriculture. In addition, the parcel to the north and to the south also sit at a lower elevation than this parcel. Although it's a little bit difficult to read, this is the entire project site. The new parking for the community assembly is in the center portion of the property. This is a blown up version of that same site. There are two access points onto Elliott Road. The southern access point is an entrance, and it's just one-way traffic through the site, and it exits back out onto Elliott Road at the northern driveway. In 1858, the Lock Barn was built and was typically used for community gatherings and military purposes. On June 19th of 1972, both the Lock House and the Lock Barn were listed on the National Register of Historic Places. Originally, it was thought that the barn was built in 1852, but in 1994, the National Register was updated to reflect the construction date of 1858. This is a lot of dates I'm giving you guys, but I think they're important. On April 17th, 1997, the Community Development approved site approval number SA 97-12 for a bed and breakfast inn. This bed and breakfast utilized the Lock House that was built in 1862, and there was an addition done to that building in 1882. This building is located just southeast of the Lock Barn. The proposed Lock Barn will preserve the historic use of the building that has been documented as previously being used for community assembly, as mentioned previously. It is currently being used just for storage for the property owners, and if approved, the structural modifications to the Lock Barn will be consistent with the historic character of the building, and there are no improvements or alterations to the front brick facade of the building proposed. The project proposes to have up to 100 customers per gathering, and that's a maximum, although the applicant has indicated that the majority of the events will likely be much smaller in size. It's anticipated that events will occur on an average of 4 days per week and would be permitted during the hours of 8 a.m. and 10 p.m. The project originally proposed to have amplified sound, both indoor and outdoor, during the events. The applicants had agreed to only have outdoor sound a maximum of 12 times per year, no more than 1 time per month, and only to have it occur on Friday, Saturday, or Sunday. An acoustical noise analysis was conducted and mitigations measures were identified to ensure that the activities would comply with the San Joaquin County noise ordinance. As a result, staff did recommend approval of the outdoor amplified sound and indoor amplified sound. But however, during the Planning Commission, there was an in-depth discussion regarding the use of amplified sound in general. And after much deliberation, it was ultimately determined that the project would be approved, but that the amplified sound would not be permitted. The board packet includes a discussion that states that outdoor amplified sound is prohibited, and the conditions of approval contained in the board packet state that only outdoor amplified sound is prohibited. However, after reviewing the Planning Commission hearing, staff has determined that this is incorrect and that all amplified sound is prohibited. As a result, staff recommends that the condition be revised to state that all amplified sound is prohibited to reflect the Planning Commission's approval. It is also recommended that if the board denies the appeal and ultimately approves the use permit application subject to the conditions in the board packet, that this modification be made to remove the term outdoor so that all outdoor, indoor amplified sound is prohibited. The appellant states that the historical building was never used for community gatherings. In response, it should be noted that the Community Development Department would not have allowed the submittal of this application had the applicants not been able to provide the documentation ensuring that the building was classified as a historic building and that the use that the building was previously used for was going to be the same use that they were proposing for current day. As previously stated, the building has been placed on the United States National Register of Historic Places, and the lock barn was confirmed that it was previously used for community gatherings and military use back all the way back to 1858. The types of activities conducted in 1858 would be similarly classified under the use type community assembly, which is what our department uses today for these types of activities. It includes recreational, social, or multi-purpose uses within the building. The appellant also states that an EIR should be required to address environmental impacts. An EIR is the Environmental Impact Report, which is the highest level of environmental review. In response to that statement, the Community Development Department did prepare an initial study early on in the project. This project's been under review for quite some time, over a year at this point. We determined that there were no potentially significant environmental impacts that could not be mitigated to a less than significant level, and as a result, a mitigated negative declaration was proposed for approval and adoption. All mitigation measures and appropriate ordinance requirements have been incorporated into the conditions of approval that were approved by the Planning Commission. The department has reviewed the county's project record and the appellant's statements and has determined that there is no substantial evidence that would conclude that a fair argument can be made and that the project may have a significant impact on the environment. And again, we determined that an EIR is not required. The third appeal statement requested that agricultural mitigation be required for this project. However, Development Title Section 9-1080.3 states that ag mitigation is required when a zone reclassification or general plan amendment is required that changes the general plan designation or zoning from an agricultural use to a non-agricultural use. It should be noted that although this parcel is 2 acres in size, it has not been farmed for many decades. In addition, a general plan amendment nor a zone reclassification are required for this. Therefore, agricultural mitigation is also not necessary. The property owners do have to accept the inconveniences or activities related to other ag operations within the vicinity as part of the right to farm ordinance. This includes normal and necessary aspect of operating the community assembly in an ag area. This applies to basically every property within San Joaquin County. I have some pictures to show you. This one is looking east from Elliott Road at the lock barn on the left, and the lock house is on the right. And this is the driveway that will be only used as an entrance. This is a close-up of the front facade of the barn. The exterior part of the barn will not be significantly modified, but rather preserved to enhance the historic nature and design of the building. Part of the project also includes installing a restroom within the barn, as well as a patio off to the south part of the building. So this is the western portion of the property line that has an existing fence between the property owner, the applicants, and the appellant. As a condition of approval, the applicant is required to plant dense vegetation along this fence line between the two properties. This is to be done on the north side as well as the south side, which I'll show you in a minute, because it abuts two neighbors. The screening requirement for the southern property line was inadvertently left out of the conditions of approval approved by the Planning Commission. The department discovered this error, discussed it with the applicant, who concurred, and as a result, the requirement was added back into the conditions of approval contained in the board packet today. This is looking north from the outdoor area where some events could potentially occur, and there will be no amplified sound in this area, but the applicants have stated that they do sometimes want to put seating area out on the lawn. And this is looking at, from a different perspective, at the same outdoor activity area facing south toward the fence line, which would also have the dense vegetation planted along that, that property line as well. Okay, and this is looking at the outdoor area just located just adjacent to the lock house, and that's part of the driveway as well. In conclusion, it is recommended that the Board of Supervisors deny the appeal, adopt the mitigated negative declaration, adopt the findings for use permit number PA1900036, and approve the conditions of approval for use permit number PA1900036 as contained in the board packet with the following modifications. To remove the word outdoor from condition 1C, so that the all amplified sound will be prohibited, and to replace as a point of information the type of surfacing that the applicant is proposing for the parking area and the driveway areas. It's a pervious pavement. It's actually a combination of grass and a lot of other things that engineers understand and I don't. But basically what it allows is that any storm water that is on the property will percolate, exactly, and it will go into the ground. So it alleviates the need for a great big storm pond. The conditions of approval actually state concrete, and so just as a point of clarification, we want to change that word to pavement. And this concludes staff's presentation. I'm happy to answer any questions.
Thank you. Are there any questions for staff at this time? All right, then I'm going to open the public hearing. And I'm going to ask if the appellant is present. If you would come down to the podium, please. And state your name for the record, and then go ahead and speak in favor of your appeal.
Thank you. To start out with, because I've taught for 32 years for Lodi Unified, I don't rely on technology. I've done the Zoom meeting. So I have a physical copy of what I emailed you. I wasn't sure if I could pass that out or not. Have one for every person.
Can hand it to the, feel free to hand it to the clerk down below, right there.
Oh, thank you. This is not my normal method of speaking. Nervous. I'm going to read what I wrote.
That's completely fine.
So my name's Kathleen LaPalt, and I live north of the Lock House. And I'm speaking to you about the appeal. And I'm not just speaking for myself, although I am the one who took out the appeal, but that for the surrounding neighborhood. And if you look at the picture in the packet, I have an overview of our neighborhood. So as you can see from the petition we've shared, we have many concerns regarding this project, and we have had many concerns all along. We do not feel that we have been completely informed along the way about this event center. As for clarification, I have a few things to clarify because during the meeting, I was not able to join on the meets, and there was no check on that, and I don't believe any of the other people that tried to were on there as well, so I was muted. And as you can see, being muted during a meeting doesn't always work. So as for clarity, Lockford already has a community center, and that is on Jacktone Road. And this project, although it now calls itself a community center, it is not in the same term. Our community center is the one that the sheriff have a center in and where we hold our MAC meetings. To further speak to clarify comments made during the meeting held by the Planning Commission on September 3rd, we as a community could not respond because our calls were dropped or we were muted, as I was. I need to clarify the fact that it was stated that there was no fence between myself and the Thayer property. I've had a fence there since 1858 because I have the property that was purchased from the Locks that was the dairy. So we always had fencing between ourselves and the home because cows don't stay. And during the 50 years that my family has owned this property, we have replaced the fence numerous times. The most recent I put in a chain link. I had the fence, my property surveyed. It was originally done by my father in 1975. He was a civil engineer for Sacramento County. We resurveyed, and I had to put in a security fencing that matches that of what I have all along Elliott Road. I did that mostly because of my mother, who was 87, living in the home, and she was going over the field fence and wandering into Lockford. So she can't climb chain link. She was at home at the time. She is still with us. I know people keep responding that I've inherited the place. My mom is still with us, but she's in a assisted. She has dementia. So we've had to replace the fence in the 50 years we've had it. There were questions during the meeting regarding the screenshot that I included in my letters to the county. Since I wasn't there and I couldn't respond, those screenshots of the Inn at Lock House and the advertising of the wedding were taken June 28, 2019. On my phone, I still have them, and I simply enlarged them. They were advertising, and they did hold amplified events. One included a drone that flew over my home. We were in the pool and couldn't quite figure out what it was. There was no mention that code enforcement was called regarding a dump truck cutting in what we thought was a driveway, and that was done May 5th. I have a picture of the dump truck because it stopped traffic. I asked the Community Development Department to visit my property long before there was a commission being held. I explained that I had numerous concerns regarding this project because I am below grade level. I have some pictures there, hopefully. I asked the county to please see me and please review the topography of the land and look at the lay of the land and the close proximity of the lock barn to my house, as well as the fact that the wooden fence stops right at the edge of my home. It was put up right before the county visit, and the same on the southern side. Repeatedly, I was denied, and I included some of those emails that I had at the county. One even stating to Mr. Girardi that I didn't want it made public because I was working full-time for Lodi Unified at the time, that I didn't want people to just show up at my mom's place. I had visiting angels coming in, as you do with dementia people, and people were asking to come in, but not the county people, people from next door, and I didn't want my mom disturbed. So I clearly made it stated, please keep this private about mom, and so then I was told, and it's included in the email, that all my letters would be erased. So then it was mad dash email. No, that's not what I meant. My intent was I wanted the fact that my mother was living alone in the property at night to be kept secret. I kind of did it better by showing the emails. Apologize for kind of. Moving on, the county provided background on the barn that stated in 1858 the lock barn was built and used for community gatherings and the military. Well, reviewing the historical documents provided as well as the documents in the University of Pacific Special Collections, I am a doctoral student at UOP, on hold right now because of other things, but mostly Mom. But I went into the special collections and I provided the page. It states the Lock Barn was built as a granary and as for livestock. And the one page I have included is the actual diary. It's a transcripted because otherwise it's in her, Delia Locke's hand script. The secondary granary was, it was stated in that document that the first barn that was built was removed. And it clearly, I highlighted that in the secondary granary was stated in that document. The secondary granary was then removed because it was in disrepair in 1975. So what happened with the submitted historic documents where they didn't include everything. So when I went into the actual documents of the historic reserve and I ran it, it comes up with the fact that there was a great deal of concern at the time over the actual verification of the barn. And so I included the missing pieces, and I have the whole document here. And it talks about the significance of the date of the barn, and perhaps that wasn't significant. And in Delia Locke's the 1858 barn was indeed removed. So that original barn that housed the military does not exist. The barn that is there now, it further goes on, and I stated it in my letter to the county, which, by the way, when they put it in the packet, it's not in order. And there were 4 letters, 2 from myself and 2 from Shirley Grenick, that when they built the barn that is now existing, it was built as a granary and for livestock. And then later, a room was added up above, and it goes into her diary, and the first use of it was for her sewing circle. So even though you could say it's used as an assembly hall, the meaning of housing military and stuff is clearly defined if you look in the diary, and I have given reference to all the documents. This is the original full national thing where, and I included the pages where it shows there was a confusion about what was being done and the amendments. So I kind of like tried to do the research for them. Sorry, I have to go back to it. So again, that is Delia Locke's, as you can see, I believe it's in itemized. And the last page of it shows her actual screen, the page that's kind of dark, and I highlighted it. It says, the men have today been tearing down the old adobe barn, which stood for 6 years from the floods. So it's just to show that there is question as to the use of the barn. The applicant requested that the removal of Title 9-10224 be made, and that was the title that states that there should be a masonry wall 6 to 7 feet between myself and that of the business. It was asked during the meeting why this was removed from being a requirement, and the applicant stated for aesthetic purposes. And again, since I was muted, I couldn't make any comment because I do not find that this fence that they have put in is solid. It does not go down far enough. I find it unattractive. It does not keep car headlights from coming through. It does not keep people from looking into my home. It does not confine guests from events walking down and looking into my home or looking directly into my master bedroom. The fence does not keep storage from view. I want you to know, I would want to know, how is this wooden fence better for me than what is the code and why it was removed? And that was part of the exception that was asked in the whole packet. An exception was asked for regarding the site drain water, and it was stated again about that the pavement to make an exception. And I have concerns with rainwater coming into my significantly lower grade property I have concerns with water that would be added that runs along Elliott Road, which goes along my property down to the bridge. Already I have a washout that I have to talk to the county about. To add more drainage would even increase this problem greater. But when the county came out, after the appeal date was set, they finally came out because I called Mr. Kwan directly. And I said, look, I've been trying to get you guys out. Please come. He finally came out. And I stated I was concerned about this exception of the pavement, and I'm also concerned about the noise of the construction, and I'm also concerned about all the vibration because I live in a brick home that's cut into the side of the hill. I have stained glass, and I have 8-foot hand sandblasted doors that my parents had put in 45 years ago. I am concerned about the vibrations and the noise, and I mentioned this, and I was laughed at and said they're not digging down 4 feet. So I went back in and I read the core instructions that were included in the packet, and it does refer to the use of a vibratory blade or roller in putting down this pavement. And it also talks about draining. So they don't just talk about water percolating, but water flow. So I question why if the site can't be accepted as it is without these exceptions, we need to look at that. And it wasn't really reviewed. I have concerns about the actual construction noises. It was estimated by the project planner that a 100-person event would have approximately 33 car trips per day from 7 to 10 p.m. That's taken from this. I feel that's grossly underestimated. I do not see how a 100-person wedding would only require 33 car trips. That doesn't include florists, caterers, servers, any of those other things that would be necessary. And and that would assume what, 33.3 people per car? I feel that just is barely scratches the surface of the trips that we made in and out onto Elliott Road, very close, and let alone the number of cars pouring onto Elliott Road would create more traffic on an already busy road. And if anyone's traveled Elliott in that area, you know what I'm speaking of. And that would make those cars 7 to 10 p.m. average 4 days a week. This is overwhelming. Plus, having 100 people wandering the yards above our homes, next to our homes, across the streets from our home is simply overwhelming. This is asking for more than I believe the rural wineries were getting. Elliott Road drops sharply by my driveway, and I included a picture in that in the pamphlet where it's a sharp fall. It's very challenging to have good visual coming up the hill where these cars from the event would be pouring out. We as a community are strongly opposed to the event center, the community center, whatever it's being called right now. There are too many events possible for our neighborhood. The notice from the county only states that there would be 1 event per month. So that's why that's attached to the petition from the neighbors. It states just 1 event a month. It doesn't go into the 4 average weekly. So we didn't understand that at first. As a community, again, we're strongly opposed to this type of project in our neighborhood. We, of course, would like to see this project reversed. However, if that is not possible, we have come up with a petitioned request, my appeal. The reversal isn't possible. We collectively have come up with something. No exceptions in the fencing, screening, or drainage requirements. I personally request a masonry wall, as the code states, between myself and the neighbors. I would like all drainage contained on site. Events, indoor, outdoor, should be limited to 1 per month. Events are not to be held on major holidays. Event hours of operation should be 8 a.m. to 8 p.m. Included in this time would be setup and takedown, so that we don't have the trucks being delivered at 6 in the morning. No amplification of any type for indoor or outdoor activities, with no drone. Number of persons at an event not to exceed 75, and this number needs to include attendees as well as the event service people that would be going in and out to try to limit the number of people added in on the property as well as traffic. Any event that serves alcohol, we would like to require an outside private security guard. I had the signed petition from the neighbors requesting those. We emailed each other back and forth. We feel that our requests are within reason. And as you can see, this property is in a neighborhood. A is a simple screenshot picture of the lock house. If you see the pool to the top of the page, that's my pool. The brick is my home. You can see where there's solar panels. That's where the parking is proposed, above my home. I have some photos if you'd like additional. They're not many, 17 I believe, that if it works we could show, and if not, then I accept.
Little hesitant to have hardware connected to the county's internet at this time. Have it on that thumb drive. Is it just the photos on that thumb drive? Is it just the photos on that thumb drive?
And my notes.
Unfortunately, that could infect the county's.
Okay, we're not going to be able to see those, but thank you for preparing all of all these other materials. I guess at this point, I would ask if there's anyone on the phone. I would ask the clerk if there's anyone else wishing to speak in favor of the appeal. And then after that, I will ask if the board has any questions for the appellants.
So I do have one written comment in favor of the appeal that I can read at this time.
Okay, thank you.
The comment reads, I am writing concerning PA 1900036. I am urging you to consider the appeal and reject the permit for the event center. I own the adjacent property to the south and object to the event center for a number of reasons. The proposed outdoor events venue less than 20 feet from my bedroom and adjacent to my backyard. When they've had events there in the past, I have been able to hear everything that went on clearly in my house. With my window shut, the AC on, and the TV turned up. While I realize that anyone can have an occasional party in their yard that can be a little loud, the event venue permit is asking for 4 nights a week, making it a possible 208 nights per year plus daytime events. This is excessive for a residential area and would have an effect on the quality of life in the neighborhood and property values, not to mention loss of privacy as my property is at least 4 feet lower than theirs, dropping down the hill. The amount of traffic this will generate. Elliott Road is a main north-south route for the area, being the only road that crosses the McCollum River between Clements and Victor. We have a large truck traffic as well as farm equipment that use the road, along with a high volume of cars. The roadside is used for parking for the apartments across the street, which narrows the roadway, and we have blind vision to the north due to the steep hill. The vehicles come through their way in excess of the posted 35 miles per hour. Adding more traffic entering and exiting the roadway in that area will only increase the number of accidents and severity of them. Their driveways are fairly blind to traffic approaching them, and they to the oncoming traffic as well, rolling out, trying to beat the oncoming traffic and possibly impairing drivers is a recipe for disaster. They have a proposed parking area as part of the original proposal, which will have cars parking within 20 feet of my bedrooms and living room. This would mean increased noise, fumes, dust, and headlights being shined into my house at all hours. This is not acceptable. This driveway also is directly across from bedrooms from other houses across the street and a congested intersection at Laird Street and Elliott Road. Both sides of the intersection are consistently lined with cars and trucks, and if the people don't want to park in their parking area or the parking area is full, where will they end up? My driveway. It's already happened, and I don't want it to happen 4 nights plus a week. And Madam Chair, that concludes the comments in favor of the appeal.
Do we have a name?
moment, let me check the email. So it is unsigned, but the sender, I see the name and the email address, is Shirley Grenig, Grenig.
Okay, great. Any members of the board have any questions for the appellant? Okay, thank you, Ms. LaPelle. Appreciate it. So now I'm going to ask if the project proponent is present to speak in opposition of the appeal, and if so, to give us just a sec. We're going to clean up here at the podium, disinfect for you, and put a new cover on the microphone, and then we will ask you to come on down. Good afternoon. If you want to just state your name for the record, and then we'd be happy to hear your comments.
Yes. Good afternoon to you as well, Chair Miller and members of the board. I know it's been a very long morning for you already, and you have other things to do after this. I will try and make this brief. My name is Connie Thayer, and I am one of the applicants for use permit application number PA 1900036. Our project involves converting a barn into a community assembly hall, and I would like to share some details about that with you. Oh, do I have the clicker?
You want me to clean it? Okay. You can spray it.
Okay, I apologize for some of this information. It will be duplicative based on what other people have shared, but there's no way for me to know. So here are the buildings we're talking about, the inn on one side and the barn. Both of these buildings are on our property. The bed and breakfast has been in operation for 20 years. And the barn is currently a storage building, is the building that we would like to use for community assembly. We bought this property a few years ago. So we've been running the business since 2018. I do all the hosting, the cooking and cleaning for guests of the inn, and my husband takes care of the land and the buildings. We don't have any other employees. We do everything ourselves. We also live on site at the inn. This is our only home, so when we don't have guests on the property, it's just a private residence. And honestly, since March, that's all it's been, is a private residence. We've been closed most of this year. Here are the plaques for the house and the barn. Both buildings are over 150 years old. And as you know, they're listed as landmarks on the National Historic Register. The house was built from 1862 to 1882, and the barn was built from 1858 to 1862. Both buildings were built by Dean Jewett Locke, the person after whom the town of Lockford is named. And these buildings were the first landmarks to be listed on the National Register of Historic Places for the whole county of San Joaquin. They were listed in 1972, so they have been historic landmarks for 48 years. These are the types of events we would like to host in the barn: baby showers, bridal showers, weddings, birthday parties, memorial services, retreats, and community service activities for nonprofit use. We get a lot of requests for baby showers and bridal showers. We also get requests for weddings and birthday parties. This year we received 3 requests to host memorial services for people who have passed away from COVID. We would also like to host retreats. Some examples would be artist retreats for painting, or wellness retreats to help people de-stress, or team building retreats for the staff of a small church or a business. We would also like to use the barn for community service, for example, as a fundraising space for nonprofit groups or community events like a pancake breakfast. or if we had a natural disaster, the barn could be used for emergency services. Here's an aerial view of our site. The inn and the barn are both labeled. The driveway is horseshoe shaped, as Jennifer mentioned. The near entrance next to the inn is one way to go into the property. And then the parking for the inn is located between the inn and the barn. Kind of see the stripes there. And the exit for the driveway is on the other side of the horseshoe. Elliott Road is shown at the bottom of the slide. The entire property line is visible, as well as the neighbor residences on the left and right sides of our property. So here's a first draft of the site plan that was sent to our neighbors by the Community Development Department. All of the highlighted areas show major changes that we had proposed to the site. They include additional parking around the horseshoe driveway, an outdoor restroom facility next to the barn, and in front of the inn, we had proposed more parking, a stormwater detention pond, and a new driveway with access to Elliott Road. The inn currently has 7 parking spaces, and we added 28 additional spaces to that for a total of 35 parking spaces. After this first draft of the site plan was mailed out, objections were received from 2 neighbors, Shirley Granig and Kathleen Lapelt. Shirley is my neighbor to the south side of the property, and Kathleen is my neighbor to the north side of the property. We sent emails to both neighbors with an invitation to discuss our project. The email at the top of the slide is to Shirley, and the email underneath it is to Kathleen. I included both of my phone numbers on these messages, but no response was received from Shirley. A brief response was received from Kathleen indicating that she was busy working and she would stay in touch. I made an additional attempt to contact Shirley after we received no response to our first email. The second email focused on Shirley's concerns regarding use of the barn, operating hours for events, parking, and stormwater runoff. Our comments are in line below in green text. Not going to read the email. My intent here is just to show that we made a detailed, good faith effort to open a dialogue about our project. We continue to try and talk to Shirley even though she was unresponsive to our efforts. We also made an additional attempt to contact Kathleen. We did not receive a further response from her after her initial indication to the first email that she would keep in touch, so a second email was sent to her to follow up on her concerns. The second email discussed our plans with regard to the timing of events, the hours of operation, the type of events being considered, parking expansion, and noise monitoring. Again, I'm not going to read this email either. I just intend to show that we tried to communicate with Kathleen directly about our project. We did not receive any response to this message. So let's go back to the first draft of the site plan. The areas of concern expressed by the neighbors were item number 1, the orientation of the proposed new parking faces the lot line. This would be toward Kathleen's property on the north. Item number 2, the proposed new parking is too close to the lot line. This would be close to Shirley's property on the south. Item number 3, the proposed detention pond is too close to the lot line. And item number 4, the proposed new driveway is a traffic concern. In response to these concerns, we worked with the planning department and also with our civil engineer to make changes to the site plan. Here's the final draft of the site plan. These parts of the plan were all modified or removed to address neighbor concerns. The parking lot to the north was reconfigured to face away from Kathleen's property line, and all of the proposed development to the south near Shirley's property line was removed. The new parking, the detention pond, and the new driveway were all removed from the plan to accommodate her objections. That area is now an open lawn, and it will remain so. I'd also like to note that the outdoor restroom facility was removed and the restrooms were relocated inside the barn, as Jennifer mentioned. And the parking was increased from 35 spaces to 42 spaces at the request of the planning department. This next slide shows the final draft of the site plan with distances marked between public use areas and property lines. Starting at the north end of the property, it is approximately 23 feet from the back corner of the proposed new parking to the fence between my property and Kathleen Lapelt's property. The long blue line represents the outdoor activity area. It begins at the parking on the left side of the barn and continues past the barn to the oak tree and then circles around toward the inn. The distance from the oak tree to the fence line is approximately 33 feet. We included this measurement because the oak tree is a primary feature of the outdoor activity area. And the distance from the event area to the property line adjacent to my neighbor Shirley's home is approximately 65 feet. For this measurement, we tried to find a location at the fence line that was closest to her house to get an idea of how far away the activity area would be from her home. There is really no reason for people to go past the oak tree to congregate. There is nothing to see or do out there. As I said, it's open lawn, but we will also add landscaping along the fence line to increase her privacy in case any guests wander in that direction. Here's an aerial view of our property showing the same distances that I just reviewed on the previous slide. I included this photograph to help you visualize the space in relationship to the landscaping and the property boundaries. So that's an overview of the buildings, the property lines, and the outdoor activity area. Next, I would like to show you our proposed paving surface material. Our proposed paving surface modification is a product called Core Grass. It is comprised of a plastic grid infilled with either turf or soil and grass seed. The information on this slide was taken straight from the company's website, which I will now read. This is a green choice for low-impact paving. It is a beautiful, sustainable, and economical solution to manage stormwater and reduce heat island effects in parking and traffic areas. Core Grass porous paving is stabilized so turf can grow with no ruts or sinking. It reduces stormwater runoff and improves water quality with natural pollution filtration. No unsightly infrastructure is seen, just green grass. The rigid honeycomb design holds its uniform hexagon shape and provides maximum load bearing. Core Grass provides stability, grass protection, and sustainable drainage in a paver that is nearly invisible. We chose this product specifically because it addresses the concerns of our neighbors regarding stormwater runoff and drainage. It also will preserve the rural look of our property and will keep my land from looking like a commercial parking lot. Here's some of the benefits of using a Core Grass product. It has a natural footprint. It is easy to recycle. It increases groundwater quantity and also groundwater quality. It protects our lakes and rivers. It protects our wildlife and biodiversity. It has a valuable cooling effect and a reduced risk of flooding. Because this product is basically dirt and grass, it provides the same water drainage as a lawn would and also the same water filtration that a lawn would provide. So we're basically, it would be the same where we have a grass area, it's going to be replaced with a grass area parking lot. The drainage should not change. Core Grass is load bearing and easy to maintain. It will support the weight of emergency vehicles and it can be mowed with standard mowing equipment. Here's an example of a Core Grass parking lot, and we expect that our proposed parking would be similar in appearance to this. Next, I'd like to review the legal support for our use permit. As you know, we are relying on Chapter 9-1053 of the San Joaquin County Code, which is the Historic Resource Preservation Chapter, as the foundation for our use permit application. I'd like to quickly review the elements of this chapter and explain how we have satisfied each element. Element A, to preserve, maintain, and improve structures, sites, and districts of historical significance. We satisfied this requirement by the investment of time and expense into the preservation, maintenance, and improvement of the barn. I will show you pictures of some of that work in just a moment. Element B, to ensure that modifications to historic resources within the county is consistent with the historic character to be preserved or enhanced. We satisfied this requirement by the use of period-specific historic bricks to renovate the barn, restoration of the original hardware, and rebuilding of doors to match the previous design. And element C, to enrich the educational, cultural, and aesthetic interests of the county through the preservation of the county's historical resources. We believe that granting a permit for community assembly in the barn will allow the public to learn about and experience an important part of San Joaquin County history. The next slide is section 9-1053.2 of the code chapter, applicability. This section reads, the provisions of this chapter shall apply to all zones in San Joaquin County. We understand this to mean that the Historic Resource Preservation Code can be applied to our property, regardless of whether it is zoned residential, agricultural, or commercial. I'm skipping sections 3 and 4 of this chapter because they are reserved by the county. So the next applicable section is 9-1053.5, change of use, and it has two elements, A and B. Section A reads, additional requirements for application. The request for such use permit shall include the following additional information. Part 1, evidence that the proposed change in use is consistent with the intent of this chapter. We satisfy this requirement by providing documentation that the barn had previously been used for community assembly. The community assembly use type is consistent with the intent of this chapter. Part 2, a list of alterations required for the change of use. We also provide a list of alterations such as additional parking with our use permit application. And Part 3, a site plan which clearly delineates the location and characteristics of the proposed use. As you have seen, we did also provide a site plan. Next, I'll review element B of section 9-1053.5, change of use. Element B reads, additional findings. In addition to the findings specified for the use permit, the review authority shall find that all of the following are true. Part 1, the historical resource has been identified as being significant by a recognized historical or architectural organization, which you know because it is listed on the National Register of Historic Places. And Part 2, the proposed use of such historical resource shall not detract from or otherwise impair it as a historical resource, but instead the proposed use shall complement, enhance, and be compatible with the historical resource. Our proposed use of community assembly requires no change to the barn's historic design or architecture, so it will not detract from or impair the building as a historical resource, and the proposed use would allow the barn to become a focal point of the community again. Next, I'd like to review a section of the 2035 San Joaquin County General Plan. There are more sections of the general plan that support our project, in addition to the one I chose here, but for the sake of expediency, I'm only covering a section of Part 3.4, which is the natural and cultural resources element. Section NCR-6.1 reads, the county shall protect historical and cultural resources and promote expanded cultural opportunities for residents to enhance the region's quality of life and economy. Section NCR-6.3 reads, the county shall continue to encourage efforts, both public and private, to preserve the historical and cultural heritage of San Joaquin County and its communities and residents. And Section NCR-6.8 reads, the county shall encourage land uses and development that retain and enhance significant historic properties and sustain historical community character. We believe a community assembly use type for the barn is supported by all of these sections. It will expand cultural opportunities for residents. We are preserving the historic and cultural heritage of the county through our private effort of restoration, and we believe that our proposed use will enhance this property and sustain the historical community character of Lockford. Next, I'd like to discuss the authenticity of the barn. The original barn was built in 1858 of rammed earth and adobe bricks. The fired brick facade was added in 1862. This information is cited from a publication titled Lockford's Beginnings, a California pioneer doctor's dream, and it's compiled from journals, diaries, letters, and other family sources dating from 1850 to 1887. The author is Delia Marcella Thorpe Emmerich, and she is a direct descendant of the Lock family. The caption under the first picture reads, Lock Barn and Granary of Rammed Earth Construction, 1858. And the caption under the second picture reads, the Brick Barn, 1862 Granary, has been refurbished and houses tooling for a grandson's aircraft workshop. Many builders of John Willard Thorpe's T-18 make use of this shop. The barn was used as an airplane workshop in the 1980s and 1990s. Here's a side view of the barn showing the brick and adobe portions of the building. We believe this picture was taken in the 1960s. The different roof lines indicate where the building materials change between brick and adobe. Next, I have a picture of the barn from, a picture of the barn taken by the Department of Parks and Recreation on July 6, 1970, and submitted with the nomination form for the National Register of Historic Places. Note the hole in the rear wall. This is what the barn looked like when it was nominated for historic landmark status. It was not in good condition. I'd also like to review the nomination form for inclusion on the register. An employee of the Department of Parks and Recreation completed the nomination form for the barn on July 6, 1970, and the following description of the barn was included on the form. The barn nearby is approximately 60 by 80 feet in size, more than 2 stories tall at its apex, and built in part of adobe and brick. Rear and sides of the structure are adobe. The facade, approximately 30 feet high at its crest, is built of local clay-fired brick. Considerable damage has been suffered by the rear wall, much of which has collapsed due to ground erosion and exposure to rain. While impressive in size, the structure does not disclose outstanding architectural design, its significance primarily relating to a curious admixture of building ingredients and to cultural activities with which the building was involved, i.e. community gatherings, military use, and pioneer ranching. This description indicates that both the adobe and brick portions of the barn were present in 1970. The damage noted to the adobe portion of the barn did not prevent the barn from becoming a registered landmark, and the significance of the barn comes from its building materials and from the cultural activities related to it, specifically community gatherings, military use, and pioneer ranching. Next, I'd like to review the historical support for our project. Delia Locke was the wife of Dean Jewett Locke, the builder of the house and barn, and her journals are a first-hand account of pioneer life in San Joaquin County. She kept journals from 1855 to 1918. Here's an image of one of those journals and also an image of a typical journal entry. The journals of Delia Locke are available online through archives of the Holt Atherton Special Collections, University of Pacific Library in Stockton. I have here some excerpts from Delia Locke's journals regarding community assembly in the barn. She refers to the barn as a granary and to the community assembly space as a hall. The blue text highlights specific references to the hall in her entries, which I will read. 1859, January 20. This evening, the sewing circle met here. The evening was very fine. We had the meeting in our new hall over the granary, which is so nice and spacious. 1860, January 18th, there has been a meeting of petitioners in the hall, and Dr. Kerr has organized a division of the Sons of Temperance this evening. 1863, September 5, a cavalry company has today been found in Lockford, to be known as the Mokelumne Light Dragoons, Mr. Holman Captain, Mr. Robert Taylor, First Lieutenant. 1864, November 21st, this evening the Soldiers' Aid Society have met in the hall. We had a good attendance and a pleasant meeting and gained several new members. 1865, April 4. The lodge met here as usual this eve, and before they closed, voted to change the place of meeting to the schoolhouse. The military company, at their meeting last Saturday, voted to do the same. I see not how anyone can think it a benefit to us to allow these meetings to be held in the hall, since the military company has never paid anything for the use of the hall or for lighting, neither the lodge until this eve, although both have been in existence more than a year and have always met here. 2 years later, in 1867, October 18th, we have been to the lodge this evening. This is the last night at Holman's Hall, for we voted to change to the old place again, in our hall, as it will be less expensive. From these entries, it is clear that meetings were held in the barn for at least 8 years, starting shortly after the barn was built and continuing through at least 1867, which is beyond the point that the brick facade was added to the barn in 1862. This is the condition of the barn in 2018 when we bought the property. There were plaster patches over parts of the brick, which you can see toward the foundation and also on the left corner of the barn. The paint was peeling off the doors and the track for the doors was falling apart. This is the condition of some of the bricks. The exterior walls of the barn included a large number of bricks in various stages of disintegration. The front left corner of the barn in particular was deteriorated and needed restoration work. The first picture is a close-up view of the left corner of the barn before the work was started, and the second picture shows the restoration work in progress. All those missing bricks had to be removed because they were turning to dust. Here's a larger view of the restoration work in progress. As I mentioned, we used antique reclaimed bricks for this work. The bricks came from another historic building, also built in the 1860s, that had been torn down. And this is the condition of the barn after completion of the restoration work. You can see that all the plaster patches are gone. The doors were completely rebuilt by hand to match the previous design, and they were also repainted. The track for the doors has been replaced, and all of the original hardware was powder coated and put back on the barn. Here's a side view of the barn. I included this picture to show that the roof line is contiguous between the two different types of building materials, unlike the picture from the 1960s. The roof and the wood siding were already present when we bought the barn, but we added gutters to the roof and painted the siding to keep it from weathering. Next, I'd like to discuss the adaptive reuse of the barn. The appellant claims that the current barn was built with primary and continuing purposes of agriculture. This barn has in the past been used for both agriculture and community assembly. However, our lot size is too small for commercial farming at only 2 acres. I believe the county minimum for commercial farming is 10 acres. Our property has not been used for agriculture in decades and cannot become commercially viable for farming again without regaining adjacent land that has been parceled off. The barn has no continuing purpose for agriculture and is a prime candidate for adaptive reuse. Permitting the barn for community assembly would restore an original use and revitalize the history of a building that could otherwise fall into obscurity. We believe that community assembly is a reasonable way to repurpose this building. We would also like to develop a secondary income stream to support our small business. The lodging and hospitality industries have declined as a result of the COVID-19 pandemic. Our own lodging business has lost an estimated $50,000 or more in revenue this year due to government lockdowns, canceled reservations, and reduced tourism. When wineries operate at limited capacity and events like Zinfest and the Sandhill Crane Festival are canceled, we receive much less business. The COVID-19 pandemic has no predictable end, and a use permit for community assembly would allow us to host events with proper social distancing to offset the financial loss of our lodging income. There is a public demand for event space. This demand is indicated by the number of event requests that we received from March to November of 2019. I chose that window of time because that is the same window of time that we have been shut down this year in 2020. On the right is a table showing the actual requests that we received during this time last year. There are 19 requests, and they break down into 6 baby or bridal showers, 4 birthday parties, 3 weddings, 3 receptions with the wedding held off-site at another location, 2 reunions, and 1 women's retreat. The guest count ranged from 25 to 100 people, and the median guest count is only 30 people. We are currently forced to turn away this potential income through the lack of a permit. In September of 2019, a neighbor who lives across the street asked if our barn was available to host their annual Halloween party. We responded that the barn was not permitted to hold events, but encouraged the neighbor to contact us the following year. This neighbor perceived the barn as a potential event space and wanted to use it. I'm sharing this exchange to illustrate that I do have neighbors who would be interested in having an event space in the neighborhood. We believe that using the barn for community assembly would be a modest expansion of our current business. Our primary business is lodging services, and the addition of an event space would complement our primary business. Our property is small, as you have seen, and has 1 outdoor activity area, so we cannot hold multiple events at the same time. We will host and manage each event personally as on-site property owners to ensure compliance with the terms of our use permit. A permit for community assembly would allow us to provide a service that people are already asking for, and your approval of our use permit would contribute toward our economic sustainability as small business owners. Next, I'd like to review the proposed hours of operation. The proposed hours of operation are 8 a.m. to 10 p.m. for a maximum of 4 out of 7 days a week. What does that look like? We would only host 1 major event. That would be 25 people or more per day. The 1-day event length would be up to 6 hours. An event will begin no earlier than 8 a.m. and end no later than 10 p.m. Based on these guidelines, a fully booked week would have 4 days comprising 1 event per day, and no single event would exceed 6 hours. Realistically, hosting 4 6-hour events every week of the year is extremely unlikely. Many weeks will have fewer than 4 events or no events at all. This is a very seasonal business. We don't get a lot of business in the winter, and we do get quite a bit in the summer. So there definitely will be peaks and valleys to the use of the event space. Hours of operation does not mean that we will be operating for 14 hours a day, 4 days a week. We are not a theme park. People are not going to be lining up outside at 8 in the morning to get into the house, into the event space. Here are some examples of what a weekly event calendar would look like. Example 1, a Bible study group may meet on a Wednesday night, a paint party on Friday night, a baby shower on Saturday, and a wedding reception on Sunday, with the actual wedding held at a different location. Example number 2, a nonprofit group could meet on a Thursday night, a birthday party may be held on Friday, and a family reunion could be held on Saturday. Example 3, a wedding shower could be held on Saturday and a memorial service on Sunday. Example 4 would be a wedding weekend. This is a Friday to Sunday booking. The bride and bridal party have exclusive use of the property for the whole weekend, and no other events are booked. Example 5 is an artist retreat, Thursday through Sunday. Artists have exclusive use of the property for the whole weekend, and no other events are booked. Referring to the Planning Commission's limitation on no amplified sound, we'd like to ask for clarification on that. A definition of amplified sound is sound whose volume is increased by any electronic, electric, mechanical, or motor-powered means. The range of devices that produce amplified sound can include, for example, headphones, mobile phones, personal Bluetooth speakers, laptops, televisions, car stereos, and DJ systems. The requirement for no amplified sound does not capture the spirit of the condition, which is to limit noise pollution in the neighborhood. A live acoustic band playing at or below the decibel threshold could be more disruptive to neighbors than, for example, the speaker on someone's mobile phone. Music for a slideshow played on a television set at a low volume would likewise be less disruptive than a live acoustic band.
Excuse me, Madam Chair, this is Supervisor Tom Patty. I am no longer able to participate in this meeting. I'm going to have to log off. I do not support the length of this presentation. As being that I'm sick, I'm now going to log off. I'm no longer able to participate.
Okay. Thank you, Supervisor Patty. Thanks for your time so far today. We appreciate it.
Yeah, the presentation this long, I've lost my support for anybody in this argument. This is abusive. Thank you.
Thank you.
I'm sorry, I didn't understand that, but did he say I'm talking too much?
We're really hoping to get through this.
I've got two more slides.
If
Sorry, this is my life also.
I appreciate that.
Thank you. We would like to make a request to have measurable noise pollution. A measurable decibel level is easier to enforce, and it protects us as well as our neighbors. We have already completed a noise study, and as a demonstration of goodwill to our neighbors, we are willing to limit the decibel level to a number that is below the current county threshold. We are willing to limit the events with amplified sound to a specified day or days of the week. We are willing to limit the number of events with amplified sound per year, and we are willing to voluntarily end all amplified sound at 9 p.m. instead of 10 p.m. So we are asking the board to please consider amending the condition of approval to include measurable amplified sound. We believe our project will preserve the past for the future. Our project will repurpose an unused historic county resource, make it relevant again, and preserve it for future generations. When people choose a location to celebrate the milestones in life, such as weddings, bridal showers, baby showers, and memorials, that location becomes an integral part of the experience those people share. When new memories are made in historic locations, those locations become current again. This process is vital to the preservation of historic buildings. Approving our project could also benefit the town of Lockford by providing an increased sense of community identity, greater economic diversity, and a reason for tourists to stay and spend money in our local economy. That does conclude my presentation. I'm available to answer any questions. I believe our civil engineer, Mike Smith, is also on the line if you have any questions for him.
Thank you. Before we go to questions, I'm going to ask if there's anyone on the phone or if we've received any comments of anyone wanting to speak in opposition to the appeal.
Madam Chair, I did have a request to participate telephonically from Patricia Stetson, but she has also submitted written comments that I can read now.
Okay, thank you.
She writes, I have been a resident of Lockford for over 30 years. I met the project property owners shortly after they moved to town. They have both shown active interest in being part of the small community by attending public MAC meetings and becoming active with our local nonprofit, which supports our only small park in town, Lockford Memorial Park. Since they purchased the property, the visual improvements are quite evident. It appears they have invested substantial funds to make these improvements, and it was definitely become a more attractive property and setting. Our community does not have an upscale venue for events. This project would be a benefit for Lockford and the surrounding area. Although there are wineries, there are not private venues for such caliber. The Lockford Community Center is a basic hall available for rentals for up to 140 people, 7 days a week, with very specific rules in the contract. I live very near this community center and parking lot of about 55 space, which was lighting dusk to dawn. Rentals have requirements to shut down by 10 p.m., cleaned out and vacated by 11 p.m., doors closed with amplified music, and more. If there's a problem or violation, the community can call the property owner, Lockford Community Services District, with a complaint and expect action. Likewise, a venue inside and outside as outlined in the permit has strict requirements. These would be serious business recourses if renters did not follow their contract and ultimately the owners did not follow the county requirements. I do not believe that the property owners will risk their purchased business by allowing disruption or careless people to rent their facilities. We can definitely use a family-based business like this which can promote our community and history. That spurs more visitor and businesses, which improve and add to our community and small town atmosphere. I believe the property owners are good stewards of their historical inn and property. A public use as a public venue would be a benefit to Lockford. Written by Patricia Stetson. And that's the only written comment that I've received in support of the project. I'm not sure if Mr. Thayer is participating telephonically and wanted to comment.
If you have specific questions, I believe so.
Okay, so that's all the public comments at this time.
So at this point, I'll ask the board if you have
Hello,
any.
this is Mr.
Okay, Mr. Thayer, I'm assuming that's you. I'm going to ask the board if there are any specific questions for at this time.
Not at this time.
Okay. Thank you very much, Ms. Baer. At this point, I'm going to ask if the appellant wishes to rebut any of the specific comments. This is specific rebuttal. This isn't to make more comments, please.
On the comment about how we did not respond to the emails, those emails that we received from Mrs. Thayer regarding the project, we wrote the letters to the county, submitted them to the county. They were immediately given to the Thayers, and then they wrote comments on our personal emails back. We chose not to respond because we didn't want to get into a tit for tat. So the letters that she spoke of us not commenting to were the ones we wrote to the county, and then the county gave to the.
Okay.
They did not come from us. So that's how come we chose not to respond, because they were letters written to the county in opposition. They were immediately given to the Thayers, then boom, we were given. We chose not to respond. And then on the surface screening in their application, it says they're requesting the modification due to the small size of the parcel and limited usable space for parking and stormwater retention. So the core product was mentioned and requested for a different reasoning, and it's in the original county community development department.
Okay.
That's it.
Thank you. Appreciate that. Are there any other questions from the board? Is there anyone else that wishes to speak? If not, I'm going to close the public hearing and then we'll go to final comments. Okay. I'm closing the public hearing, and I'm going to bring it back to the board for any final comments. Supervisor Wynn?
A couple of questions. In regards to the requests of the residents or the neighbors as far as the wall and the draining, those types of things, are they adequately addressed in regards to the plot plan or at least the project site?
Okay, through the chair, staff does believe that we have adequately addressed any potential impacts and feel that the conditions of approval in the project in the board packet do address any issues. We did go through some extensive redesign of the site plan because we did have concerns when there were parking spaces aiming towards the neighboring properties. So they did redesign that so that lights do not go towards them. So we did feel that the modification request for the fence and vegetation did provide adequate screening. The same kind of review was given to the alternative surfacing requirement. We felt the screening and the surfacing requirement were more consistent with the design and type of project proposed, but still satisfied the underlying issues.
My experience is the type of fence that's displayed in the pictures is certainly not as soundproofing as a masonry wall would be. So the question, and the appellant had talked about the stopping of the wall at her property as opposed to extending. So I'll be very honest, I have a concern because I have a proliferation of these type of event centers in my district, and I can't tell you the number of times I've gone out and met with neighbors who have complained, and I appreciate the presentation in regards to the type of events, but it's obvious, at least for me, that one of the main concerns you have in regards to this project is a lack of revenue in regards to your existing bed and breakfast facility. And I would say that what most businesses that I've seen out there, and usually they're wineries that are really, for the most part, are event centers and not really wineries. But I've gone out and seen enough complaints from neighbors in regards to, it's not just the noise, it's not just the, sometimes it's the parking, sometimes it's, especially when they're close to orchards, and I know this doesn't have that, but parking in orchards, you know, affecting farmers and their ability to do their jobs. So I guess my concern would be that certainly a stronger or maybe sturdier fence to block any sound, because I certainly don't agree with amplification, because frankly, amplification, and I'll be honest, this is an ag and a residential property, period. The only thing that I understand that obviously triggers this to allow them is because the historical, you know, registry that they belong to. And so I don't even know without that whether they would be able to operate this, but I understand the law, and I understand that. So I would offer that some better barrier in regards to sound be provided between the neighbors, understanding their elevation compared to this particular property. And I think also, and this is something I deal with all the time in my district, because my district floods, is the drainage in regards to any changes that would be made that would affect the neighborhood in regards to flooding or backing up, et cetera. I do appreciate the type of I guess, footing that you're going to put in regards to the parking lot to allow drainage. I think it's a good thing, and hopefully that solves some of the problem. But I would say, and I would, guess depend on the vote of the board, but I would say that those two issues need to be resolved if to move forward, to make sure that the neighbors are not adversely affected by the activities. I understand the 4 days. Is that, I assume that's part of the permit, that they only do 4 days a week, or is that just an average?
Typically, we ask for, when we're doing the environmental review, we need to understand the scope, scale of the project. So we have to have an idea on the scale. So they did provide an average of 4. We don't typically restrict a project like this to how many days they can have these operations. We feel like it's actually better to just address all of the issues so that if they did have them on a daily basis, that all the issues would be addressed adequately.
Well, I know
also very difficult from an enforcement standpoint.
I appreciate that. I know that with the winery ordinance, essentially we allow daily activities. And, you know, with a large number of participants, up to over 300 in certain venues, not in all of them, obviously. But this is one of the smaller ones that would parallel that particular ordinance in regards to allowing events to occur. I certainly am very empathetic to the neighbors in regards to, and looking at the photos, one of the concerns I have is if you come out of that one driveway, or actually either one of them, and the hill that's located there, is you have trees, and the more cars you add with more people, and I'm assuming the type of activities that may occur there, every additional car creates another potential additional accident because of coming directly out of there and the sight distance that people coming out, and more importantly, people who are coming down the road, because I've been out there. It is a busy road, and trucks, et cetera. So I would ask also that maybe Public Works look at it, because I've been out with Public Works looking at those particular entrances or exits to make sure that there's legitimate or safety sight distance to preclude any type of additional accident potential that may occur at that particular location. So those are the things. Again, I have my concerns in regards to an event center in a neighborhood, but if those particular aspects can be mitigated, I would see them being to move forward. I would also ask one other thing is I would hope that we could do it for, as opposed to, and their particular business may be very popular based upon certainly what I saw in regards to the not only the house but certainly the barn. It could be, you know, although the list of requests are spread over days, there may be an opportunity when we get through this pandemic that people may go crazy and see this as a real opportunity to have an event, whatever that happens to be. So I would want to see, if we're talking about 4, let's keep it at 4. That provides them with the opportunity to maximize the weekends, which most events occur. But there are other events that are during the week, birthday celebrations, anniversaries, those types of things, which happen on a particular day. So those would be my requests if we deny the appeal, to allow certainly a little more mitigation in regards to those particular issues. So I would leave it with the rest of the board for their comments.
Supervisor Villaputua? You
know what? It's a historical barn. I think the town deserves a place to have events. I'd support it. I think it'd be pretty neat to, you know, the way that the money they invested to make it look nice and beautiful, and I think everybody's desire is to have it there. So I think I'd be in support of the project and denying the appeal.
Thank you. Supervisor Elliott?
Thank you. I have some reservations about this particular project. I mean, it is requesting a use permit for a commercial use and event center in a residential and agricultural area. So that in itself presents some problems. And I guess one question I've got is there was mention of this petition that had been signed by neighbors. I'm not sure how many people signed it, but they said that if all of the conditions that were on this petition were met, then the appellant would withdraw their appeal, or they would be okay with the project. So I guess my question there is, has any serious discussion of that list of requirements been done between the appellant and the project proponent?
I have not reviewed nor seen any of the information that Ms. LaPelt was referring to.
Right. This just came to us today, and so it doesn't appear that there's been any discussion between At least we're not aware of any discussion.
Okay, would you be willing to consider a discussion here to try to come to a point of agreement on these things?
So I guess, Supervisor Elliott, do you have the list in front of you?
No, I don't have the list either, as the items were ticked off.
Correct. It was a solid masonry wall, 6 to 7 feet in height. All events, indoor and outdoor, limited to 1 per month. No events on major holidays, Christmas, New Year's, or Easter. Hours of operations, 8 to 8, as opposed to 8 to 10. And that includes setup and takedown. No amplification of any type for any kind of event. And number of persons at an event not to exceed 75. And that includes staff as well as attendees.
Okay, and then there was something about a security guard if alcohol were to be served.
Yes. Yes, if there's any alcohol to be served. Why am I not seeing that on this list? The last one. Oh. Yeah, that that a security guard would be required.
So my recommendation would be that the two parties discuss that a little bit, and if there can be some agreement on even some of those items, maybe a compromise could be reached.
Well, within, okay, here's the project proponent.
Thank you, Chair Miller. I would agree to all of those conditions except for 2. The 2 being the limitation of only 1 event per month as extremely restrictive, and the requirement to have a security guard on site for alcohol consumption. However, I agree with the operating hours. I would agree with the limitation on the number of people. I am fine to put up a brick wall if that's what Kathleen would like. Do that. A masonry wall. I don't know that it would be brick, but masonry. I would need clarification on the extent of that wall, because the area at the top where the property is level, where the current wood fence is, that is the section I would replace with brick. But going down the hill, separating her field from my bluff, I don't see why I would have to build a masonry wall down there. But we do intend to plant shrubbery there to keep people from looking into the field, because I know that is a concern of hers. So if we can limit the masonry wall to the same distance that is currently the fence, I would agree to that.
Okay, I'm looking, some of these things aren't itemized, they're just in here. It also says they're requesting drainage ponds, but we've heard from staff that they don't believe the drainage ponds are actually a preferred alternative, because the product that's proposed is going to handle the drainage, correct? Oh, here we go.
Chair Miller, so the process is that their engineer proposes a engineering standard to remediate, if you will, the drainage issues. We in our county refer the issue out to our Public Works Department, who takes a look at it to make sure it actually meets county standards. So what we represent today is a combination of all of the department's standards in the conditions of approval of the staff report before you. So in other words, it is acceptable to the county in terms of what mitigation is proposed for drainage requirements.
Okay, thank you. And I got some clarification. On the actual signed petition, the points that are itemized are the 1 per month for events, no major holidays, hours of operation 8 to 8, no amplification for any events, number of persons limited to 75, including staff, and events serving alcohol require security. On this particular petition, I'm not seeing anything about the masonry wall. Okay, well,
Madam Chair, I'm sorry.
Okay.
The record won't be able to pick
Yeah,
up.
we can't pick up comments that are just from the audience, but the project proponent has agreed to substitute the wood fence with a masonry fence. So the two items that don't work are limiting to one per month. I have to say, in my own opinion, that's extremely restrictive, and we don't apply that to any of the other facilities. And also requiring outside security. That's, I think, overly restrictive in my opinion as well. It would be different if complaints are received and then there's a process to address the permit if there's complaints that are received. So that's something that could be added later if there are problems with the neighbors. So I guess I would ask the individuals, Ms. Lapelt, in terms of your opposition, there's an offer from Ms. Baer to essentially meet the majority of your issues that were signed on by the neighbors. So would you like to come up and let us know if that's acceptable to you? Otherwise, we'll move forward as a board.
On the masonry wall, I'm referring to the exception to the development title, which stipulates that there is in any commercial project that abuts a residential area. So they're asking for an exception to the title. And I'm requesting that they not have that exception. So that's where the masonry wall 6 to 7 feet came from, is the development title that they asked exception for.
Okay, we'll have staff address that on the development title. But what I'm asking you is, there's an offer from the project proponent to, and I would concur with Supervisor Wynn in terms of the numbers. I would say up to a maximum of 4 per week. I think that's a reasonable restriction on the number. My concern is, we heard from the project proponent that it's very seasonal, which when you listen to that, I mean, she said there were months where there's no real events. My concern is there would be several months out of the year where there could be events 6 or 7 days out of the week. I think limiting it to a total of 4 per week, I would be fine with that. But the project proponent is fine on the holidays, shortening the hours of operation to 8 p.m., the number of people down to 75. So I guess what we're asking is, does this seem like an acceptable compromise to you?
I want to request that the masonry fence, I've never expected one to go down the hill, but I would like one to keep the people, you could go across the top and continue the masonry a different way so I'm less exposed. Because where they stop the wooden fence, it views right in. And it could conceivably go further than what the wooden fence is.
Chairman,
yes, I'm going to.
If I can provide some assistance, we do have the aerial photography that shows the fence location, so we can provide some clarity as to both height and length and side of the fence or wall that's being talked about at this point.
Where is the actual the existing wooden fence? I don't see that. We need a pointer. Because the lot line, I think, is obscuring some of it.
There we go. When we did our site visit, Chair Miller, the fence was along this location, and it stops approximately right here because Ms. LaPelt was showing us that she could still view the barn from her property. So I believe what she's asking for is for it to extend beyond where it is right now.
Come up this way, more toward the barn a little, just so it curves around a little bit. Right, so it goes down, there's the master bedroom a little, and keeps like where all the sheds are, and I took pictures of, just so people aren't walking straight up. Right. Correct. Not just go where the wooden fence is now.
Okay.
Correct. Not just replace the wooden fence that's there.
Okay.
Does that make sense to you? Since you were out there, you kind of see. So if it were extended around more, give me more privacy that will be coming in. And that, again, is according to the title.
So, Chair Miller, we do know where the existing fence, the wood fence location is. If the proposal is a modification of the condition to replace exactly that same fence, wood fence, into a masonry wall, we will know exactly how long the lineal dimensions of that would be in terms of a condition. And we can figure out based upon the documents we've got on our file. If the condition is modified to include something that Mrs. LaPelt would like to have, which is usually it's along the perimeter of the fence as opposed to kind of curving it. So we would need to know some kind of specificity in terms of what she's asking for regarding curving that. What would been a fence is now a wall as well. The easiest thing usually is from a privacy standpoint is just following the lineal dimensions of the property line itself.
That would work. I mean, but I just further than the wooden fence, if you want to take it down the hill, I thought that was a problem.
Well, it seems to me that if the masonry wall goes to where the property drops off, that's not an area where people are going to be walking. It's a drop off.
No, it doesn't drop off. That's why I have pictures. Oh.
There are different slopes on each side of the property. Mrs. LaPelt being out there, we could tell her side drops off more significantly than the side on the subject site itself. That's more leveled. It's on her side where the slope starts. So you're looking down in some respects. So one of the modifications could be we take it all the way down to that 90-degree angle where that looks like a road or some kind of path is, but that'd be a pretty significant length of property. As it is, it's probably already 250 feet.
Madam Chair.
Yes.
We have a public comment request from Mr. Thayer. He said he'd like to comment on the fence.
Okay. Thayer, please go ahead.
Am I online?
Yes, you are. We can hear you.
Okay. So I'm very familiar with the section of the fence that's being discussed. The first point I'd like to make is that the slope where the fence currently stops changes dramatically from near level to approximately 30 degrees as it goes down. If we were to erect a fence at the property line, it would not obscure a view from the above into her property because the topography. The fence line at that point would have to be about 30 feet high in order to obscure any view from that area of the property down into her home. The second point is that part of her property is utility use only and it's not open to the public. That is a utility shed. It is for storage of our lawnmower and gardening equipment, and there's even a posted sign in that area that says restricted access. The public is not allowed. So that area will be strictly cordoned off from public access. With regards to trying to respect her privacy, which I absolutely do. I do not want to invade Ms. LaPelle's privacy at all. Oh, there you can see in the image that's on the but you can see how the wooden fence curves at the edge of the property close to the corner of her house. It stops there because that's where the slope abruptly changes. I'm not sure if she is requesting to put a masonry fence all the way down the bluff to the bottom of the property, which I don't see that would be helpful because if you're on top of a hill, a 6-foot high fence doesn't make any difference. So I'm looking for clarification there.
Going to turn to staff on that.
I would concur with what Mr. Thayer is saying. When we went out there, we saw the same concern, is that the property does drop down so that even if you erected a 6 or 7 foot fence, people standing on the higher elevation, it wouldn't really block much. So we did discuss a taller fence, but I don't know that I don't know that a tall enough fence can be erected to satisfy what Ms. LaPelle would like.
Just a quick question.
And again,
There are other ways to.
It would be for the owners.
There are other ways to provide privacy other than fences.
Right.
And as I look at the picture, there appears to be some trees in that location. Is that correct?
Yes.
Okay, so there are a variety of cypresses or shrubs or whatever that grow that become a wall of sorts that completely block any kind of view, especially if you're talking about from an upper level to a lower level, as far as, and it may not happen immediately, but certainly within a certain amount of time, it's going to provide a clear, I mean, those things grow 30 or 40 feet high. So I guess my question would be is to satisfy the privacy issue, because obviously the block wall, unless you build it extremely high, is not going to suffice, that there would be some other kind of screen that would be provided to ensure that it, in the near future, that particular view would be blocked for your house, whatever, which is not a wall, but it certainly provides a screen or that.
In your packet, I included the picture.
Please, could you speak into the microphone, please?
I'm sorry. In the picture on the top, it includes where the wooden fence stops, picture of the corner of my bedroom, and where I'd just like it to be continued. You can see that it's not a sharp drop-off. I just am asking it be continued further, a block wall, because as it is, people can look right into the bedroom, which is on the top floor. And I passed around the hard copy of the photos. And so it's not impossible to continue a block wall, the required masonry block wall.
You need to replace the existing wood fence as well,
Yes.
even though you've erected the black screen over your chain link.
Even though
You've placed the black screening material over against your shed area.
Comments should be directed to the Board of Supervisors, not to the individual participants.
I apologize.
Are you talking about this one picture at the top where the chain link fence is at your level?
Yes.
And then there's the wood fence on top?
Yes, that's the wooden
Then
fence.
then there's an opening, and then it appears there's some type of structure?
Correct.
Is that correct?
Correct.
I see a distance of maybe, 10 feet, maybe 15 at the most. Is that correct?
Maybe 20?
It's hard to tell from this picture, but...
Because I think the fence is 8-foot sections, in between.
Okay.
Yes. Just continue it. You can see it doesn't drop off sharp. Just follow that fence line further. If you just continued that, if you made that wooden fence masonry, but just continued it, say 20 feet further, it would definitely help with my privacy.
Oh, I don't know what would it be 20 feet, but it's probably 20 feet or less.
Not sure. Yeah. We're not talking hundreds of feet. I'm not talking about going all the way down the hill.
Right.
I'm just talking about isolating my home.
Got it. Okay. Thank you.
Okay, thank you, Ms. LaPelt. So what you're basically saying is if they're willing to replace the wooden fence with masonry and extend it to that storage shed?
Yeah, a little past the storage shed, as you saw in the photo, yes.
Other than that, the compromise is acceptable?
I can't speak for the 4 events a week. That's a lot in our neighborhood.
Well, that would be a maximum. So
I mean,
it certainly wouldn't be every week.
That's a lot.
Well, typically that's going to take you over a long weekend.
And as far as, but that's our weekend as well. And that's why we're, and that's why that's a lot in our neighborhood.
So
I realize that 1 a month, okay, but I'm trying to work with people collectively. There are a lot of people that are very angry about this whole thing. And so that was a compromise. 4 a week is a lot.
So you're saying that this compromise is not acceptable? You still oppose the project?
Well, of course I am not liking the fact that I'm opposed to an event center, but I'm trying to compromise, and I'm asking, can we have less than 4 a week?
Okay. But everything else you're all right with, not requiring the outside security. Ms. Baer has essentially agreed to the others.
I think we need to, for clarity, could we just real brief make sure that I know what you're speaking of, because so the event hours are okay. No major holidays, no amplification inside or outside. Number of persons, including those that work there, and, the whole bit. So the question is the outside security for alcohol and the 1 a month. And then okay with the block wall continuing as stated beyond the shed there on the, okay?
Well, to a point where it
right.
shields the view of your bedroom.
Right, thank you. And so the only thing is I'm requesting, 4 a month is extreme. 4 a week, 4 events per week is extreme.
Okay, then I think we've got what we need from you. It's going to be up to the board at this point.
Thank you.
Thank you. Thank you for your input. Mr. Thayer and Ms. Baer, thank you for your input. So I'm going to bring it back to the board to see where we're at. Supervisor Elliott, I hope that satisfied your request for process in terms of trying to strike a compromise. At this point in time, as I understand it, the point of contention that we're still looking for the board to provide guidance on in terms of limitation is number of events. It's been suggested by Supervisor Wynn that be limited to a maximum of 4 times per week. Events will not be held on the major holidays. Event hours of operation will be limited from 8 a.m. to 8 p.m. There will be no amplification of sound, which has already been included in the recommendations from staff. Number of persons would be limited to 75 per event. And the masonry, the wood fence would be replaced by a masonry fence that would extend beyond the existing length toward the shed to such point that it goes to the shed and or provides adequate privacy for next door. That would be the restriction. Yeah.
What we can do is go out back to the subject site and look at where their grade starts dropping to determine where that should terminate.
Perfect. Thank you. So that's, as I understand it, Supervisor Elliott, that is where the compromise is. I'm going to bring it back to the board now to see if those restrictions are acceptable to the board, and if so, we'll take action. Supervisor Villaputua? Okay, Supervisor Elliott?
No further comments.
Thank you. Supervisor Wynn?
I'll make a motion to adopt that recommendation.
I'll second the motion.
So I want to put up exactly what we're going to approve because there was some specific language on this. Can we get the slide again on the recommendation? Because there were several parts, as I recall.
Get that right up, Madam Chair.
Okay, so this will be to deny the appeal, adopt the mitigated negative declaration, adopt the findings for the use permit with the addition, is that correct? Or the next one, approve the conditions of approval, and we're going to add the additional modifications to this. So it will be remove outdoor, replace concrete with pavement, replace wood fence with a masonry fence. Staff will determine the length of that. And the other one do you have the other ones? No.
Would you like me to go over them?
Yes,
Okay.
thank you. Let's read that, and then we'll let Supervisor Wynn move with his.
So
Go
we
ahead.
would be looking at amending the hours of operation to end by 8 p.m. rather than 10. We can add language in that states that there shall be no events held on major holidays. We will limit the number of people amend it from 100 to 75. And we will add a condition that states that there will be a maximum of 4 events per week. I would request clarification on if we are going with the vegetation planting that Supervisor Wynn had suggested, or is the masonry wall the compromise and we do not need to address the language for the vegetation?
Well, from what I saw in the picture, I don't think we need the vegetation because the fence goes to the shed.
Okay.
Which then covers
I just
whatever.
wanted clarification so I didn't miss that.
Yeah.
And I believe that
Sound.
captured everything.
Amplified sound.
That's right up there, and Chair Miller did read that condition. The condition is already in the recommended conditions of approval. Right now, it reads as no outdoor amplified sound. If we strike outdoor, it's just no amplified sound. So it's in agreement with Ms. LaPelle's.
Okay, so.
Move to.
Yes.
Move to approve that recommendation.
Thank you. Do we have a second?
Second.
We have a motion and a second. We have a roll call vote, please.
Supervisor Villapudua?
Yes.
Supervisor Wynn?
Yes.
Supervisor Elliott?
Yes.
Supervisor Miller?
Yes.
And for the record, Supervisor Patty is absent.
Okay. All right. Thank you very much. We're gonna try and power through this next one quickly if it's at all possible. We're going to conduct a public hearing to consider Planning Commission's recommendation to adopt mitigated negative declaration and approve master plan amendment application number PA 2000063, specific plan 1 amendment application number PA 2000064, and site approval application number PA 2000065 of Rankins Ag Inc. In Mountain House Community. So, Mr. Funderburg, welcome.
Good afternoon, Madam Chair and Supervisors. Thank you. This project is comprised of 3 separate applications: a master plan amendment application, a specific plan 1 amendment application, and a site approval application. The master plan amendment and specific plan 1 amendment primarily focus on changes to map figures and text in these documents to conform to the proposed underlying site approval application for the construction services heavy development project located in the Old River Industrial Park Southeast expansion area. The project site is located at the north side of West Bethany Road, 650 feet east-south of Henderson Road, Mountain House. The current general plan designation for the project site is IG, General Industrial, and the site has a current zoning designation of AU20, Urban Agricultural Reserve, 20-acre minimum. This is a current aerial picture of the project site, and it is currently developed with the Farm Services Headquarters operation that was approved by the Community Development Department on July 24, 1997. The surrounding land uses to the north include the Old River Industrial Park, which is currently undeveloped. The adjacent land uses to the east, south, and west of the project site are agricultural with a few scattered residences, and further southeast is the wastewater treatment plant and corporation yards for the Mountain House Community Services District. This is a copy of the proposed site plan for the site approval application submitted by the applicant, which depicts the development of the proposed 12,000 square foot office and warehouse building in the center of the site plan, an existing 5,800 square foot office shop building, which is located on the east boundary. Analysis. In order to proceed with the underlying project, the applicant, Pinnacle Ridge LLC, has requested to amend the existing master plan and specific plan 1 documents. The master plan text amendment will strengthen the existing master plan policy language to allow for the construction services heavy use type in the IG zones for Mountain House, and will also help facilitate future economic development opportunities in the industrial zones for Mountain House. The specific plan 1 amendment will change the zoning at the project site from AU20 to IG General Industrial to ensure compatibility with the proposed underlying project. The approval of the underlying project will again facilitate job development in accordance with the specific Plan 1 policies, which states that the expansion areas adjacent to the Old River Industrial Park shall be encouraged to develop as soon as practical to facilitate job development. In terms of the development for the project site, the design and aesthetics will be developed in accordance with the Mountain House Commercial Office and Industrial Design Manual. The design manual includes standards for site planning, architecture, landscaping, and community elements. Job generation. The anticipated number of full-time equivalent jobs for the project site is 35 jobs. This is the same as the minimum number of jobs per acre assumed by the master plan and specific plan 1 for general industrial expansion areas. Consistency with adopted plans. The project was reviewed for consistency with the general plan, Mountain House master plan, and specific plan 1 documents. The industrial development project was found to be consistent with these plans because it is supportive of the master plan policies and specific plan provisions regarding the development and location of industrial and commercial projects. It does not affect existing plan and industrial and commercial employment for Mountain House. No significant changes in jobs are expected that would adversely affect the number of jobs projected or the jobs housing ratios anticipated for the community. This first photo is taken from West Bethany Road facing east for the project site. The second photo is taken from West Bethany Road again facing southeast. This photo is taken from West Bethany Road facing southwest where the new proposed building will be built. Recommendation. Staff recommends that the Board of Supervisors adopts the mitigated negative declaration for PA 200063, PA 200064, and PA 20065, approved master plan amendment application based on the ability to make the bases for master plan, approved specific plan 1 amendment application based on the ability to make the bases for a specific plan amendment, and approve the site approval application based on the ability to make the findings for the site approval. Thank you, Madam Chair. This concludes staff's presentation.
Thank you.
Probably it's the fastest.
Are there any questions for staff?
No.
Then I'm going to open the public hearing. And is there any, have we received any public comments on this, Clerk?
Oh, no, we have not, Madam Chair.
Okay. All right, then I'm going to close the public hearing. And I'm going to ask board members if there's any final comments or questions.
I'll make a motion to approve.
Okay, I think I heard Supervisor Elliott, so I'm going to say Supervisor Villaputua made the motion and Supervisor Elliott, you were the second. Is that acceptable?
That's okay.
All righty. Okay, we have a motion and a second. Roll call vote, please.
Supervisor Villapudua? Supervisor Wynn?
Yes.
Supervisor Elliott?
Yes.
Supervisor Miller?
Yes.
And for the record, Supervisor Patty is absent.
Great. Thank you so much. Thank you.
Thank you, Madam Chair and Supervisors.
Thank you for your patience, everyone. We are going to take a break. We're going to be back here at 3 o'clock for our discussion items, and we will see everybody then. All righty? Thank you.
Sheriff's Office. Total net assessed value increase.
Supervisor Patty, have you rejoined the meeting? This is Rochelle. Supervisor Elliott, are you on the line?
Yes, I am.
Thank you. I'm just double checking before we get started.
Okay.
This is Supervisor Patty, also online. Can you hear me?
Good afternoon, Supervisor Patty. Yes, I hear you.
Excellent. I am present.
Thank you. I'll let the chair know for the record that you have rejoined the meeting. Supervisors, if you could please go ahead and mute your mics until we start the meeting. And you would do that by pressing *6.
We are back for our afternoon session. Thank you, everyone. First up, for our first discussion item on general government, we are going to accept or look at our fiscal year 2021 first quarter budget report. Gallo, thank you for being here.
Thank you. Good afternoon, Chair Miller, members of the board, CAO Nino, County Council Miles. This is the staff report for the 2021 first quarter budget report and the preliminary 21-22 budget forecast. Oh, there we go. Thank you. On October 7th, county department heads were requested to conduct a comprehensive review of expenditures and revenues through the first 3 months of fiscal year ended September 30th, 2020, and also to provide our office with 2021 year-end projections within their respective budgets. These projections provide an early indication of departmental budget performance, identification of fiscal and operational issues, and a basis for estimating year-end fund balances. In order to provide a more accurate picture of the county's current overall financial health, it is necessary to identify the available unreserved undesignated fund balance that remained in the general fund on July 1, 2020. The general fund unreserved undesignated fund balance on June 30, 2019 was $22.2 million. During 1920, departments experienced a $47.4 million net county cost savings. Contributing to the savings was approximately $15 million in CARES Act reimbursement. The remaining $32.4 million was primarily due to salary savings as a result of vacancies in various budgets. These adjustments resulted in a general fund unreserved undesignated fund balance of $69.6 million on June 30, 2020, and available on July 1, 2020. The following report summarizes projected expenditures and revenues for 2020-21, highlights significant fiscal issues, and provides a preliminary budget outlook for fiscal year 21-22. This table provides a summary of the overall county budget for 2021. The summary includes the 2021 adjusted budget, plus encumbrances carried forward from 2019-20 and board-approved budget adjustments through September 30th. The overall adjusted budget totals $1.98 billion in total appropriations. Approximately 81.8% of funding, or $1.62 billion, comes from departmental revenues. 15.7%, or $309.7 million, comes from the general purpose revenue, while the remaining sources come from fund balance, which accounts for 2.5%, or $49.1 million. Fund balances are utilized from the general fund, contingency fund, and other funds primarily consisting of road funds, hospital enterprise fund, solid waste enterprise fund, and the airport enterprise fund. The largest expense in the county budget is salary and benefits costs. This table provides a snapshot of the total full-time and part-time positions. As of September 30th, there were 6,652 allocated positions, of which 757, or 11.4%, were vacant. Approximately 59.4% of the vacant positions are in the Healthcare Services Agency with 181, San Joaquin General Hospital with 117, Human Services Agency with 104, and Public Works with 48. These positions are primarily funded by federal or state programs or by service fees. The net county cost is computed by subtracting program revenues from expenditures for general fund supported activities. This table shows the projected net county cost by functional area based on the first 3 months' experience. Law and Justice utilizes the most net county cost at a budgeted $192.3 million, followed by general government with $52.4 million. Overall, it is projected that there will be a net county cost savings of approximately $96.2 million by year end. I should point out that departmental projections do not include costs of the October agreement made with SEIU and the unrepresented units, or the costs of the agreement made with the San Joaquin County Attorneys Association in November. These bargaining units total 71.4% of the county workforce. Together, costs for the 24-month agreements total $40.4 million, with the net county costs of $12.5 million. For the remainder of 2021, costs total $14.8 million, with the net county cost of $4.7 million. Through the first quarter review, several issues were identified. Human Resources is projecting a savings of $484,617, primarily due to salary savings and an overall increase in cost reimbursement, largely due to a one-time offset from the CARES Act funds. Overall savings is offset by a budget overage in professional services. Sloan Sakai provides the county with legal services and support for labor-related grievances, negotiations, and litigation. Appropriations of $200,000 for services performed by Sloan Sakai were included in the 2021 adopted budget. However, more than $147,000 were used to pay for services done in 2019-20. As a result, the department now estimates the total cost for services for Sloan Sakai will be $450,000 in 2021, $250,000 more than the current budget, and exceeds the purchasing agent's authority. Current outstanding bills through October 2020 total approximately $100,000. In order to process the outstanding bills and partially address the shortfall in professional services, the department requests an appropriation transfer in the amount of $100,000 from salary and benefits to professional services. County Council has secured a retention agreement with Sloan Sakai in order to process bills for the remainder of 2021. Based on the first 3 months' experience, Air Park is projected to exceed budget by $77,811, primarily reflecting actual project-related cost reimbursements and an increase in outside legal counsel services to support the first phase of development. On October 6, 2020, the board approved the amended and restated master development agreement, which included an increase in appropriations in the amount of $60,000. Based on actual expenditures, the county administrator recommends approval of an appropriation increase of $17,811 in the Air Park 599 budget funded by the Airport East Project Fund. The Law and Justice Departments are projecting an overall net county cost savings of $79.3 million. The primary savings is from CARES Act reimbursement totaling $71.3 million by fiscal year end. Vacancies in the sheriff, probation, and district attorney budgets are also contributing to the savings. As of September 30th, the sheriff had 115 vacancies, probation had 72, and the district attorney had 33. Partially contributing to the high number of vacancies is the comprehensive hiring process, including an extensive background check. The salary savings is partially offset by overtime costs for the sheriff, patrol, and custody divisions, which are projected to exceed budget by $2 million and $3.8 million, respectively. The custody division is also projecting a savings of $1 million in food and clothing costs due to a lower than anticipated average daily inmate population of 1,351 compared to the budgeted level of 1,550. However, recent statistics for October and November indicate the population is steadily increasing, primarily due to the county's continued housing of state prisoners during the COVID-19 pandemic, which has been an average of 187 state prisoners for the first quarter. The state budget reduced base funding of the local community corrections AB 109 budget by $5.6 million and eliminated growth funding of $2.8 million for the next 2 years. To partially address the shortfall, the state budget included $750 million statewide to counties experiencing revenue losses for realigned programs. Our county's portion of this realignment backfill is $13.4 million. Of the $13.4 million, $2.6 million is designated for public safety realignment programs. The exact amount that will be allocated to the AB 109 budget is undetermined at this time. Probation is projecting a shortfall of $8.1 million in the AB 109 budget. Any shortfall will be funded by the AB 109 Trust Fund Reserve, which as of October 31st, 2020, had a fund balance of $43.9 million. The 2019-2020 SB 678 budget included appropriations for the Adult Day Reporting Center Classroom Remodel Project. The project was expected to be completed by year end of 1920. Due to the COVID-19 pandemic, the construction was delayed and work remained on the project by year end. Remaining appropriations of $163,023 were not encumbered to be used towards the project in 2021. The project has since been completed, and the General Services Department has paid outstanding costs to vendors totaling the $163,023. It is recommended that appropriations in the probation SB 678 budget be increased by $163,023, offset with funding from the SB 678 fund to reimburse the General Services Department. The board has established homelessness prevention as an operational priority for all county departments. Several departments regularly provide services to the homeless. The county plays a lead role in coordinating regional homelessness prevention efforts through its involvement in the continuum of care, ongoing collaboration with other jurisdictions and various community organizations, and activities of the Homeless Initiatives Program Administrator. As indicated in the 2021 proposed budget, the program administrator position is being transferred from the County Administrator's Office to the Healthcare Services Agency. The position will continue to serve as the focal point for the county's efforts to reduce and prevent homelessness, as well as acting as liaison between the county and many outside agencies involved in assisting with homelessness prevention. In addition, given the number of related funding streams currently administered by the Neighborhood Preservation Division of the Community Development Department, the neighborhood preservation budget and staff are also being transferred from community development to the Healthcare Services Agency. This consolidation of resources will allow closer integration of various programs and staffing. The transfer to healthcare services will provide enhanced collaboration with other healthcare services responsibilities, such as behavioral health, public health, veteran services, and whole person care. As the transition to healthcare services moves forward, additional staff may be recommended as part of the 21-22 proposed budget for the coordination of neighborhood preservation programs. In conjunction with the restructuring, the vacant Deputy Director of Programs Administration position will be deleted from the Neighborhood Preservation Division budget. To meet increased demands for administrative and budgetary functions in community development, 2 positions will be added to the Community Development Department mid-year 2021, including a Deputy Director of Planning and a Management Analyst. It is anticipated there will be no net increase in county costs, since these costs will be offset by the deletion of the Deputy Director of Programs Administration position and its partial reimbursement from the Community Development Department budget, as well as the planned elimination of vacant CDD positions either during 2021 or as part of the 21-22 proposed budget. During 2019-20, the functions of the Office of the Medical Examiner began transitioning from the Sheriff's Office to Healthcare Services, and beginning on July 1, 2020, both operational and fiscal responsibilities were transferred to the Healthcare Services Agency. Allocated staffing includes 15 positions. Recruitment and training of new staff continues during 2020-21, with completion of training expected by spring of 2021. The Sheriff's Office continues to provide assistance for investigation and administrative support as needed, delaying redeployment of staff to patrol activities, including the community car program. Staff of the Office of the Medical Examiner will continue to operate from the Sheriff's Administration Building and existing morgue facility until interim office space is available at San Joaquin General Hospital and eventually the morgue replacement facility, which is projected to come online in mid-2022. The budgeted deficit in the mental health pharmacy was projected to be approximately $2.3 million and covered by the mental health fund balance. After the first quarter close, the projected deficit has increased to a full-year estimated deficit of over $3.6 million, primarily driven by continued deterioration in revenue. All aspects of pharmacy operations are being reviewed in an effort to improve customer service levels, maximize third-party reimbursement, reduce operational costs, and maintain fiscal sustainability. In mid-November, the California Department of Healthcare Services announced that the scheduled carve-in of the Medi-Cal pharmacy benefit to fee-for-service Medi-Cal would be delayed until April of 2021. It is anticipated that after this transition, Healthcare Services will bring to the board for consideration potential changes to the mental health pharmacy operations that could result in the discontinuance of certain current services. In Human Services, the HSA programs are projected to be below budget by $2.2 million. Projections are based on preliminary information, which is subject to change. Beginning July 1, 2020, the CAO assumed administration of the Community Services budget, which had been administered by HSA. At the end of 2019-20, HSA requested that 4 purchase orders be rolled over to 2021 in order to fulfill outstanding obligations using 2019-2020 appropriations. County policy dictates that any outstanding POs on September 30th be closed and the applicable appropriation be removed, unless a department requests approval from the County Administrator's Office that a PO remain open beyond September 30th. HSA did not request CAO approval to keep the encumbrance open. Therefore, the encumbrance was eliminated and the PO should have been closed. Unfortunately, the PO remained open and HSA processed 2 invoices in October after the encumbrance was eliminated, thus utilizing 2020-2021 appropriations. The 2021 budget does not include sufficient appropriations to cover the cost of expenditures that should have been paid with 2019-20 appropriations. The CAO is requesting that appropriations for the Community Services budget be increased by $39,779 with a contribution from the contingency provision budget. The overall Parks and Recreation budget expenditures for 2021 are projected to come in lower than budget by $248,652. The decrease primarily reflects salary and benefit savings and CARES Act reimbursement for expenditures attributed to the COVID-19 pandemic. The revenue, however, is projected to be $714,254 lower than budgeted revenues, primarily due to the aggressive public health response to the pandemic, which has resulted in parks facility closures and a decrease in special events, admission, rentals, camping, concession, and parking revenues. The projected negative impact to the net county cost is $465,602. General Services will continue to work with the County Administrator's Office to closely manage and monitor all expenditures, identify additional opportunities for improved efficiency and revenue generation. If necessary, the department will return to the board during the mid-year budget review to address any revenue shortfalls. The net county cost of the budget is funded by general purpose revenue. The County Administrator's Office has reviewed each of the general purpose revenue accounts, and it is projected that there will be an overall increase in revenue of approximately $10.3 million. This increase is primarily due to a $9.7 million correction in sales tax. In June 2020, the county was notified by the California Department of Tax and Fee Administration that local tax for orders shipped from the warehouse of Costco Wholesale Corporation should have been reported directly to San Joaquin County, but instead were reported to the county-wide pool in error. The $9.7 million represents the misallocation from the second quarter of 2015 through the first quarter of 2020. And will be paid in installments back to the county, with the last disbursement to be issued in May of 2021. Revenue from penalties on delinquent taxes are projected to increase approximately $0.7 million, and anticipated residual payments from former redevelopment agencies are projected to increase approximately $0.8 million. Offsetting the increase is a projected decrease of $2.1 million in interest income in the general fund due to a significant drop in overall interest earnings. Solid Waste Enterprise Fund projections include $353,208 for the multi-year Foothill Landfill gas flare project. The project was not completed by year-end 2019-20, and funds were not encumbered or rebudgeted in 2021. The department requests an appropriation transfer of $353,288 from professional services within the solid waste budget to capital expenditures for anticipated project costs for 2020-21. Based on unaudited financials for 2019-20, the Hospital Enterprise Fund is expected to close last fiscal year with a $24.5 million loss, reflecting 4 months of the COVID-19 pandemic's negative impact on volumes and net patient revenue, year-end actuarial pension and other post-employment benefit adjustments, and the recognition of $12.6 million in CARES Act funding to offset the COVID-19 related expenses through June 30th, 2020. The Hospital Enterprise Fund cash balance at fiscal year-end was $118.9 million. Based on revenue and expense estimates, San Joaquin General Hospital projects net loss at the end of the fiscal year to be approximately $200,000 or $2.6 million below the adjusted budget. On a cash basis, including costs of all budgeted capital expenditures, the hospital is expected to decrease the fund balance by $2.1 million, which is unfavorable to the budget by $2.7 million. Staff will continue to monitor revenue and expenditures closely. The hospital chief executive officer, Mr. David Culberson, will provide more details in a separate report following this presentation. As the CAO mentioned earlier, using a portion of Federal CARES Act funds received by the county, your board approved several programs to assist the community in mitigating the impact of the COVID-19 pandemic. This table provides the grant programs, the objective of the grants, and the total amount paid or obligated, which totals $19.2 million. This report also includes a preliminary forecast for next fiscal year. This chart depicts the county's general purpose revenue, including Prop 172 and realignment revenues for fiscal years 2013-14 through 2019-20, the budget estimate, as well as the year-end projection for 2021, and the preliminary forecast of 21-22. The overall GPR for 21-22 is projected at $445.3 million, which is an increase of $18.2 million from the current 2020-21 projection. Property taxes, which are the major source of the county's general purpose revenue, provide about 80% of the local discretionary fund. The assessed valuation for 21-22 is projected to increase by 5.25% or $13.7 million from the current 2020-21 projection. Revenue from sales tax, including Prop 172 for public safety departments and realignment funding for social services programs, are projected to increase by 1.4% or $2 million from the current 2021 projection. As of November 30th, 2020, 3 memorandums of understanding representing a total of 9.6% of the county labor force have expired. These bargaining units include the nurses, physicians and physicians management, and sheriff's management. The county is either negotiating or will be negotiating with these 3 bargaining units. Based on existing MOUs and current county negotiation proposals, salary and benefits costs are estimated to increase by $33.2 million, of which approximately $11.4 million is funded by the county's general purpose revenue. Additionally, the county's actuary is currently updating the self-funded health programs, and it is unknown at this time if premium adjustments will be required. On October 9, 2020, the Board of Retirement approved setting the retirement contribution rates for calendar year 2021. The 2020 composite rate for most existing employees increased from 47.46% to 49.82%. This represents a 2.36% increase in payroll costs and requires an additional $13.2 million in annual county contribution. Sufficient funds have been included in the 2021 budget to cover the increased costs of $6.6 million for the remainder of the current fiscal year. This table shows the adopted composite rate for calendar years 2013 through 2021, the annual county cost for retirement, and the funded ratio of the retirement system. During the 8-year period from 2013 to 2020, county costs for retirement increased by approximately 86%, from $112.1 million to $208.4 million. This table shows the general fund unreserved undesignated fund balance on July 1, 2020, and the projected fund balance on June 30th, 2021. On July 1, 2020, the available general fund unreserved undesignated fund balance was $69.6 million. At this time, the general fund year-end fund balance at June 30th, 2021 is projected to increase by $106.5 million. The sum of $96.2 million in net county cost savings and $2.3 million in additional general purpose revenue, bringing the projected total to $176.1 million in the general fund on June 30th, 2021. The large fund balance is due largely to the $94.2 million of one-time offset of general fund costs funded by federal and state CARES Act funds. In conformance with the board's reserve capital funding policies, as well as the board's express directive for a structurally balanced budget, a significant portion of the June 30th, 2021 fund balance may be programmed to support ongoing operating costs in the 21-22 recommended budget and future budget years. Still dealing with the effects of the COVID-19 pandemic and the expected economic downturn, the uncertainty of potential future general fund costs remain a major concern. Some uncertainties are identified on this slide. Although currently only 3 bargaining units remain without a contract, 3 more are set to expire in 2021, which include middle management, peace officers miscellaneous, and probation officers. The state provided realignment backfill funds for safety net services that counties administer on behalf of the state. An initial $750 million was provided to counties, of which the county's portion was $13.4 million, and $250 million was dependent upon the state receiving additional COVID-19 relief from the federal government. The state did not receive the additional $250 million, and therefore counties did not receive the additional allocation. Our county's portion would have been an additional $4.5 million. Possible recession impacts on property tax, sales tax realignment, Proposition 172 revenue, and vehicle license fee revenue. The hospital's financial performance remains a concern. Although the county provides an annual maintenance of effort amount of $2.1 million to the hospital, their ability to continue to fund net losses with available cash is diminishing and remains one of the county's largest risks of maintaining a structurally balanced budget. The closure of the State Department of Juvenile Justice, the DJJ, and youth prisons will shift the responsibility of all justice-involved youth to counties. County probation departments will need to expand placement and treatment options at the local and regional levels for this higher needs population. Counties will receive state funding to provide county-based custody, care, and supervision of youth who are realigned from DJJ, but funding will be allocated based on a funding formula developed by the state. It is unknown at this time whether state funding will be sufficient to provide services for these high-risk, justice-involved youth. The transfer is scheduled to take place on July 1, 2021. The county continues to be heavily burdened with total cost of salary and benefits when compared to its total budget. Salary and benefits costs for the county's 7,446.5 full-time and part-time positions in 2021 total $941.9 million, which is 49.3% of total budget. The analysis to comparable counties will be updated as part of the 21-22 budget process. There we go. And this concludes the staff report. It is recommended that the board receive and file the 2021 first quarter budget report, authorize the transfer of $39,779 from the contingency provision budget to cover the projected shortfall in the community services budget, transfer appropriations in the amount of $100,000 from salary and benefits to professional services in the human resources division budget, increase appropriations in the Air Park 599 budget in the amount of $17,811 for project-related costs, increase appropriations in the probation SB 678 budget in the amount of $163,023 and offsetting revenue from the SB 678 fund, transfer appropriations in the amount of $353,288 from professional services to capital expenditures in the solid waste budget for anticipated project costs for the Foothill Landfill gas flare project, adopt a resolution amending Department allocation listing, and transferring the Neighborhood Preservation Division budget from the Community Development Department to the Healthcare Services Agency effective December 21st, 2020, and approve appropriation and revenue adjustments in the County Administrator's Office budget and the Neighborhood Preservation Division budget, reflecting a net decrease of $95,147. And the County Administrator and I are available for any questions from the board.
Thank you. Have any questions for staff? Supervisor Elliott or Supervisor Patty?
Motion to accept and approve.
Supervisor Elliott? All right, well, we have a motion. Do we have a second?
Oh, second the motion.
Okay. Do we know, is Supervisor Elliott on the line? He is.
He's on the line.
Yes, sir.
Great. Supervisor Elliott, do you have any comments or questions before we move to a vote? We do have a motion and a second.
No questions.
Okay, then we'll have a roll call vote.
Supervisor Villa-Pudua?
Yes.
Supervisor Patty?
Yes.
Supervisor Nguyen?
Yes.
Supervisor Elliott?
Yes.
And Supervisor Miller?
Yes.
Okay, thank you.
Good afternoon, Mr. Culberson.
Good afternoon. Good afternoon, Chair Miller, members of the board. David Culberson, CEO at San Joaquin General Hospital, here to recommend that you accept the San Joaquin General Hospital 2020-2021 first quarter financial report. Just in summary, as you heard from Sandy earlier, Ms. Regalo, that based on revenue and expense estimates provided, San Joaquin General Hospital projects a net loss at the end of the fiscal year of approximately $200,000 or $2.6 million below the adjusted budget. On a cash basis, including all costs of budgeted capital expenditures, the hospital expects to decrease its fund balance by $2.1 million, which is unfavorable to budget by $2.7 million. To offset the expected shortfall, San Joaquin General Hospital will be reducing its non-essential capital expenditures and continue to implement process changes to improve revenue collection performances. Again, I prepared a PowerPoint here, basically outlining some of the important statistics here and other activities at the hospital, and I'll go ahead and present that here. As you can see here, this is our adjusted budget for the current year of net patient revenue. That's revenue we collect for providing patient care of $323 million, and also anticipating $84.6 million supplemental funding for a total operating revenue of almost $408 million. Our first quarter projections coming in lower than that, particularly on the net patient revenue side. You can see about $9.4 million less. One of the interesting things we're dealing with right now is, while census is up, not all of the patients that are in the hospital are paying. So Here we're reflecting somewhat of a deterioration of the payer process here. The volume is up, but the net reimbursement is down, and I'll explain some of that here a little bit further in my slides here. As outlined, you can see then the total operating expenses of about $410 million. Our projection are less than that, $403 million total. So that is actually a favorable adjustment of $6.8 million. So we can show, as mentioned to you, the net loss from operations of $2.2 million versus our projection of 4.8. In other words, we're on track to lose, as we mentioned earlier, $2.6 million more than anticipated. The net county general fund support here, the minimum maintenance of effort remains at $2.1 million. And we're anticipating at this point in the year no additional pickup of a realignment revenue. You may recall over the last couple of years we've had some pickups at the year end for the realignment, but at this point we have not received any reconciliation information from the state, and so our projection is exactly what our budget was. Let's see here, again, depreciation, because we really aren't spending a whole lot of significant capital, will not be increasing significantly from budget. And as such, we still are anticipating capital expenditures, at least in the budget side here. One of the things I'm working with my team is really assessing where we are in a number of projects that have plans to get started, but because of OSHPOD requirement, sometimes up to a year. Those projects may not be initiated this year, so I anticipate some capital expenditure savings here, but it's really too early in the fiscal year for us to say all of that 15.2 will be withheld. I anticipate some of it will be, and we're working particularly with Jake McCarty and Belva Snyder, our nursing and chief operating officers, to determine what really is essential. Again, mentioned then that the first quarter projection does show a decrease in the fund balance by $2.1 million, or 2.7 greater than what was budgeted for the current fiscal year. Here is an interesting trend, and it continues on here. Really the activities for the first 3 months, and really they continue on even to a greater extent here. Greater than budget, we had budgeted, you can see, just around 129 patients to be in-house. We're averaging 145. Last night we had 183. Really we're seeing tremendous, not just only COVID volume, but now everything else coming in here. I've got a few more updates here later on in the slide. Our clinic visits actually are back to exceeding our budget. About 60%, between 50 and 60% of these visits are virtual now. They're televisits. We do have as needed in-person visits, but we really are pushing the telehealth, and so that's been able to increase our volume back up to really pre-COVID volume. I think these numbers dropped down to around 11,000 a month during March, April, May, when we really put the brakes on in-person visits, and we didn't have the telehealth option fully rolled out, but it is now, and happy to report that we do have increased clinic visits. I think from what I'm hearing in the community, quite honestly, though, there is need for and from the physicians in the clinics, that there is need for more in-person. There's only so much we can get on your, particularly if you have a series of very complicated clinical history that we can only get from in-person visits, whether it's through hands-on evaluation or something just the body language that either you or your person who's accompanying you would be able to show some concern about something. And again, we're really trying to push more of those the best we can. Emergency department visits really have taken a decline here, and they really commenting nationwide. I think hospitals are down to somewhere between 60 and 75% of emergency department visits post-COVID outbreak, and that's reflective here. We did have continued to during the first quarter, and we continue on to limit surgeries to really only things that are necessary. And a lot of times it necessary is really a physician-patient decision. So you can see our volume is below our budget here. Deliveries have been slightly ahead. I will say we've had the last 2 weeks really almost at capacity in terms of deliveries. And I'm not sure exactly why that is. We are about 9 months into the pandemic, but we also know that we anticipate, as an industry, we anticipate really reduction of deliveries over the next couple of years. And then last adjusted occupied bed, just a overall combination of inpatient and outpatient activities shows that we're about 10% to 15% above our planned for the current year. And again, mostly that's going to come from the inpatient census. So I mentioned last night we had 183 patients in-house here. I think we had about 195 earlier this week, and maybe even at about 8 in the morning, I talked to Ms. Nino. I think that was last Friday or maybe Monday this week. We had 205. So clearly, all hands on deck at the hospital right now, and everybody's working the best they can to keep up with the volume. Let's see here. Here's just kind of a statistical summary here. The inpatient census was 13% greater. Clinic visits 8.5%, emergency department off by 11%, surgery off by 10%. It was, we mentioned there, slightly less than anticipated performance for the change in net assets. One of the things that's going on here, quite honestly, and I've done an awful lot of work with primarily with the internal medicine team. Our hospitalists basically taking care of about 75 of the patients in-house. We've got an increased census, partly attributed to a significant number of cases with long lengths of stays. I think I've told your board in healthcare, we really try to get you out of the hospital within 5 days. Modern medicine, modern techniques have shifted so much work to the outpatient basis. We have a lot of technology here that we can diagnose and treat faster, whether it's the robotic system for surgery, whether it's new approaches for orthopedics. But unfortunately, with some of the COVID and complications to patients who are non-COVID, we've seen a real spike in folks that are that are in the hospital greater than 10 days, and a also large number who are in more than 20 days. A lot of the more than 20 days are significant placement problems here, as I highlight. The acute hypoxic respiratory failure. You can think of these folks who are COPD, chronic obstructive pulmonary disease, that are potentially on ventilators, but they're certainly not stable, and so they're in the hospital on vents or on high-flow nasal cannulas for a long period of time. So again, those are difficult to discharge to long-term care facilities. Many of these folks are on tracheostomies and ventilators. They're hard to place. Really, home care is not an appropriate setting. We've also had some challenges returning these patients and a few other COVID positives to other CDCR healthcare facilities, whether it's the Stockton facility or whether it's Mule Creek and other places throughout Northern Complication. We do have COVID patients in the house as of today, 26 positive, 6 persons under investigation for a total of 32. 9 of those 26 are in the ICU. We have a total of 18 patients today in the ICU, and you may recall our licensed capacity is 16 beds overall. So we have one floor, which is 16 beds. We've been able to accommodate as many as 30 ICU patients by expanding into our telemetry floor, 2C, and also into the recovery room. We do have, associated primarily with the trauma program, a number of traumatic brain injury patients. We have had placement difficulties for 5150, 5250 behavioral health patients, whether it's waiting for a COVID negative status or other other medical issues, my diabetes, my just a number of other things that we're finding there just aren't enough medical beds for the behavioral health patients throughout the state. And then there is an increased number of conservatorship patients that we've had. We've worked closely with Michelle Pennington and her team, with Greg Niederich, but as you may be aware, the conservatorship courts have really limited access. We're working closely, but these are folks that are in the hospital for more than 90, and in some instances more than 120 days, waiting for a conservatorship. They're being taken care of. They're in good clinical shape. Many of them actually are ambulatory, but just aren't. But they are at the point that they are gravely disabled and not able to be on their own. So that's created a capacity issue for us. A number of the conservators patients, because they're not medically necessary to be in the hospital, will end up being essentially no pays for us, but we'll continue to work and do what we can to find sources for funding for all of these patients I mentioned here. As Ms. Regala pointed out here, the financial results for last year had a $24.5 million loss. Really, we had a dramatic drop of revenue for March through June. I can't recall the exact number per month, but I know when I talked to Chief Financial Officer Chris Roberts, I think it was we were seeing somewhere between a $1 and $2 million net revenue loss for those 2 months, or for those 3 or 4 months here. We also had a substantial year-end pension and other post-employment benefits adjustments that contributed to that loss. We're able to offset those losses with some CARES Act funding, about $12.6 million. And as mentioned, the cash balance at the end of the year was $118.9 million. Wanted to highlight really some important things that I think are going on with the trauma program. I mentioned the other day I was in the emergency department, knowing that we have a public health crisis. I think we all recognize with COVID-19, but I think we have a few others, and at least one that I think is very significant. Wanted to point out here that, again, the tier zeros, that's going to be the most significantly injured patients. Those are the ones that are penetrating injuries and a number of blunt trauma. You can see the substantial growth in the tier zeros. Same period last year we had 97. This year for the first 3 months 133. You can see the total trauma volume are up by over 100 cases, so that's almost, more than 10%. Again, it's something that I think we're seeing here. To give you a little bit more idea of what's really going on, though, I made this comparison for the major mechanisms of injury. The first 3 months of this year, 2020, and then the first 3 months of last year. So comparison, equal number of days per period here. 329 motor vehicle collisions, 360 this year. Substantial increase, again, it's around a 9 to 10% increase. I think the most important one, again, the second really public health message that I can share with you from the trauma program is in the gunshot wounds here. 46 last year, 83 this year. That's an 80% increase. And I know Chief Jones talked about earlier this week the number of homicides in the city. I think this is reflective of, again, another crisis we're having here as the only county, the only trauma center in the county. We can clearly see that that's a substantial increase. The other things are fairly stable, as you can see here. Again, I just wanted to share that with you. I think that's pretty important. We do see the number of falls. I guess that's the other thing that's increased from 239 to 299. What we're seeing, I think, quite honestly, is about 3 or 4 different causes of falls. A number of folks that are, and then these end up in the ICU many ways. They are neurosurgical cases, subdural hematomas that are requiring sometimes just observation, but many times they do require surgical intervention. People that have not ambulated a lot recently, they've been locked down. They're walking in gingerly and then trip and stumble. We are seeing a number of medical conditions that are causing also instability, confusion, and then a fall. And then nursing home, repeat folks that are having dementia issues that are falling and being brought to our facility. So again, those are the kind of things we're seeing from a clinical perspective that are leading to greater than expected inpatient census and also greater than expected length of stay. We continue to work on our Cerner system. We're almost 3 years post-go live here. A big project that's about a year into it now. We have put in most of the code changes. We've tested it. We're working on improving the charge processing rules and some of the data integrity improvements here, making sure that if a test is charged to a department, it goes to that department, let's say cardiology, and not to the ICU where the patient may be residing here. The rules are really the department that charges for it should be the department that performs it. So again, lab X-ray cardiology should go to the lab X-ray cardiology department and not necessarily the nursing unit. And that's a big project we've worked with Cerner on for over a year. The PeopleSoft, we continue to also work on optimization here, the item master and improving of the PAR inventory processes. Things that we didn't maximize, didn't optimize prior to go live that we're working on right now. Some of that is with Chris Cruz, Johnny Terry's team, and then also with our interim materials management director who started about 6 weeks ago and recognizes the importance of both of these items. Wanted to talk a little bit about where we are with our COVID project. I will say an awful lot of the hospital's activity over the last 9 to 10 months now has been on COVID. First getting ready for the surge, then handling the July surge, kind of catching our breath a little bit in August and September, and now certainly since Halloween, a continued growth as you saw earlier today that we really are mirroring the San Joaquin County trends. Again, in May, 1 positive, 4 persons under investigation. There were only 7 positives countywide. In July, the biggest surge that we had was 36 positives, 3 PUIs, 262 countywide. Again, we slowed down quite a bit here in October. The hospital's numbers were 1 positive, 4 PUI, countywide 28. November 30th, 18 positives, 4 PUIs, 143 countywide. And again, as I reported today, as Dan Birch and his team have let the information go, we have 26 positives, 6 PUIs, and I believe there's more than 211, maybe a little bit higher than that, countywide. So clearly we are just riding the crest with everybody else. I will say the team at the hospital has come together in an incredible way. We certainly are feeling 9 or 10 months of stress, but clearly the team continues to do what's required of us. Again, we really are trying to expand our activities. Here, I want to point out that we've expanded our ICU capacities to 38, again, 16 in the ICU, another 14 in our telemetry unit, and 8 in the in the post-anesthesia care unit. We've added additional ventilators, some rental. We're trying to buy some. We actually ordered 10 and they were damaged in transit, so we're expecting delivery of those 10 shortly. Technology here, high-flow nasal cannula, is something that we've learned is better in many instances to manage the COVID patient requiring substantial oxygen supplements, a much more less ventilator dependency and able to get you out of the hospital, we hope faster. We do monitor our PPE closely. We continue to have our drive-through testing of employees and the public in French Camp. We are actively managing our employees' exposures to our employee health services. I will say we have had an increase in employee illnesses and symptoms over the last 2 to 3 weeks, and we're monitoring that closely here. And then we have added the 2 of the mechanisms. These are there's actually 3 different treatments here. Remdesivir is the antiviral antibody treatment. And again, that's once you're inpatient, it does work for you. We also have the monoclonal antibodies. There's two treatments. One is bamlanivimab. That is the single dose, and then single combination of a single monoclonal antibody. And then we just added the other one, which is the combination of the two monoclonal antibodies. Both of those are available. We have 37 treatments of remdesivir available, 38 of the bamlanivimab, and we have 13 of the recently approved combination therapies. Both of those are the monoclonal antibodies. We're scheduling in our outpatient centers, and I think we've given 4 or 5 treatments now. Let's see here. We do have a substantial project. We're working closely with County Council, Auditor, Controller to separate the clinics from the hospital. This is really in line of some compliance issues. Recently changed HRSA rules here. The Healthcare Resources, Medicare, Medicaid Services have required that we separate the hospital, still keep it a county department, but we're working on that. And then revenue cycle assessment and improvement, planning on bringing to your board a contract next Tuesday for a substantial training, investment, really consulting project here, revenue cycle assessment and improvement consulting and team to help really work with us. A lot of this are fixing things that haven't been fixed yet since Cerner, and a lot of them are adopting of just really better practices that the industry has that we need to adopt. And that's really across all of the revenue cycle departments here, admitting, charge capture, utilization management, coding, billing, and collecting, really the entire revenue cycle. That concludes my presentations. I'm more than happy to answer any questions you may have.
Thank you, Mr. Culberson. Any questions from the board? Supervisor Wynn.
How's your staffing?
Supervisor Wynn through the chair. We have had, until the last couple of weeks, very adequate staffing. We've had our own staff have been working a lot of overtime. We have had our long-term registry as well as COVID registry in-house. So the travelers that have come and specifically for COVID, they stuck with us really through a lot of the summer and continue on with us. I will say right now, with some of the absences we're having, both nursing and respiratory therapy, we're beginning to fall a little short here and there, Supervisor, doing our best that we can. We do have a good number of the management staff are now doing other things and pulling as many of the folks that have clinical licenses and recent experience to put them into staffing. We have asked, I believe as of today, through the MOAC, we have asked Dan Birch and his team through the state, through the MOAC, for additional staff if it's available. We're concerned that this is a nationwide experience now, not a sporadic way it was last summer, last fall, so we aren't sure of the availability. That's where an awful lot of these discharges, if we can get them out, will be able to help us. But I will say the staff is holding up, but I got to say they're getting a little tired. Again, it is stressful. I noticed that the number of deaths that we've had at the hospitals creeped up slightly, and then the number of traumatic injuries we've had. You've seen in the newspaper here the number of shootings that have occurred just in the last 10 days have taken a toll on the team. So it's getting a little tight, Supervisor.
Your experience in your emergency department, there's always been talk in regards to individuals who show up, who are just showing up, maybe homeless, looking for a meal or warm bed or whatever. How are you reacting to those who come who probably don't need to be there, taking up your staff's time and possibly even a bed?
We're taking everybody, Supervisor, through the chair, we're taking everybody that comes in. We have to see them in accordance with federal law. My staff has worked in public hospitals. The young nurses that we're adding here, we're adding, I think, 36 new nurses over the next 60 days or so. Again, that's been able to help out the new nursing program we put in place really throughout all of 2020. Will continue on to 2021. I think that's helping our ability to handle the difficult patients. We have talked as recently as yesterday afternoon about creating a discharge area where we can take folks out of the emergency department that don't need to be there. They're medically cleared, but they are, they're homeless, they're cold, and finding a place somewhere in the hospital where we can hold them at least overnight. So we'd have to staff it with somebody, probably a LVN, but we'll create we've put every space that we can find in patient care areas, but we're going to find some more. And we think we got a couple of alternatives, a small lounge maybe that would hold 4 or 5 people that would keep them overnight warm, but not keep them in the emergency department bed where we really need them. We really need that bed for folks that are coming in through the paramedic system.
Thank you.
Thank you. Any questions, Supervisor Elliott?
No questions.
Supervisor Patty?
Thank you, Madam Chair. I'm fine.
Okay. Thank you. This was good information, and we appreciate it as always.
Thank you.
Madam Chair, can I just add a little bit? So as this board heard today, I want to thank you first and foremost for accepting the CAO's first quarter report. But as Ms. Regalo and Mr. Culberson stated, our hospital is anticipating another loss. Our enterprise fund that the hospital is part of course, has a cash balance of roughly $118 million. For a size of organization of Mr. Culberson's, the hospital, there should be some level of reasonable cash balance in there for those uncertainties. I would hate to ever see that, and he has some competent finance staff who will know what that threshold is. But for the last 3 years, the hospital has had a deficit, and they've absorbed those deficits. The county general fund has continued to been able to contribute roughly $2.1 million towards the maintenance of effort from the general fund to the enterprise fund. For 21-22, the general fund is projecting a larger fund balance. The hospital would definitely be a concern and risk for the budget, that contribution towards the hospital would probably have the risk of growing as a result of trying to maintain a reasonable cash balance in the enterprise fund. And so I wanted to make sure I stated that, because I think there's some real risk in taking the hospital enterprise fund down too low, and take that into consideration when the 21-22 budget is being considered before this board.
Okay, thank you. Yeah, we're gonna need to look at that and have that amount that we should not fall below, so that we can project forward what we're going to need. So thank you, Mr. Culberson. This is basically to just accept the report, correct?
Yes.
Okay, thank you. Before we move on from any budget, and along these same lines, we had talked a little bit earlier about the possibility of redirecting some of these, this unexpected fund balance, or the increase in the fund balance, to provide some immediate assistance within the county, specifically because a lot of other programs that people have been able to access earlier are no longer available. And so I don't know how the rest of the board feels, but I would like to see staff come back, whether it's sort of reinstituting our small business program with a more relaxed set of parameters now that we don't have to meet the Federal CARES Act requirements. And also, I'm not talking about inventing new programs, but are we able to perhaps reappropriate some dollars for that? We didn't have a huge number of takers initially, but I believe part of the reason why is we were quite specific. You couldn't submit claims for things that you got reimbursed for in any other way.
Correct. And it had to be on a cost reimbursement basis. So if somebody was extremely struggling, did not have the cash to pay it up front. So it was very much on a cost reimbursement.
Exactly. And we don't have those requirements now. So I would like to see staff come back to us with some very concrete, what we could do quickly, both for our small businesses and also we do have rental assistance programs already up and running within the county. What could we do to expand the reach of those programs to help more people? We have a whole lot of eviction moratoriums that are expiring. There is just, I believe, a real crisis headed our way that folks are not going to be able to pay either the rent for their business or their rent for their families. And so because we have this, I would like to see something very concrete that we could get up and running quickly, that people could access to give folks a little bit of help and a little bit of hope for the first part of the year.
Would the month of January, because more than likely staff won't be able to get this done for the 15th, which is our last December board meeting.
Well, I'd like to see it really as soon as possible because there's a whole lot of rent that's going to be due the first of the year that people are not going to be able to pay.
Okay. So you know what? We may reach out, be outside of the CAO's office, see what some of our other departments are doing within, especially the rent, and possibly taking over part of that small business piece just to balance out the workload. So
that would be my preference. Any other members of the board, or is everybody comfortable with that?
Agree.
Okay. Yeah, let's see what we can do and do it really quickly as soon as we can. Okay.
Thank you.
Thank you. Thank you, Mr. Culberson.
So I'd like to make a motion. I wanted to recommend acceptance of the report. I'm sorry. Yes.
I'd entertain a motion to accept.
Make a motion to accept.
Second.
We have a motion and a second. Roll call vote, please.
Supervisor Villapudua? Supervisor Patty?
Yes.
Supervisor Wynn?
Yes.
Supervisor Elliott?
Yes.
And Supervisor Miller?
Yes. Thank you, everyone. That's approved 5-0.
Thank you.
Thank you.
Okay, now we are going to move on to a presentation and approval of some recommendations for the Homeless Housing Assistance Prevention Program Round 1 Awards, also known as HAP. Cheshire, welcome.
Before you today is a recommendation to approve staff recommendations for the Homeless Housing Assistance and Prevention Program. I will be referring to this henceforth by its acronym HAP. There was a joint NOFA process that was developed by San Joaquin County, the City of Stockton, and the San Joaquin Continuum of Care, and which solicited applications from throughout San Joaquin County. It was frankly a challenging process to bring together the needs of all three of these organizations. But what we were able to accomplish was, for the first time in this county, applicants, local applicants, nonprofit organizations, and so forth, were able to apply in a single location for multiple sources of funds from multiple jurisdictions. I mean, it was an incredibly complex process, but what we came away with on the other side is, I think, exactly what we set out to get, which was multiple great applications and a ranking and scoring of those applications. 34 applications were received for a total of $38.9 million in funding requests on $12.4 million in available funding countywide. San Joaquin County's portion, we received $10.2 million in funding requests on $2.8 million in available funding. illustrating the demand for these funds far outstrips the available resources. The recommendations before you today are based on the rankings and the scoring of an ad hoc review committee, and also the stated priorities of this board around emergency shelter, and also feedback from a committee of the San Joaquin Continuum of Care. HAP was enacted by Assembly Bill 101 and was signed into law by Governor Newsom on July 31st, 2019. As I mentioned, total funds provided to our county, $12.4 million across the 3 jurisdictions, and you can see that San Joaquin County's portion of those funds was 23%. There were several requirements for the HAP program. Perhaps the key requirement was a demonstration of regional collaboration, and certainly the joint NOFA process was the primary way that we demonstrated our commitment to that regional collaboration. Additionally, no less than 8% of the funds are required to be used for homeless youth, and no more than 7% may be used for administrative purposes. This table was developed by our partners and friends at Home Base, who helped us, along with the City of Stockton and the Continuum of Care, to develop a strategic plan on homelessness. I won't get into too deep a detail. I know there's a lot of information here, but I did want to point the board to the column regarding percentage of funds. The way this table was developed was that throughout the process of creating the strategic plan, Home Base sought input from the general community through interviews, through listening sessions, and surveys. From that, they synthesized this table, which we were required to submit to the state as part of our application to give the state a rough estimate of what we might plan to do with the funds depending on eligible uses and projects applied for. And so, again, what you can see is that these percentages are very reflective of that community input, and that emergency shelter, the eligible use under new navigation centers and emergency shelters, was by far the greatest priority as stated by the community. Part of the application process required that applicants develop narratives and submit answers around how their project proposal aligned with this strategic plan. The strategic plan talks quite a bit about emergency shelter, and it suggests a measure of success of adding 200 new low barrier shelter beds by 2025. It also suggests that we expand low barrier shelter capacity either by adding new low barrier beds or by lowering barriers on existing beds in our system. It suggests a housing first approach and a housing focused program design. And what that means is that as folks enter our emergency shelter system, staff should be focused on exiting those folks into housing of some kind, whether that's transitional housing or permanent housing. The goal being to increase the speed at which folks move through our system, because the key aspect of any effective system of housing and services for the homeless is that throughput, that quick throughput. And of course, regional collaboration is a phrase that we are going to be hearing over and over again as we continue to implement these state funds around homelessness. An ad hoc review committee, which represented folks from the City of Stockton, the Continuum of Care Board of Directors, St. Mary's Dining Room, Salvation Army, Community Partnership for Families, and University of Pacific, reviewed and scored 34 total proposals, and that review was completed on October 8th. Additionally, at the request of this board, a committee of the San Joaquin Continuum of Care focused on issues of shelter, provided a written report on just the shelter-related projects that were submitted for HAP. And that report was submitted to me on October 19th. That full report is included in your board packets. I wanted to provide the board with a snapshot, so to speak. These are just the overall results for all projects: shelter, permanent supportive housing, street outreach, etc. And you can see these are just the top 10 projects, not all 34. I will note that the projects that are denoted with an asterisk are projects that are being recommended for funding today. All of those are in the top 10, top 9 as a matter of fact. The other thing I wanted to point out is you'll notice that there is, in most cases, very little difference between the scoring between projects. What that illustrates is really how difficult, how challenging it is to make these kinds of decisions, even through what I think we came away with as a pretty strong process of ranking these projects, considering the quality of those projects. So while that is going to continue to be the case as we continue to find great, good ways to implement these limited funds, I also want to point out that what this tells us is we have a strong project pipeline in this county. We have many organizations that are doing good work. And while other communities may suffer from, well, geez, if we had money, what would we do with it? That is quite the opposite of our problem here. What we have are, again, 34 good projects just through this process alone, and a really strong project pipeline so that when the call does come down and the resources are made available, we're ready to implement those quickly. And that is some good news. These are the results, again, just briefly, for just the projects that were submitted having to do with shelter. And so you can see 3 of those are being recommended for funding today. And you see there's a little bit of a greater scope of scoring. But again, just to kind of give the board a sense of the breadth of organizations that were reaching out and saying, we want to do something around emergency shelter specifically. So our recommendations today, there are 4 projects being recommended for funding. Stockton Shelter for the Homeless proposes a 3-level shipping container shelter, which will add 46 low-barrier beds and full-service day and night shelter with navigation center. The estimated completion is October 2021. Behavioral Health Services proposes a 16-bed low-barrier modular shelter for seriously mentally ill males in French Camp for an up to 6-month length of stay. Estimated completion October 2022. And the City of Tracy proposes a 30-bed low-barrier sprung structure shelter with case management and employment services with an estimated completion of winter 2021. Additionally, as I mentioned, because by statute we are required to spend no less than 8% of these funds on projects that serve homeless youth, we are recommending that Lutheran Social Services be funded for their proposal for a low-barrier rental assistance, housing placement, and supportive services program for up to 36 transition-age youth. This is an expansion of an existing program, so as soon as funds are provided, they will be implemented for this program. So again, in conclusion, before you today is a request to provide direction to staff regarding Round 1 awards and also accept staff recommendations for HAP funding for the top 3 scoring shelter projects and the 1 top scoring youth project. With that, I thank you for your time, and I'll be happy to answer any questions.
Thank you. Questions for Mr. Cheshire? Supervisor Elliott?
No questions. Move to approve.
Supervisor Patty?
Yes, I would agree. I make a motion, or I second the motion to approve. I do have a couple of quick questions for Adam before we do so. Mr. Cheshire, real quick, you mentioned there's 34 projects in the pipeline. Would you give me, do you have a rough ballpark figure on the total cost of those 34 projects and how many people that would serve, given the fact that we have like roughly, 1,500 homeless people on the streets any given night?
Yes. So as far as the total cost, that was across all 34 applications. The funding request we received, this is countywide, not just for San Joaquin County, $38,924,821. And again, that's on $12,430,906 in available funding for this program. As far as the total number of individuals that might be served across all 34 projects, I'm sorry I don't have that information at my fingertips. It would be several hundred individuals, probably quite a bit more than that. I would need to do the math on that one.
If you can get back to me on that. And then explain to me real quick, I know that there was, you mentioned county dollars, and there's 2 figures, and there's percentages and breakdowns and such. Now, it was a 12.4 million county, and then 2.8 million county. And so explain to me how we go from 12.4 to 2.8, and what we're actually, do we have more in reserves?
So forgive me, Supervisor, I realize that's confusing. Because I'm going back and forth talking about San Joaquin County as a region and then the county of San Joaquin as an agency. San Joaquin County as a region received $12.4 million in HAP in total. That was allocated to 3 jurisdictions within our region, which is the county of San Joaquin, City of Stockton, and San Joaquin Continuum of Care. San Joaquin County's specific HAP allocation, irrespective of the City of Stockton and the Continuum of Care, was $2.8 million, $2,871,309.
Supervisor Patty, we put in the event you have your screen in front of you, we put this PowerPoint slide, which gives you the detail and the breakout, and that totals the $12.4 million.
Thank you, ma'am.
Yep, I see it now. I got you. I know at one point, digressing for a moment, going back a couple of months now, at one point I had mentioned if we could get an audit of where the use of funds and what's been accomplished with not only the money that we're looking at right now through HAP, but where's the budget been in the past and what have we accomplished with the use of those funds? And I know at some point I was told, the board was told that yes, they'll come back and give us a report, but I'm yet to see that. But that's a separate subject than what it is right now, and I believe Supervisor Elliott made a motion to approve, so I would second it. But that was my couple quick questions I had.
Supervisor Patty, this is Monica. I would like to respond to that. Mr. Kwan, our Community Development Director, he sent a memo out within probably a week of that last request that was made here, and we could resend that to you. And it gave you an analysis of how the past money was spent and also what happened with that audit. So we could resend you that memo. It was probably done, I'd say, at least over 30 days ago.
Thank you, and I apologize if I missed it. As we all know, we get a myriad of emails, but I may have misidentified it and not caught that.
No problem. We'll resend it.
Thank you.
So, Mr. Cheshire, I have a question. On the shelter-related proposals, why was the decision made to fund the project at French Camp as opposed to the Stockton Self-Help Housing Project? Because from what I was trying to grab it quickly in terms of the scoring. It looked like the Stockton Self-Help scored higher. And so how was the decision made? If it's not based on scoring, what was the criteria?
So per the direction of this board from the meeting of July 21st, what staff is recommending today are projects that are going to be creating new beds of emergency shelter or otherwise serving shelter projects. The self-help housing project did score well. Frankly, I think it's an excellent project, just like a lot of the projects we got. It didn't serve shelter. So again, within the scope of what the board's direction was, this is the basis for the staff recommendations. Within that scope, what you are seeing are the top scoring projects.
Okay, well I'm a little confused because I thought the self-help project was also geared toward folks with mental illness and also co-occurring disorders, substance abuse, that sort of thing, and that it was basically for treatment and housing. So those people are not coming in from the streets?
No, I do not believe that is the case. The behavioral health program is taking people either from the streets or from referrals from shelters. I'd have to go back and review that particular proposal for these specific details, but my understanding is that it's taking referrals from a different source and not necessarily it's providing transitional housing as opposed to shelter.
Okay. All right. And so this project at French Camp, this won't be, I mean, it's up to 6 months. There will be no services delivered as well? This is strictly
certainly
shelter?
There'll be services. No, there'll be certainly services. Yes. Just like with, I believe, all of these projects discuss services provision in some way.
Okay. I guess I'm just a little, I'm not 100% certain what the difference is in the criteria. So maybe I will double back with Director Vartan and see what the differences are. Perhaps he can give me the explanation on the two programs. It just seems to me in most every other instance, expanding existing programs, it doesn't matter if the referrals are coming from shelters or directly from the streets. If they're pulling people from the shelters, that's freeing up shelter beds for other individuals. So in my mind, that doesn't really matter. If the goal is to expand capacity, shelter capacity, from my standpoint, we should be doing it in the most proven and cost-effective way possible. And so usually that's an already existing program as opposed to starting something from scratch. But perhaps there's elements to these two projects that I'm not aware of. I did not get it, though, from the staff report
I will note that in Zach Self-Help's application, in all the applications, they were asked to identify what their project type was. They identified their project type as permanent housing. So where that was occurring, of course, we have to take the word for our project partners. Folks that we're identifying as an emergency shelter navigation center, I mean, this is who you're seeing today. I mean, again, based on that.
Okay, I get it. And so my last question is going to be, so we did a joint NOFA, and I realized that that was more about demonstrating collaboration and providing the opportunity for our community-based organizations to work within one process, but to have access to 3 different pots of money, so to speak. Did the 3 entities align on many of their funding decisions, or did we not? And I guess my question would be, if we did not, did that cause some confusion with the community organizations who were applying?
It's a good question. So to date, the city of Stockton is the only jurisdiction that has actually made funding decisions. Having said that, San Joaquin County was actually slated to go first, but unfortunately I had some issues that caused a delay here, so I'm here before you today. Folks were aware of what the county's funding decisions were likely to be, and those are very reflected here today. The Continuum of Care has not made funding decisions yet. They will be discussing that at Thursday's meeting. How that goes is probably anybody's guess, but my understanding is that they're probably going to take a close look at how the scoring played out, and using a formula and a process that was very similar to what the city of Stockton did, which was to take that table that I showed you earlier, take those community priorities and sort of try to, again, to use a phrase that we've used before, kind of sprinkle the money around. The county has clearly, this board has clearly provided direction to focus on a particular project type, emergency shelter. It certainly did cause some confusion where it does appear as though the 3 jurisdictions are not necessarily aligning on funding decisions. Having said that, personally, I think it's been clear that funding decisions were going to be made individually by these individual jurisdictions. That was certainly part of our application to the state to make that clear. I know that the city of Stockton and the Continuum of Care wanted to retain that control. I know obviously the county did too. All 3 jurisdictions and anybody receiving HAP funds did have the option of providing those funds to a local jurisdiction. So in some cases, a county and a city might have provided those funds to their Continuum of Care and said, we're going to allow you folks to decide how these funds get spent and how they get regionally implemented. That didn't happen in this case, so it did create a little bit of a back and forth. But I think ultimately, because of the way the application was designed and because of the requirements around scoring, the criteria that reviewers were using, it was very much centered around the strategic plan. And so what came out of that scoring and what you see reflected in the rankings is very much reflected in the strategic plan.
Okay, thank you. So basically the Continuum of Care then has, because they're going third, they have the opportunity to look at where the money has been sprinkled and either make up some areas perhaps that they think should be funded at a higher level.
Or enhance areas that have already been funded. And, as a member of that board, I can tell you, I couldn't possibly predict which direction they're going to go. I think it's going to be a robust discussion come Thursday.
Right. Okay, great. Thank you.
Madam Chair, can I just, along with what you just, for some clarity, so for instance, I have the City of Stockton staff report here, which was very helpful. They had probably a list of 10 to 12 projects, but the benefit of all 3 of us doing this together, both the city of Stockton and based upon a positive outcome of today's board action, they allocated 2.3 to the Stockton Shelter for the Homeless, which is the same one that we're recommending today at $972,000. So that project alone is going to end up with about 3.1 million, 3.2 million for this project, and who knows where the COC ends up. But that's the beauty of this collaboration, and given not every box gets checked similarly, but look at, here's a big winner and a real opportunity for the community.
Right. No, I definitely believe there was tremendous value in this joint process. Even if there wasn't as much for the three jurisdictions, the three entities, there certainly were for the community organizations to be able to work through a single process and yet have access to, all three funding pots. That's a huge benefit. These are community-based organizations. The time to prepare these applications is a real burden on them. And to be able to only have to do it once instead of 3 times, that's a really huge savings for them. So I'm pleased with it. I was just mainly curious in terms of where we all landed in the process. So I'm going to look forward to some of the continuum meetings and hearing the feedback in terms of how everybody else felt the process went, where we might see some areas for improvement, that sort of thing. So I think it's a really good start, though. Thank you. Do we have any public comment?
We do, Madam Chair. I do have a public comment from Kay Roostaller of the Family Resource and Referral Center. And she writes, Family Resource and Referral Center's proposal received the highest score in this application process and requests that you honor the process that was established for funding these proposals. While San Joaquin Continuum of Care has a basic CES framework in place, they've determined with the administrative entity for San Joaquin Continuum of Care and the San Joaquin Continuum of Care Board of Directors that to improve effectiveness, resources need to be made available to enhance the capacity of the existing CES. CES committee members have expressed a desire to have 211 San Joaquin serve in this capacity as reflected in their meeting minutes. The need for this project is identified in the San Joaquin Continuum of Care strategic plan, where it states, quote, stakeholders in San Joaquin County have expressed the desire to have a robust coordinated entry system to better prioritize and serve those struggling with housing instability and homelessness, end quote. It specifically lists that a step to take to strengthen San Joaquin's CES is to centralize access points to administer the coordinated assessment tool, VISPDAT, incorporating 211 San Joaquin and existing community resource centers. 211 San Joaquin doesn't receive any funding from HUD or private public resources to address the San Joaquin County homeless population. This approach would be prioritized now because this $114,852 will fund work on this recommended strategic plan action item immediately. This funding also specifically names strengthening coordinated entry systems as an eligibility activity and provides a rare funding opportunity. Generally, HUD and other funders prioritize actual housing or shelter beds. It is very difficult to find private or public funds for system improvement work. Thank you for your consideration. And that concludes our public comments.
Thank you. Okay. Are there any other questions?
And Madam Chair, we do have a motion and a
We have a motion and a second, so I'm going to ask the clerk to take roll call, please.
Supervisor Villapudua?
Yes.
Supervisor Patty?
Yes.
Supervisor Nguyen?
Yes.
Supervisor Elliott?
Yes.
And Supervisor Miller?
Yes.
Thank you.
Thank you. Okay, we're going to move on to our final discussion item, which is a response to ethics charges. I am going to turn this to County Council.
Thank you. First, I'd like to apologize to the board for bringing this discussion. I know that some members of the board find these discussions uncomfortable. I thought long and hard about whether to bring this report. I know that I am not biased against Supervisor Patty, and I do not have an agenda against him. I also know that I have never lied to any board member, past or present. At the end of the day, I concluded that my duty to my client, the county, required that I submit this report. Because, as I stated in the board letter, the county needs to be able to trust that the information presented by council is neither biased nor false. Additionally, the public needs to trust that the information you are presented is supported by law and facts, and that when inaccurate information has been presented to the board, that steps will be taken to correct that information. During the November 3rd, 2020 meeting, Supervisor Patty alleged that I had a bias against him, had an agenda against him, and that I lied to Supervisor Miller. During the meeting of November 3rd, 2020, Supervisor Patty referenced the agendas for the Board of Supervisors meetings of April 23rd, 2019, and the agenda for the Board of Supervisors meeting of November 3rd, 2020, as support for his claim that I was biased. He believed, apparently, that the agenda showed bias because the board letter title, and thus the agenda title for April 23rd, when the board considered whether his conduct violated the Code of Ethics, read BOS - discuss violation of Code of Ethics. By comparison, the board letter title and agenda title for November 3rd, 2020, when the Board of Supervisors discussed whether Supervisor Wynn's conduct violated the Code of Ethics, read CC - discussion of alleged violation of Board of Supervisors Code of Ethics. The distinction is that County Council did not draft the board letter or agenda title for the April 23rd, 2019 meeting. That board letter originated in the Board of Supervisors and hence the abbreviation BOS, and was prepared by Supervisor Wynn, a fact acknowledged by Supervisor Wynn at the November 3rd, 2020 meeting. As to the claim that I lied to Supervisor Miller, informing her that Supervisor Patty had alleged that she violated the Code of Ethics on 2 occasions, the board letter and attachments substantiate that Supervisor Patty claimed that Supervisor Miller violated the Code of Ethics by disclosing information from closed session, and that he withdrew that complaint after a preliminary investigation was conducted and he was provided with the results. They also substantiate that Supervisor Patty claimed that Supervisor Miller violated the Code of Ethics by using the term slush fund when describing his proposal. This matter was investigated by an outside investigator. The report was presented to the board and no action was taken. This concludes my report.
Thank you. Are there any questions for County Council?
I have a question for County Council since the subject was brought up as we're wrapping up the year. When County Council went and discussed with the Stockton record reporter and came to the conclusion that I had violated the ethics code, what prompted that phone call to the Stockton record reporter, Roger?
Well, let me clarify. I never concluded that you violated the Code of Ethics, Supervisor Patty. But what prompted that phone call was the published report in the record and a request from supervisors about whether or not whether or not those comments violated either the discussions in closed session or the Code of Ethics.
Okay, so I had an interview with a newspaper reporter, and you followed up on a complaint, or you followed up on your own to investigate that discussion with the newspaper reporter?
I followed up because it was requested that I do so.
It was requested by whom?
I believe that it was requested by Supervisors Wynn and Supervisor Miller.
Got it. Understood. And you didn't bother to interview me before you came to your conclusion, did you?
No, because I was referring to the comments that were made in the record and as published by the record, and that was the basis because it was the impact of those statements, both as represented and as potentially understood by the public.
Well, in one of those statements, you later did interview me and you retracted the alleged violation. Wouldn't that be correct?
I believe that, and if you'll give me just 1 second,
There was the ambidextrous, I'm sorry, what was the term you used?
Ambiguous?
Ambiguous, that was it. You said it was ambiguous. It could mean one way or the other, and you took it as the worst way, meaning it would have been an ethics code violation. And my point being, though, County Counsel, Mr. Miles, is that it seems as though there was a different standard. While you were willing to open up and have an outside party interview Supervisor Miller and any other party as it relates to the slush fund and the derogatory, demeaning term as used to identify me and my proposal, it seems as though a luxury was given to Supervisor Miller separate from what was given to me. Would you agree?
No, Supervisor Patty. What I would say to that is that that it's been a learning process. That through you were the first instance where an issue was raised. Well, no, I take that back. You were the second instance where a issue was raised with the Code of Ethics. The first one came up. It was brought up by Supervisor Elliott, and I looked into it and I provided a report back to the board. I applied that same methodology. When yours came up, I looked into it. I provided a report back to the board. But because of the negative repercussions that arose from that interaction, I have modified how I approach these matters. And when I believe that it's appropriate to bring in an outside counsel to look into it, I do so.
Understand. Well, that learning process, unfortunately, is slanderous to my name, my reputation. In fact, Supervisor Wynn's son worked for an opponent of mine that used that and twisted and just totally distorted and misrepresented so that there was these ethics charges and all these ethics violations against me when it is not factual. And it's not even a violation until it's voted on by the board, as said by you. I had asked you a couple of meetings ago, who determines an ethics code violation, and you had said, quote unquote, the Board of Supervisors. So the conclusion that you had in your report, having not even interviewed me, was able to be used in a political campaign against me, which was used to slander me in public, in the newspaper, in our public forum, and to impugn my name and my reputation unjustifiably so. So for this learning process that you're going through as our county council, I find it offensive that you're learning at my expense.
Well, I apologize for that, Supervisor Patty.
Well, here we are 3 years later and you finally give an apology. Shame on you for that. That should have been the first words out of your mouth when this issue was brought up. You should have said, Supervisor Patty, I made a mistake. I should have given the courtesy and had a conversation with you, and I apologize for that. Instead, that mistake led to Supervisor Wynn's son using a smear campaign against me and the newspaper and everybody else reporting it. How absolutely terrible, as a newly elected representative, for me to have my county council, the one that's supposed to protect us and look out for us, instead sharpen the knives and come after me.
Supervisor, I don't sharpen knives and come after anybody. I am not the county counsel for any member of this board. I am the county counsel for my client is the county as it acts through the Board of Supervisors. I advise the board. I don't tell the board what they can do or cannot do. I advise them of risks that are associated with the actions that they desire to take.
Understood. And I have a freedom of speech. I have an obligation to represent and speak out as I do to those that I represent. And that was one of the contentions and issues of the alleged ethics code violation, which ultimately wasn't deemed an ethics code violation by this board. So let's not to belabor it, not to bemoan it, not to drag it out. I accept your apology at this moment, but I find the actions offensive by this board, by some of the members of the board that came after me politically to get some sort of political gain, and look at the damage it caused for the last several years. Look at the hardship, the difficulty, and the acrimony it caused between us. Supervisor Miller and Supervisor Wynn, are you proud and happy that you came after me and you advised our county council to do an investigation on my giving an opinion to a newspaper reporter? In my opinion, shame on both of you.
I have to say, this is an almost unbelievable amount of complete denial of what happened and a failure to accept even the smallest amount of responsibility. What the original problem was coming out of closed session was that you did not like a vote that was taken in closed session, and you marched out of that session and you initiated a call to a reporter to vent on behalf of an individual that you wanted outside of a recruitment process that the full board had, a majority of the board had voted to undertake. It was for an individual, I might add, that was not participating in the recruitment, that had chosen not to. And because of your comments to the paper, it threw the recruitment into jeopardy because potential recruits could justifiably believe that it was going to be a political decision. It was not going to be a legitimate recruitment. That's what the discussion centered on. And while the vote went to not censure you, the discussion that occurred that day, a majority of the board did discuss the fact that your behavior was unprofessional and that it could indeed jeopardize the board's recruitment. And the concern was that it would jeopardize future recruitments. And so I think if there was any characterization that came out of that, any political fallout, I think you have yourself to blame for that, for initiating the contact with the media when you were not authorized to speak on behalf of the board. And in fact, you were making statements that a majority of the board did not endorse and had not voted to pursue. So the fact that now today, after you spent the better part of last year concocting ethics violations against me for a purely political reason because you were supporting my opponent, and you are now demanding an apology from me and from Supervisor Wynn, I am just absolutely flabbergasted. I have not seen this kind of just bald-faced nerve in many, many years. And all I'm going to say is County Council did not lie to me when he said that you had indeed brought 2 ethics charges against me last year. In fact, you spent the better part of last year making sure that he would continue to pursue both of them. And so he did not lie to me, and he did not bring the first agenda item forward. He did not have an axe to grind with you. His report, it was exactly like the report he brought forward with Supervisor Elliott's charge. It laid out the facts. It analyzed from a legal perspective the charge and whether or not that would rise to the level of a violation, potentially, of the code. And then he brought the reports forward to the board for deliberation. In every instance so far, the board has not voted to take action. So what we are here today to do is really to make sure the public understands that our legal counsel and our entire department, our legal department, is not playing politics, and they are providing guidance to this board from a legal standpoint to make sure that they protect and help us protect the county as a whole, as an organization, not any one supervisor. Supervisor Wynn, do you have any comments?
Thank you, Madam Chair. Well, I would agree with Supervisor Miller, and from the standpoint of contacting County Council in regards to your comments in the Stockton record, it was simply a question as to whether or not your comments did violate the closed session discussion. And it wasn't an accusation, it was just a question of which Mr. Miles, as part of County Council, asked County Council, looked into it, and that was all that was requested. When he did look into it, he did provide the board with what he had found. And I think that the problem is that, you know, in looking over this particular agenda item and looking at the documents that County Council has provided, I'm just absolutely appalled at your behavior, not only for the last 4 years, but certainly in regards to these allegations against Supervisor Miller. And I know you think that we're picking on you, but, you know, frankly, there's a lot of things over the past 4 years that I could have raised in regards to your conduct and your integrity that I didn't, in deference to you as a fellow board member. In regards to my son, he has a job and he does it to the best of his ability in regards to his particular candidates. But I could also raise the issue that in my last reelection campaign, you tried to assist my opponent in regards to getting her a better position as far as the election itself. I don't care. It doesn't matter. That's fine. And that's being done all the time by various supervisors and city council members, et cetera. So it doesn't bother me. It just happens. But also, I've also been concerned in regards to, you know, your comments over the years in regards to throwing your rest of the board under the bus and talking about us being a do-nothing board. And especially even about 2 weeks ago in regards to a conference call with Valley supervisors, telling them how great you were in regards to your homeless proposal and how other supervisors, including obviously myself and Supervisor Miller and maybe Supervisor Elliott, but anyway, basically saying that, you know, we were not supportive, like we somehow were stupid to not support your grand plan, which everybody just fawned over, to your own pleasure and certainly recognition, which unfortunately seems to be the focus of your persona. The other part of this is in reading one of the memorandums prepared by County Council Miles, in regards to an allegation about comments that supposedly were made in a conversation with a IHSS individual. You said that in your conversation, at least what this was said by the person that you told Council Miles had supposedly, Supervisor Miller had made these uncharacteristic comments. You had talked about in regards to the rest of us in these sessions in regards to our support or lack of support. And I guess my concern is that when we talk in closed session, it's important that we keep those comments to ourselves, and I really am concerned as to how much you divulge out of these closed sessions. Not make an allegation, but certainly it seems that somehow when you have conversations, you create discussions that didn't even exist. And so the concern I have in regards to this particular memo is that when you talk about your supposed discussion and how us as a board, for example, and I'll read this memo directly, in this conversation, right now, he said, she said that he told her, you, Supervisor Patty, told her the reason why he did not think they would get a contract, IHSS, they were looking for included that there were a number of other bargaining units at the table right now, Nurses, deputy sheriffs, and IHS wasn't a priority. That never happened. He also said he said nothing against the union, that the other supervisors did not support them getting a raise. He told her that Supervisor Miller was not supportive. She said that she told Supervisor Patty that she spoke with Supervisor Miller, and based on her comments, she felt the supervisor was supportive. He told her, that was not accurate. She said that you added another reason they would not get the contract they were looking for is this program wants to pay people to take care of their children who weren't born here. She said she wasn't sure if he was referring you to people who weren't born here or the children not being born here. Where did that come from? That was not even remotely discussed in any meetings that we had in regards to IHSS. So my question, Supervisor Patty, being indignant in regards to supposedly bias or prejudice by county council and certainly by myself and Supervisor Miller, the question is, where do you get these ideas? They just come out of thin air, and then you purport them to criticize your fellow supervisors. There are 5 of us here, and it takes 3 to get anything done. But certainly you have never been, in my opinion, a team player, because you want to make the biggest splash possible for yourself, and you don't care, for example, when you make these comments at board meetings from the dais to departments saying, well, whatever you want, we'll get it for you. Do you understand, have you ever worked in a job where somebody cut your legs out from under you, somebody who actually had worked very hard to supervise another individual or department, and then have somebody of higher authority come in and say, don't worry about them, we'll take care of you. I can't even imagine how our department heads feel when you keep offering to give them everything they want, when we all know or should know that not only do the department heads work very hard to work with our staff and certainly our CAO to make sure that what we do is appropriate, certainly that we can afford it, and it's the best thing to do under the circumstances. So again, you're asking Supervisor Miller or myself or County Council to apologize for you when you are probably the most unethical, lacking integrity of an individual in the 18 years I've been in office that I've ever been around. So put that in your ethics complaint against me. And by the way, if you want to talk about ethics complaints, we'll pull it up, and let's see, you violated 1E, 3E, 3F, 4A, 4C, 4E, 5A. Those are all violations you've just committed today, and you did on November 3rd, and you've done it repeatedly. And Supervisor Patty, your incident in regard to, supposedly protecting this woman, you came out with 3 different versions of what occurred, of which we have no idea which one was true, if at all. And secondly, maybe I missed it, but I haven't heard anything in regards to your arrest and whether that was dismissed or you pled or whatever, there was a trial. But my point is, there's a lot of things that you've done that unfortunately have I think, tarnished the image and the integrity of this board. And frankly, if anybody owes anybody an apology, you an apology to this county, and certainly not only to this board, but certainly to our staff in regards to your behavior, where you arrogantly bully individuals in regards to the questioning. So I will leave it at that. But again, I don't think that County Council Miles deserves you an apology whatsoever. If anybody deserves an apology, it's the rest of us in regard to your behavior for the last 4 years. So with that, thank you, Madam Chair.
Thank you. Supervisor Patty, I want to bring this back to what we were here to discuss today. On the 3rd, you
if I have an opportunity to respond in kind.
Yeah, just 1 second. On the 3rd, you said when we were discussing the fact that when you challenged County Council, you said if he had told me that you brought 2 ethics complaints against me in 2019, that was 100% an outright lie, and that if there was documentation to prove that wrong, you would be more than happy to apologize for making that statement and calling him a liar. So what I'd like to give you an opportunity to respond, and I'd like to ask you if you're willing to issue that apology now.
Certainly, Madam Chair. Yes, absolutely. I do owe an apology to County Council. My memory is very short. I forgot about the union representative telling me the lies that you told them about me. So I did forget about that one, and that was something that County Council did look into, but that union representative kind of got cold feet, didn't want to come out in public, but they did state those exact statements, which were blatant lies by you, Madam Chair, witnessed by myself and Supervisor Villapudua. Now, you and Supervisor Wynn and Supervisor Wynn, congratulations on dragging up as much possible. Do you really want to revisit my defending a girl getting beat up on the street and my getting my face busted doing that? Do you really want to revisit all these things? I'm not sure in all of your arrogance how many more things you want to try to lop on to try to make me look bad. And have I learned in the past? Absolutely. Have we all made mistakes? Absolutely. We all admitted that we can make mistakes and we can do better. But I will note, if we want to get back to the issue of what we're talking about, I will note, and it is factual, that when you, Madam Chair, when you stated I was proposing a slush fund, that's a blatant lie and therefore an ethics charge violation. When you stated I was trying to, and when you take photographs in a county building, that is an ethics code violation. Now, it may not be an ethics code violation by some interpretations, but it's in our ethics code. Now, as you know, we've discussed our ethics code, and we did look at it as a weapon, as noted by Supervisor Elliott, and I had also made a motion that we should strike and replace our ethics code, but none of you wanted to do that. You wanted to keep the ethics code as it was. So if it's good for you to slander and attack me, then surely it must be okay for the same to happen to you, especially when you blatantly lie, Madam Chair, and say things like, I'm proposing a slush fund, which was not even close to anything I proposed. Now, we can just go over and rehash all these many things, and we can, I can address the many things that Supervisor Wynn just tried to bring up and try to, impugn and make me look bad. Listen, as I said, have I made mistakes? Absolutely. Have I learned in the process? Have I worked to be the best representative and to be a better representative again and again? Absolutely. But let's go back to that very first ethics charge violation that Supervisor Miller and Supervisor Wynn proposed. I did not reveal anything from closed session. I spoke to a reporter and gave my opinion, and that's my First Amendment right. And we've already had a hearing and discussion about that. So I don't know if you want to redo that again. You can go back and replay it because it already ended and resulted in my not getting an ethics charge violation lobbied against me. So if you want to just keep going on and on and on about the same old thing, the reality is I did not reveal anything from a closed session. I did not say anything that incriminates myself or anybody else from the board. I have been respectful of your space and your place in privacy or what you say behind in closed session or what you say in public. So, to me, I accept the apology that County Council gave. I give my apology to them because I did forget about the mischaracterization that Supervisor Miller gave to that union representative. So I did forget about that second one, and I apologize for that. So we'll call water under the bridge at this point. I accept your apology, County Council, and I apologize to you for forgetting that second time that Supervisor Miller lied and misrepresented about me.
And once again, you're stating publicly that I'm lying about you. I have not lied about you. My statement in characterizing your proposal as a slush fund was made publicly. And there's at least 8 different dictionaries that will define a slush fund, especially for political purposes, as an amount of money that is under the control and able to be spent with little or no oversight by a political figure. That's essentially what you were proposing for a district fund. Now, you might not like the characterization, but a vast majority of people, when given your proposal, would have described it as a slush fund. But my point is, I did not do it behind your back. I said it publicly, and I stand by that. I have not called you. I do not sit up here and call you a liar. That's part of the issue here. On the one hand, you say, oh, well, I've learned from things. And then in the next hand, you say, oh, and by the way, Chair, you're lying about me again. I mean, it would be very nice and very helpful to not have to have these conversations. Nobody else has attempted to weaponize the code of ethics other than you. And it would be very nice if we could simply conduct these meetings in a professional way. I know Supervisor Villaputa was cringing because this makes him very uncomfortable. I think it makes everybody uncomfortable. So I was actually prepared to simply have County Council give his report and move on. And so unless there are any other last comments, I would recommend that we do that now and we move to closed session.
Supervisor Miller, we do have a public comment.
All right.
Submitted by Barbara Berrigan-Perea, who writes, I am writing to register the support of two organizations that I represent in regard to the work and conduct of County Council Mark Miles. First, in my role as Executive Director for Restore the Delta, I have observed that Mr. Miles represents the interest of the county and its people in a professional and thorough manner. He has been a champion of the area's water protection needs and works well with other entities. As co-coordinator for San Joaquin County Together, I have noted time and time again that Mr. Miles' reasoning, reports, and conduct are grounded in truth, facts, and a deep respect for the rule of law. San Joaquin County is fortunate to have Mr. Miles as their county council and should treat him with the respect and honor that he has earned. Sincerely, Barbara Berrigan-Perea. That concludes public comments.
Thank you. So I'm looking here, and I believe this is just to receive this report, and no action is required, correct?
No action is required.
Okay. Then if there is nothing else, Supervisor Elliott, do you have anything to add, or are you comfortable moving on to closed session?
I'm comfortable moving on to closed session. However, I do have a request here that would come under the Board of Supervisors comments section. Hello?
Yes, we can hear you. Go ahead.
Okay. So for some time now, there's been an effort underway by a third party to gather input to review and revise the ethics policy that we now have and amend it as appropriate. So I would request that we agendize that effort, that ethics policy review and amendment for next week's meeting.
Okay, it was my understanding that was going to come to us in January after the new board is seated. We'll have a full board of supervisors who will be operating under the code. County Council, am I incorrect?
No, you're correct that it was one of Supervisor Elliott's frequent criticisms of the Code of Ethics that sufficient time wasn't given to him or other board members to participate in the creation of it or the review of it before it was adopted. We began this current process for the review, I want to say in October. Shalene Bennett, an attorney, it may have been actually September, October timeframe. Shalene Bennett, an attorney at Liebert Cassidy, has met with all of the supervisors. It got down to after November 3rd, it wasn't clear what the composition of the board was going to be here in December. And at that point, with the possibility of having two open seats, or at least not having a complete board, and with Supervisor Elliott's concern about having full participation, that I made a recommendation to, and a decision to push it over until January, so that all of the new members of the board would be able to participate in having their comments, their input into the process, and be able to participate throughout. Supervisor Elliott did speak with me the end of last week, I think it was, about whether or not this was going to come back in December. And I told him that if it was the pleasure of the board to bring it back at the next meeting, that I would work with Shalene Bennett to bring back. I know that she's working on it in two separate parts. Part that should become part of a new document, and part that is a revision of the existing code of ethics. But if it's the direction of the board to bring something back next week, I will carry that forward.
I would. All right, my preference would be to do it.
Right. Okay. Supervisor Wynn?
I understand that, but I think one of the things that I think is important, actually was raised by Supervisor Elliott way back when, is that Supervisor-elect Rickman should have some say in this.
Yeah, I agree.
He's obviously going to be dealing with it for 4 years. On the other side of it, I would also say that whatever Supervisor Elliott has provided should be included in that discussion, because of obviously his experience as to how we want to proceed from January, February on out. So that would be my.
Supervisor Wynn, makes perfect sense.
Supervisor Patty?
Yeah, I'm good with if we want to have a discussion, but I think moving forward into early January, this should be agendized, and hopefully we have something that's actionable.
I feel the same way. I think January is better, and I want to make sure that Supervisor-elect Rickman has an opportunity to meet with Shalene and provide his input as well. So we want to make sure that he gets a copy of the code, he gets any background information, maybe comes in for a briefing with you or one of your staff people, so that he can have some context when he meets with Shalene, so that we have his input as well.
We have an orientation meeting with Supervisor-elect Rickman for later this week, and I will have that discussion with him then.
Good. Okay. I think that's a good plan. We'll do that.
Okay, just my last comment on this. I had let it be known months ago that my goal was to get this amendment done before the holidays. And of course, we were already into the holidays, so I called County Council Miles to see what's the status on this thing. When are we going to do it? And was told that, well, the decision had been made to wait until January. So it does make sense what people are saying, that yes, we should get input from all members of the board. I just wish that there had been that same consideration given when we first introduced this ethics policy, when I suggested that we didn't need to do it that day. We had time to go and get input from all members of the board, and I was voted down on that. So that'll be my final comment. And I would appreciate it if you at least consider the comments that I made, the comments that I provided to the third party.
Certainly, those will be included.
Great. Thank you. Are there any other reports or final comments from supervisors?
Madam Chair, I have a quick one.
Yes.
You had mentioned, I think it was a great idea to bring back to the board as quickly as possible an actionable item to help relieve some of the, utilize some funding we may find available in our budget. And at our last board meeting, I had mentioned the RAD, R-A-D program in Stanislaus, and I know that John Solis has taken a bit of a dive into this and gave me a little bit of a report. So I would ask that our CAO follow up with John Solis and his office and see what they might be able to utilize by way of this software that apparently was created for a funding allocation for local restaurants and businesses in what started off in downtown Modesto, but then expanded throughout the county of Stanislaus. So I think that would be included and a great option for us to review moving forward and trying to help the public here.
Supervisor Patty, we'll make sure that we bring that also next Tuesday and have the department present it.
Thank you.
Thank you. Okay, we are going to go to closed session, and I'd like to ask County Council to announce that, please.
The board will meet in closed session on the items listed on the agenda. There may be an announcement coming out of closed session.
Okay, thank you. We're back. I'd like to ask County Council to report out a closed session, please.
In closed session, the board authorized council to pursue the permanent restraining order in the matter of County versus Cook.
Great.
A unanimous basis.
Thank you. We are adjourned until next week on December 15th, 9 a.m. Chambers. Thank you, everyone.